Check. Microphone testing 1 2 3. Microphone testing 1 2 3. Hello. 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 Testing 1 2 3. Hello. Change or ಮಾಡ್ತೀನಿ.
Can you put your hands together? Dr. Press. Dr. Press. Dr. Bane. One more chair, huh? No. Suresh, one more. Suresh, one more chair. Let's start. On behalf of Price Monitoring and Resource Unit PMRU, set up under NPPA, Drugs Control Department, Karnataka, a very good evening to all. We are delighted and honored to extend a very warm welcome with great joy and immense exultation to all the dignitaries and the audience gathered here in this auditorium, and thousands of people attending this program virtually on this auspicious day. Access is defined as having medicines continuously available and affordable at public or private health facilities or medicine outlets within the reach. We need to create this access in making the essential medicines available and affordable to all of us. And today's session is all about this, which is titled PARICHARCHA on Affordability and Availability of Essential Drugs. This is organized by the PMRU Society, Drugs Control Department, Karnataka, as a part of ongoing celebrations on Azadi Ka Amrit Mahotsav. The topic of today's session is affordability and availability of essential drugs. To speak on the topic, we have resource persons who are holding key positions in various government and private organizations. They are going to enlighten us with the needful information. Before the launch of this inaugural session, let me first acknowledge the presence of our respected Principal Secretary, Health and Family Welfare Department, Shri T.K. Anil Kumar, IAS, sir, who is attending online and will be sharing his thoughts in a short while from now. Welcome, sir. Today we have with us our respected Shri B.T. Kanapuri, sir, Drugs Controller, respected Shri Amrish Tumbagi, sir, Additional Drugs Controller, eminent personalities and resource persons from their respective fields, Shri Y.G. Muralidharan, Shri Harish Jain, Shri Ajay Reddy, Shri Gangadhar Yavgal, Shri Mahesh, Dr. Prasanna, Dr. Salahuddin, Shri Somshekar, Shri Amrish Tumbagi, Shri Sunil Chiplankar. I am Bhaskaran, Deputy Drugs Controller, Regional Office, Bangalore. To start this program, I request our Drugs Controller, Shri B.T. Kanapure, sir, to give the welcome address. Sir, please.
ಎಲ್ರಿಗೂ ನಮಸ್ಕಾರ. Good afternoon to one and all. Honorable Principal Secretary, Health and Family Welfare, Government of Karnataka, Sri T.K. Anil Kumar sir, distinguished speakers of today's symposium, my dear fellow colleagues and participants from the various sectors and pharma industry sectors, pharmacists and doctors and consumers, and dear ladies and gentlemen, and my fellow pharmacists who are present here now. It gives immense pleasure to welcome you all for this meaningful and constructive event on the occasion of 75th Azadi Ka Amrit Mahotsav, organized by Karnataka PMRU Society, Drugs Control Department, Karnataka. That is PARICHARCHA on affordability and availability of essential drugs. Health is the foundation of individuals and families to flourish, communities to prosper, and nations to thrive. That's why it is fundamental human right. So medicines have become very important and powerful now more than ever, improving the health and status of the population. As you all know, pharmaceutical industry is knowledge and based and dynamic industry. With the announcement of NPPA, that is 2012, and the DPCO 2013, that is the Drug Price Control Order 2013, there has been shift regulation of prices from economic and the cost-based criteria to essentiality and market-based criteria, while entertain enormous tasks on creating and maintaining the data base and strengthening with the existing monitoring and enforcing system of NPPA in making the essential drugs affordable and available. Hence, a price monitoring resource unit has been set up in Karnataka under the aegis of NPPA, National Pharmaceutical Pricing Authority, Department of Pharmaceuticals and Chemical and Fertilizers, Government of Karnataka, Government of India, and PMRU and Drugs Control Department has organized this PARICHARCHA on affordability and availability of essential drugs, which is need to the hour. We got tremendous support from our beloved Honorable Principal Secretary Sri T.K. Anil Kumar sir to disseminate the aims and objectives of NPPA to the root level. We indeed happy to have our Honorable Secretary, Principal Secretary, Health and Family Welfare, Government of Karnataka, Sri T.K. Anil Kumar sir today, and we are grateful to him for accepting our invitation in spite of busy schedule, and he joined on virtually as the chief guest to inaugurate today's event on behalf of Karnataka PMRU Society, NPPA, Government of India, and extend hearty welcome you sir, once again sir. And we have our additional drugs controller Sri Amrish Tumgi on the dais. I welcome you too. Sir, today it's remarkable event organized wherein we have eminent speakers from the various fields and sectors of the society and wide range of subjects to relevant on the affordability and availability essential drugs are going to be covered. As the first speaker, we have Sri Y.G. Muralidharan sir, Managing Trustee, Consumer Right Education and Awareness Trust, who will share his knowledge on the consumer perspective on the affordability and availability of the essential drugs. Sir, hearty welcome to you. Ladies and gentlemen, is thoroughly industry efforts, many new drugs and devices have been developed in the market, which has led to the striking of the decline in mortality over the past several decades. Yes, we have Sri Harish Jain, President of KDPMA, who over the past several decades, who will focus in his speech on the manufacturing initiatives to ensure affordability, promoting Make in India. On behalf of Karnataka PMRU, I welcome you. While I scientists are working hard to tackle the complex disease with new approaches, it is pharmacists who take utmost care to ensure the medicine reaches to the right patient at right time and right way. Yes, to speak about the role of the chemist pharmacist to ensure the availability of drugs, patients, consumers, we have Sri Ajay Reddy, Senior Marketing Officer, Pradhan Mantri Bharatiya Jana Aushadhi Kendra. Thank you. Welcome you too. And also our distinguished guest, Sri Gangadhar Yavugal, President, Karnataka State Pharmacy Council. Welcome you, sir. Sri Mahesh, Member of Chemist and Association. On behalf of Karnataka PMI, I welcome you, sir. I am very aware of fact that increasing the number of diseases successfully managed today with the drug therapy, but promote the generic drugs at the affordable prices, the major role will be played by the doctors, clinicians. Today we have our beloved Dr. Prasanna HM, President, Private Hospitals and Nursing Hospitals Association, to speak on the doctor's role promoting the generic drugs at affordable prices. On behalf of Karnataka PMRU, I will welcome you. Ladies and gentlemen, given the challenges in innovation, we are aware of that fact. Continuation, R&D progress is also one of the robust support and also involvement of the academic promoting and R&D. To speak about the same, to speak about on the box of solution to ensure the quality of the affordable drugs, we have Dr. Salahuddin, General Secretary, KSPC. I extend heart welcome to you, sir. We need full support from civil society and NGOs creating the awareness about the schemes or plans of NPPA, mainly about the affordability and availability of essential drugs. In this, to speak on the same, we have Sri Somshekhar VK, Managing Trustee, Grahaka Shakti. On behalf of Karnataka PMRU, sir, welcome you, sir. Dear all, Karnataka PMRU will be the collaborating with the partners of NPPA and state level with information gathering mechanism, particularly relating to collection, compilation, and creation and analysis of market-based data at the grassroots level. The primary function of PMRU is to assist the NPPA in monitoring of price drugs, ensuring the availability of drugs by conducting trainings, seminars, and workshops at the state and district levels for consumer awareness and publicity through Karnataka PMRU staff. So, with immense and affection, I welcome all the participants across the state and India who made efforts to join this symposium. I get the benefit out of the same. Thank you for all being a part and witnessing this event. Thank you very much, sir.
Thank you, sir, for your humble, encouraging, and informative welcome note. Now we request the dignitaries on the dais to illuminate the session by the process of lighting the lamp. nature and other forms of life. May the truth prevail. May the darkness of ignorance be swept away by the dawn of self-realization.
ಹಚ್ಚೇವು ಕನ್ನಡದ ದೀಪ, ಹಚ್ಚೇವು ಕನ್ನಡದ ದೀಪ, ಕರುನಾಡ ದೀಪ, ಸಿರಿನುಡಿಯ ದೀಪ, ಒಲವೆತ್ತಿ ತೋರುವ ದೀಪ, ಹಚ್ಚೇವು ಕನ್ನಡದ ದೀಪ, ಹಚ್ಚೇವು ಕನ್ನಡದ ದೀಪ.
Thank you all. Now I request our additional drug controller, Shri Principal Secretary. Now I request our additional drug controller, Shri Amrish Tumbigi sir, for the introductory remarks.
ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. ಕರ್ನಾಟಕ ಸ್ಟೇಟ್ ಪ್ರೈಸ್ ಮಾನಿಟರಿಂಗ್ ಆ್ಯಂಡ್ ರಿಸರ್ಚ್ ಯೂನಿಟ್ ಸೊಸೈಟಿ ಅವರ ನ್ಯಾಷನಲ್ ಫಾರ್ಮಾಸ್ಯೂಟಿಕಲ್ ಪ್ರೈಸಿಂಗ್ ಅಥಾರಿಟಿ ಅವರ ನಿರ್ದೇಶನದ ಮೇಲೆ ಇವತ್ತು ನಾವು ಅಫೋರ್ಡಬಿಲಿಟಿ ಮತ್ತು ಅವೈಲೇಬಿಲಿಟಿ ಆಫ್ ಎಸೆನ್ಷಿಯಲ್ ಮೆಡಿಸಿನ್ಸ್ ಬಗ್ಗೆ ಒಂದು ಸಿಂಪೋಸಿಯಮನ್ನು ಮಾಡಿಕೊಂಡಿದ್ದೇವೆ. ಈ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಉದ್ಘಾಟಕರಾಗಿ ಆಗಮ ಮಾಡಬೇಕಾಗಿದ್ದ ನಮ್ಮ ಪ್ರಿನ್ಸಿಪಲ್ ಸೆಕ್ರೆಟರಿ ಅವರು ವರ್ಚುವಲ್ನಲ್ಲಿ ಇದ್ದಿದ್ದಾರೆ. ಅವರಿಗೆ ಈ ಸೊಸೈಟಿಯಿಂದ ಮಾಡಿದ ಕೆಲವೊಂದು ಕಾರ್ಯಕ್ರಮಗಳ ಬಗ್ಗೆ ಮತ್ತು ಎಲ್ಲ ಇದರಲ್ಲಿ ತೋರಿಸಿದ ಒಂದು ಅಫೋರ್ಡಬಿಲಿಟಿ ಮತ್ತು ಅಸೆಸಿಬಿಲಿಟಿಗೆ ವಾಟ್ ಆರ್ ದ ಥಿಂಗ್ಸ್ ವಿ ಹ್ಯಾವ್ ಮೇನ್ಲಿ ಮೇಡ್ ಔಟ್ ಅಂತ ಅನ್ನೋದು ವಿ ಹ್ಯಾವ್ ವಾಂಟೆಡ್ ಟು enlighten here as an introductory remarks. ಮಾನ್ಯ ಪ್ರಧಾನ ಕಾರ್ಯದರ್ಶಿಗಳೇ ಹಾಗೂ ವೇದಿಕೆಯಲ್ಲಿ ಉಪಸ್ಥಿತರಿರುವ ಔಷಧ ನಿಯಂತ್ರಕರೇ ಹಾಗೂ ಈ ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ಭಾಗವಹಿಸಿದ ಶ್ರೀ ವೈ.ಜಿ. ಮುರಳೀಧರ್, ಮ್ಯಾನೇಜಿಂಗ್ ಡೈರೆಕ್ಟರ್, ಕನ್ಸ್ಯೂಮರ್ ರೈಟ್ಸ್ ಎಜುಕೇಷನ್ ಆ್ಯಂಡ್ ಅವೇರ್ನೆಸ್ ಟ್ರಸ್ಟ್ ಅವರೇ, ಶ್ರೀ ಹರೀಶ್ ಜೈನ್, ಕನ್ಸ್ಯೂಮರ್ ರೈಟ್ಸ್ ಅಧ್ಯಕ್ಷರು, ಕರ್ನಾಟಕ ಡ್ರಗ್ಸ್ ಆ್ಯಂಡ್ ಫಾರ್ಮಾಸ್ಯೂಟಿಕಲ್ ಮ್ಯಾನುಫ್ಯಾಕ್ಚರಿಂಗ್ ಅಸೋಸಿಯೇಷನ್ ರವರೇ, ಶ್ರೀ ಅಜಯ್ ರೆಡ್ಡಿ, ಸೀನಿಯರ್ ಮಾರ್ಕೆಟಿಂಗ್ ಮ್ಯಾನೇಜರ್, ಪ್ರಧಾನಮಂತ್ರಿ ಜನೌಷಧ ಕೇಂದ್ರ ರವರೇ, ಶ್ರೀ ಗಂಗಾಧರ್ ಯಾವಗಲ್, ಅಧ್ಯಕ್ಷರು, ಕರ್ನಾಟಕ ಸ್ಟೇಟ್ ಫಾರ್ಮಸಿ ಕೌನ್ಸಿಲ್ ಅವರೇ, ಕೆಮಿಸ್ಟ್ ಅಸೋಸಿಯೇಷನ್ಗಳಲ್ಲಿ ಸದಸ್ಯತ್ವ ಹೊಂದಿರುವ ಶ್ರೀ ಮಹೇಶ್ ರವರೇ, ಡಾಕ್ಟರ್ ಪ್ರಸನ್ನ ಎಚ್.ಎಂ, ಅಧ್ಯಕ್ಷರು, ಪ್ರೈವೇಟ್ ಹಾಸ್ಪಿಟಲ್ ಆ್ಯಂಡ್ ನರ್ಸಿಂಗ್ ಹೋಮ್ ಅಸೋಸಿಯೇಷನ್ ಅವರೇ, ಶ್ರೀ ಸಲಾವುದ್ದೀನ್, ಜನರಲ್ ಸೆಕ್ರೆಟರಿ, ಕರ್ನಾಟಕ ಸ್ಟೇಟ್ ಪ್ರೈವೇಟ್ ಕಾಲೇಜ್ ಪ್ರಿನ್ಸಿಪಲ್ ಅಸೋಸಿಯೇಷನ್ ರವರೇ, ಶ್ರೀ ಸೋಮಶೇಖರ್ ವಿ.ಕೆ, ಮ್ಯಾನೇಜಿಂಗ್ ಟ್ರಸ್ಟಿ, ಗ್ರಾಹಕ ಶಕ್ತಿ ಅವರೇ, ಶ್ರೀ ಸುನಿಲ್ ಚಿಬ್ಳಂಕರ್ ಅವರೇ, ವೈಸ್ ಪ್ರೆಸಿಡೆಂಟ್ ಬಿಸ್ನೆಸ್ ಡೆವಲಪ್ಮೆಂಟ್ ಗ್ರೂಪ್ ಫಾರ್ಮಾಸ್ಯೂಟಿಕಲ್ ಅವರೇ, ಈ ಕಾರ್ಯಕ್ರಮದ ಕೇಂದ್ರ ಬಿಂದು ಹಾಗೂ ತಮ್ಮೆಲ್ಲ ಪರವಾಗಿ ಆನ್ಲೈನ್ನಲ್ಲಿ ಭಾಗವಹಿಸಿರುವಂಥ ಎಲ್ಲ ಕನ್ಸ್ಯೂಮರ್ಸ್ ಅವರೇ, ಬಳಕೆದಾರರೇ, ಕೆಮಿಸ್ಟ್ ಆ್ಯಂಡ್ ಡ್ರಗ್ಗಿಸ್ಟ್ ಅವರೇ, ಮ್ಯಾನುಫ್ಯಾಕ್ಚರರ್ಸ್, ಎಂಟರ್ಪ್ರಿನರ್ಸ್ ಅವರೇ, ಮ್ಯಾನುಫ್ಯಾಕ್ಚರ್ನಲ್ಲಿ ಎಲ್ಲ ಕಾಲೇಜ್ ನಿರ್ವಾಹಕ ಮಂಡಳಿಯ ಸದಸ್ಯರೇ, ಬೋಧಕ ಸಿಬ್ಬಂದಿಯವರೇ, ಇಲ್ಲಿ ನೆರೆದಿರತಂಥ ನನ್ನ ಎಲ್ಲ ಸಹೋದ್ಯೋಗಿಗಳೇ ಹಾಗೂ ಮಾಧ್ಯಮದವರೇ ಮತ್ತು ಆಹ್ವಾನಿತರೆ. ಇದು ಒಂದು ನಮ್ಮ ಔಷಧ ನಿಯಂತ್ರಣ ಇಲಾಖೆ ಒಂದು ಮೈಲ್ ಸ್ಟೋನ್ ಅಂತ ಹೇಳ್ಬೋದು ನಾವು ಇವತ್ತು. PMRU we made during August 2020, and after registration we conducted one governing body meeting. So afterwards, this is an opportunity we issued to enlighten how the PMRU activity is doing. So today's topic is affordability and availability of essential medicines. So I am grateful to the Government of India, Ministry of Chemical and Fertilizers, Department of Pharmaceuticals, NPP, and for Karnataka Society of PMRU for having given me an opportunity to express certain views on the PMRU activities and the way Government of Karnataka, Government of India has made all efforts to make steps initiative to make affordable drugs. As you know, we have a lot of diseases and lot of medicines for that. For example, for fever, we have a paracetamol which costs 1 rupee. At the same time, if you go for an SMPA, that is spinal muscle atrophy, we have an Jolsonama, it cost me at 16 crores rupees per dose. See, we are in the dilemma which are to be made affordable. So we need to think of it, that's the reason we have taken Government of India has chosen a topic, affordable and availability of essential medicine. See, the making of essential medicine, listing of essential medicine itself is a big task. As you know, it requires a lot of a scientific background in it. It depends upon the locality, disease pattern, it depends upon the resources activity and potentiality of the socio-economic reasons. These are all to be considered. I really congratulate. See, Tanzania being a small country, it made a first essential list 1970. Thereafter, we have seen WHO 1975, it was started to make essential drugs, and every 2 years it is updating. First it was 208, thereafter it made to around 400 drugs. So now, at the same time, Government of Karnataka, Government of India, we also made an NLEM. It was first made during 2011 and thereafter 2015. During 2015, we all knows that. So a expert committee came to Karnataka and it was conducted at BMC, and a lot of people who are sitting here are a part of that today. So during that NLEM of India came out with this thing, because in spite of a lot of geographical differences, we made a comprehensive NLEM, so which can be made operative in a systematic way. So today, after 2015, recently in the month of February, in the month of September, Government of India introduced a national NLEM list comprising of around 399 medicines. That means, so these are all essential medicines which covers around 39 patterns. So we need to think of it, which are the essential medicines, which are desirable medicines. At the same time, Government of India, we have around 700, Government of Karnataka, we have 786 drugs comprising of desirable drugs and essential medicines. This needs to be an eye-opener for us. So we need to think which has to be considered as affordable medicines. During pandemic, we never thought that oxygen will be an essential medicines. So NPPA, it has used its powers. It made oxygen also under scheduled drugs and converted into a price parity. Now, since Government of India made oxygen as a scheduled drug and monitoring of the price has been done, at the same time, Government of Karnataka extend a step forward. It has also capped transport facility, transport rate also. So we have seen Government of India and Government of Karnataka, the way we have made it to affordable of all drugs which are essentially required. So in case if it is not possible to cover up under scheduled drugs, Government of India, National Pharmaceutical Pricing Authority has made a TMR activities. I mean, trade margin rationalization. You know that the trade margin rationalization, it covers around, a first seller, a company will give you around 70% of margin. If affordability of the drug is a double-sword edge, we need to make one side a drug available in the market, another side its affordable rate has to be reduced, and at the same time drug has to be made available. So in this case, what we expect is, see, all stakeholders, we need to use our due diligence. For example, we have seen the iron ferric content injections are available in several molecules. It may be iron ferric dextran, ferric iron choline ferric methyl carbamine. Ferric dextran is the cheapest drug. So it has got a little safety precaution. At the same time, iron choline is it's a still safer side. At the same time, its cost is normal. Its cost is in between. Another one is, if you go to the iron carboxymethyl, its safety is well proved and already established. At the same time, little costly. We need a judging activities in this, which to be considered an essential drug. See, that's the reason Government of India has included iron choline as an essential drug in the group of essential medicine. At the same time, we have one molecule having similar formulations. It may be an amphotericin B. It is available in the conventional method, conventional formulation, lipid formulation, liposomal formulations. So it depends upon the patient activities. We need to give that this thing. At the same time, the rate varies from the molecule formulation to formulations. Affordability not only depends upon the production cost, it also goes with the physicians who writes to the prescribes taking care of the drugs, which molecule, which formulation will be suitable for him. Here, a balancing activity between risk-based potential, safety and affordability has to be taken care of it. At the same time, Government of India has directed us to conduct a survey on the availability of several COVID-related drugs. From the PMRU activities, we usually conduct around 10 medical stores within a 1 kilometer radius of the COVID hospitals, where certain around 9 scheduled drugs, 6 non-scheduled drugs, and 5 medical devices availability is there or not. If it is not there, then what to be done? At the same time, 10 medical stores which are within 1 kilometer, and another 10 medical stores which are outside the behind 1 kilometer also. So every week we are monitoring. So we have seen that this affordability and availability depends upon the socio-economical reasons and institutional authority which accommodate it. So we have seen a wide range of materials, so which actually takes affordability. To make affordability of drug, it is then big task. We require consumer consent, we require physician consent, we require academicians, we require producers. We need to make a balancing between all the stakeholders. Affordability is one side, availability is another side. So if you go ahead with this thing, NPPA has taken due diligence and capped around 844 drugs under price control, around 5 scheduled medical devices and 6 under TMR activities. At the end of the day, TMR activities is the Government of India thought that TMR activities, trade margin rationalization, which gives import of the drugs to sell it at a 70% of margin to the dealers as well as for the manufacturers also. So it is a balancing activity between the producers and consumers. It has worked out nicely, and government has reduced a lot of prices for in this way. And I hope, so today's symposium, especially with all stakeholders, it may be from the Janaushadha stores, it may be from the hospitals, it may be from the community pharmacies, it may be from the consumer association. All have got their own role and play in this. They all will talk on this matter, and they will give in a bigger way. And I have seen a more active participation in this type of activities by all stakeholders will give in more awareness to the consumer activities. We have seen See, people who have come with several requests for the making availability of drugs, we have addressed it also. So in the same way, we request all participations, what we learnt and what we get here during our deliberations here, it may kindly be percolated to other people who have been there as your colleagues, it may be friends, or to encash further getting assurance about availability and affordability of the drugs. I am looking forward. This discussion will take forward to the highest level, and all matters which are to be addressed will be addressed here, and it will be taken care further this thing. Thank you. Thanks a lot. Jai Hind, Jai Karnataka.
Thank you, sir, for your enlightening remarks on the topic of the day, affordability and availability of essential drugs. Now, I kindly request respected Principal Secretary, Health and Family Welfare Department, Shri T.K. Anil Kumar, IAS, sir, for the inaugural address. Sir, please.
Am I audible?
Yes.
Am I audible? I will, of course, interact with our officers from the department to understand in depth as to what are the learnings from this workshop, and probably at another time and forum, we can have a closed door discussion on what needs to be done, how we can make this whole more effective. I once again congratulate the Karnataka Price Monitoring and Resource Unit Society for having organized this workshop, and I look forward to. I'm hoping that there will be good interaction. I thank one and all for giving me this opportunity to be a part of this inaugural session. Thank you one and all.
Thank you, sir. Thank you for your encouraging address. Thank you. We have come to the end of the inaugural session. I request Shri S. Venkatesh, Assistant Drugs Controller, Headquarters, to present the vote of thanks. Mr. Venkatesh.
Good evening, one and all. It's a feast for eyes to see such a wonderful and colorful gathering after a long gap of 600 days, isn't it? 600 days. Okay. So, Honorable Respected Principal Secretary, sir, to Government, HFW, dignitaries on dais, distinguished guests, eminent speakers, dear participants, and entire healthcare stakeholders who are all present here physically and also logged on virtually from the entire state. I'll give a gist. 2,170 members are viewing in the YouTube and 3,876 are logged in and house full. Okay. I am privileged to propose vote of thanks for the inaugural session on today's topic, affordability and availability of essential drugs. On behalf of NPPA, Department of Pharmaceutics, Government of India, Government of Karnataka, Karnataka State Price Monitoring and Resource Unit Society, and Drugs Control Department, on my behalf, I wish to express my sincere gratitude to Shri T.K. Anil Kumar sir, Principal Secretary to Government, HFW, for having spared his precious time from his busy schedule and gracing this occasion and enlightening all of us by his inaugural address. Sir, really you gave us a thought-provoking insight on the functionalities of PMRU and the objectives of PMRU and their importance in making the essential drugs affordable. Under your guidance, sir, we from the department shall ensure and assure you, sir, we will work for the health of the society and we shall not leave any stone unturned in making the essential drugs available to the needy. I wish to express my sincere gratitude to our beloved drugs controller, Shri Bagaji T. Kanapure, sir, and additional drugs controller, Shri Amresh Tumgi, sir, for being a constant motivators in all our endeavors and for their unfaltering support and confidence in us. Sir, you are the backbone of our department and guiding force for every new step forward. I thank you very much, sir, for welcoming the guests and speakers for today's technical session and also for delivering wonderful introductory remarks on today's topic. Sir, medicines are an integral part of a medical treatment and the expenditure incurred on medicines and medical devices is quite substantial. Considering this fact, the NPPA is putting all its efforts to reduce the out-of-pocket expenditure. For this, I wish to thank the entire team of NPPA. An event like this cannot happen overnight. The wheel started rolling a week ago. It required a bird's eye and a detailed planning, and we are fortunate enough to back it up by a team of very motivated and dedicated colleagues and staff in the department who know their job and are result oriented. I thank everyone who directly and indirectly involved in making this event successful. I thank all the deputy drugs controllers sincerely for their untiring efforts in organizing this event. I express my gratitude to all the officers and staff of the drugs control department from Bengaluru and from all the districts who have participated in the event and made all the stakeholders to participate virtually also. On behalf of department and on my behalf, express my profound sense of thanks and appreciation to all the participants, chemists who have come over here in the busy schedule, students from various colleges, industry members, members from print and media who are present here, and to all the participants who have logged on to this PARICHARCHA online with great enthusiasm and have made this event a great success. I thank you all once again for being with us today. Have a wonderful day ahead and request you all to participate in the technical sessions which will be continued by eminent speakers. Thank you, sir.
Thank you, Mr. Venkatesh, for your beautiful and pleasant words. Thank you so much. Now let's begin with the technical session. Now I request our dignitaries on the dais to kindly occupy the seats below for the next important and most awaited technical session of the day. Venkatesh. 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 Let's begin the technical session, starting with the consumers. They are the most important people. Consumer access to effective and affordable medicines is an imperative for public health, social equity, and economic development. To talk on the subject, consumer perspective on affordability and availability of essential medicine, we request Shri Y.G. Muralidharan, Managing Trustee, Consumer Rights Education Awareness Trust, CRATE. Sir, please.
ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. ಕರ್ನಾಟಕ ರಾಜ್ಯದ ಆರೋಗ್ಯ ಮತ್ತು ಕುಟುಂಬ ಕಲ್ಯಾಣ ಇಲಾಖೆಯ ಕಾರ್ಯದರ್ಶಿಗಳು ಈಗಾಗಲೇ ಈ ಕಾರ್ಯಕ್ರಮವನ್ನು ಉದ್ಘಾಟನೆ ಮಾಡಿದ್ದಾರೆ. ಅವರಿಗೆ ನನ್ನ ಧನ್ಯವಾದಗಳು. ಎರಡನೇದಾಗಿ ಈ ಕಾರ್ಯಕ್ರಮವನ್ನು ಆಯೋಜಿಸಿರುವ ಔಷಧ ನಿಯಂತ್ರಣ ಕಚೇರಿಯ ಎಲ್ಲ ಸಿಬ್ಬಂದಿಗಳು, ವಿಶೇಷವಾಗಿ ಖಾನಾಪುರೆ ಅವರು ಮತ್ತು ಅಂಬರೀಷ್ ಅವರಿಗೆ ಮತ್ತು ಇತರ ಸಿಬ್ಬಂದಿಗೆ ಒಬ್ಬ ಗ್ರಾಹಕ ಕಾರ್ಯಕರ್ತನಾಗಿ ನನ್ನ ಧನ್ಯವಾದಗಳು ಹೇಳ್ತಾ ಇದ್ದೇನೆ. ಈಗ ನವಂಬರ್ ಹತ್ತಿರ ಬರ್ತಾ ಬರ್ತಾ ಕನ್ನಡದಲ್ಲಿ ಮಾತಾಡೋದು ಒಳ್ಳೆಯದು ಅಂತ ಅನಿಸುತ್ತೆ ನನಗೆ. ಸೊ ನನ್ನ ಹೃದಯದ ಭಾಷೆ ಕನ್ನಡ ಆದ್ದರಿಂದ ನಾನು ಕನ್ನಡದಲ್ಲಿ ಮಾತಾಡ್ತೀನಿ. ಮಧ್ಯ ಮಧ್ಯೆ ಏನಾದ್ರು ಅಫೋರ್ಡಬಿಲಿಟಿ ಅದು ಇದು ಎಲ್ಲ ಬಂದರೆ ದಯವಿಟ್ಟು ನನಗೆ ಕ್ಷಮಿಸಿ. ಮೊದಲನೇದು, ನಿಮಗೊಂದು ಧೈರ್ಯ ಇರಬೇಕು, ಇವನು ಜಾಸ್ತಿ ಮಾತಾಡಲ್ಲ ಅಂತ. ಯಾಕೆಂದರೆ 10 ನಿಮಿಷ ಕೊಟ್ಟಿದ್ದಾರೆ, ಅಷ್ಟರಲ್ಲೇ ಮುಗಿಸ್ತೀನಿ ನಾನು. ಈ ಹತ್ತಿರ ಇದ್ದರೆ ನಿಮಗೆ ಅರ್ಥ ಆಗುತ್ತೆ. ಈ 10 ನಿಮಿಷದಲ್ಲಿ ಈಗ ನಮ್ಮ ಅಮರೇಶ್ ಅವರು ಸಿಕ್ಕಾಬಟ್ಟೆ ಸಬ್ಜೆಕ್ಟ್ಗಳನ್ನು ಫ್ಲ್ಯಾಗ್ ಮಾಡಿದ್ದಾರೆ. ಅಂದರೆ ನಮ್ಮ ಅಜೆಂಡಾ ಮೇಲೆ ನಮ್ಮ ಊಟ ತಟ್ಟೆಯಲ್ಲಿ ಇಟ್ಟಿದ್ದಾರೆ. ಅದೆಲ್ಲವನ್ನೂ ಮಾತಾಡೋದು ಭಾಳ ಕಷ್ಟ ಆಗುತ್ತೆ. ಎರಡನೇದು, ತಾಂತ್ರಿಕವಾದಂಥ ಭಾಷಣಗಳು ಬೇಕಾದಷ್ಟು ಇವೆ ಇಲ್ಲಿ. ಅವರು ಔಷಧಿಗಳ ಹೆಸರು ಹೇಳ್ತಾ ಹೋದರೆ ನಮಗೆ ತಬ್ಬಿಬ್ಬಾಗ್ತಾ ಇದೆ, ನಮಗೆ ಅದು ಗೊತ್ತಾಗಲ್ಲ. ನಮಗೆ ವಿ ಆರ್ ವೆರಿ ವೆರಿ ಕಾಮನ್ ಮ್ಯಾನ್ಸ್. ಆದ್ದರಿಂದ ಒಬ್ಬ ಗ್ರಾಹಕನಾಗಿ, ಒಬ್ಬ ಸಾಮಾನ್ಯ ಪೇಷಂಟಾಗಿ, ಅಂದರೆ ಎವ್ರಿ ಕನ್ಸ್ಯೂಮರ್ ಈಸ್ ಎ ಪೊಟೆನ್ಷಿಯಲ್ ಪೇಷಂಟ್, ಅದರಿಂದನೇ ಇರೋದು ಗೊತ್ತಾಗುತ್ತೆ. 50 ವರ್ಷ ಆದಮೇಲೆ ಎವ್ರಿಬಡಿ ಬಿಕಮ್ಸ್ ಎ ಪೇಷಂಟ್ ಐದರ್ ವೇ. ಸೊ ಆ ದೃಷ್ಟಿಯಲ್ಲಿ ಏನು ಬೇಕಾಗುತ್ತೆ ನಮಗೆ ಅಂತ. ಮೊದಲನೇದು, ಯಾವುದೇ ಸರ್ವಿಸ್ ತೊಗೊಳ್ಳಿ ನೀವು, ಅದ್ರ ಪ್ರಕಾರನೇ ಹೋಗಲ್ಲ, ನಾನು ಬೇಕಾದ್ರೆ ಟ್ರೈ ಮಾಡ್ತೀನಿ. 3 A's ಅಂತ ಕರೀತಾರೆ ಅದನ್ನು. ಅಫೋರ್ಡಬಿಲಿಟಿ, ಅವೈಲಬಿಲಿಟಿ, ಆಕ್ಸೆಸಬಿಲಿಟಿ ಅಂತ. ಬರೀ ಅಫೋರ್ಡಬಿಲಿಟಿ ಅಲ್ಲ, ಅವೈಲಬಿಲಿಟಿ ಅಲ್ಲ, ಆಕ್ಸೆಸಬಿಲಿಟಿನೂ ಇರಬೇಕಲ್ಲ. ಕೋವಿಡ್ ಆದಮೇಲೆ ಬೆಂಗಳೂರಲ್ಲಿ ಇರೋರಿಗೆ ಸಿಕ್ಕಂಥ ಔಷಧಿಗಳು ಬೇರೆ ಕಡೆಯವರು ಸಿಕ್ಕಿದ್ವಾ? ಅಥವಾ ಅಲ್ಲೆಲ್ಲೋ ಇನ್ನೆಲ್ಲೋ ಡೆಲ್ಲಿಲಿ ಅಥವಾ ಇನ್ನೆಲ್ಲೋ ಸಿಕ್ಕಿದ ಔಷಧಿಗಳು ನಮಗೆ ಸಿಕ್ಕಿದ್ವಾ? ಸೊ ಆಕ್ಸೆಸಬಿಲಿಟಿ ಇಸ್ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ ಅನ್ನೋದನ್ನು ನಾವು ಇಲ್ಲಿ ಯೋಚನೆ ಮಾಡಬೇಕಾಗತ್ತೆ. ನೀವು ಭಾಳ 60-62ನೇ ಇಸ್ವಿಯಲ್ಲಿ ಶಿವಮೊಗ್ಗ ಹತ್ರ ಒಂದು ಡ್ಯಾಮ್ ಕಟ್ಟಿದ್ರು. ಆ ನೀರು ಸಂಗ್ರಹಣೆಗೋಸ್ಕರ ಆ ಒಂದು ಡ್ಯಾಮ್ ಕಟ್ಟಿದಾಗ ಅಲ್ಲಿದ್ದ ಹಳ್ಳಿಗಳೆಲ್ಲ ದೂರ ದೂರ ಹೋದು. ಇವತ್ತು ನಮಗೆಲ್ಲರಿಗೂ ಎಲೆಕ್ಟ್ರಿಸಿಟಿ ಸಿಗ್ತಾ ಇದೆ. ಆ ಜಾಗವನ್ನು ಬಿಟ್ಟುಕೊಟ್ಟ ಹಳ್ಳಿಗರಿಗೆ ಎಲೆಕ್ಟ್ರಿಸಿಟಿ ಇಲ್ಲ, ಇವತ್ತಿಗೂ ಇಲ್ಲ. ಸೊ ಆಕ್ಸೆಸಿಬಿಲಿಟಿ ಈಸ್ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್. ಅಫೋರ್ಡಬಿಲಿಟಿ ಮೇ ಕಮ್ ಇನ್ ಲೇಟರ್ ಅನ್ನೋದು ಒಂದು ರೀತಿಯ ಒಂದು ಮಾಡುವಂಥದ್ದು. ಎರಡನೇದು, ಈ ಅಫೋರ್ಡಬಿಲಿಟಿ ವಿಷಯದಲ್ಲೂ ನಾವು ಸ್ವಲ್ಪ ಯೋಚನೆ ಮಾಡಬೇಕಾಗತ್ತೆ. ಅವೈಲಬಿಲಿಟಿ ಅಂದರೆ ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ಎಲ್ಲಿ ಅವೈಲಬಿಲಿಟಿ ಅನ್ನೋದು ನೋಡಬೇಕಾಗತ್ತೆ. ಪ್ರೈಮರಿ ಹೆಲ್ತ್ ಸೆಂಟ್ರಲ್ಲಿ ಔಷಧಿ ಇದೆಯಾ? ESI ಹಾಸ್ಪಿಟ್ಲಲ್ಲಿ ಇದೆಯಾ? ಪ್ರೈವೇಟಲ್ಲಿ ಇರ್ಬೋದು. ಈಗಾಗಲೇ ಒಂದು ಸ್ಟ್ಯಾಟಿಸ್ಟಿಕ್ಸ್ ಕೊಟ್ಟಿದ್ದಾರೆ, ಪ್ರೈವೇಟ್ ಔಟ್ ಆಫ್ ಪಾಕೆಟ್ ಎಕ್ಸ್ಪೆಂಡಿಚರ್. ನಾನು ಒಂದು ಸ್ಟ್ಯಾಟಿಸ್ಟಿಕ್ಸ್ ಕೊಡ್ತೀನಿ ನಾನು ಬೇಕಾದ್ರೆ. ಬಟ್ ದ ಪ್ರಾಬ್ಲಮ್ ಈಸ್ ಎಲ್ಲಿ ಅವೈಲಬಲ್ಲು. ಅಫೋರ್ಡಬಿಲಿಟಿ, ಅವೈಲಬಿಲಿಟಿ ಇಲ್ಲೇ ಇರೋಕ್ಕೆ ಸಾಧ್ಯ, ಪ್ರೈಮರಿ ಹೆಲ್ತ್ ಸೆಂಟ್ರಲ್ಲೇ ಇರೋಕ್ಕೆ ಸಾಧ್ಯ, ESI ಹಾಸ್ಪಿಟ್ಲ್ ಇರೋಕ್ಕೆ ಮಾತ್ರ, ಅಥವಾ ಗೌರ್ಮೆಂಟ್ ಹಾಸ್ಪಿಟ್ಲ್ ಇರೋಕ್ಕೆ ಸಾಧ್ಯ. ಸೊ ಅಫೋರ್ಡಬಿಲಿಟಿ ಆ್ಯಂಡ್ ಅವೈಲಬಿಲಿಟಿ ಈಸ್ ವೆರಿ ವೆರಿ ಕಾಂಪ್ಲಿಮೆಂಟೇಟಿವ್ ಈಚ್ ಅದರ್ ಅಂತ ನನಗಾಗ್ತದೆ. ಇದ್ರೂ ತೊಗೊಳಕ್ಕಾಗ್ತಾ ಇಲ್ವಲ್ಲ. ಸೊ ಇದು ಒಂದು ಒಳ್ಳೆಯದು. ಸೊ ಅದೇ ರೀತಿ ಏನೂ ಕಾರ್ಯಕ್ರಮ ಮಾಡೇ ಇಲ್ಲ ನಮ್ಮ ಸರ್ಕಾರ ಅಂತ ನಾನು ಹೇಳ್ತಾ ಇಲ್ಲ ಆಗ್ತಾ ಇದ್ದೇನೆ. ಇವಾಗ ಆಕ್ಸೆಸಿಬಿಲಿಟಿಗೆ ಜನೌಷಧಿ ಕೇಂದ್ರ ಇಸ್ ಎ ವೆರಿ ಗುಡ್ ಎಕ್ಸಾಂಪಲ್. ಇಟ್ ವಿಲ್ ಬಿ ರಿಪ್ಲಿಕೇಟೆಡ್ ಎವ್ರಿವೇರ್, ಏನು ತೊಂದರೆನೇ ಇಲ್ಲ ಅದು ಒಂದು. ಆದರೆ ಅದರಲ್ಲಿ ಪ್ರಾಬ್ಲಮ್ ಇದೆ. ಮೋಸ್ಟ್ ಆಫ್ ದಿ ಜನೌಷಧಿ ಕೇಂದ್ರಸು ಅರ್ಬನ್ ಏರಿಯಾಗೆ ಕಾನ್ಸಂಟ್ರೇಟ್ ಆಗಿದೆ, ರೂರಲ್ ಏರಿಯಾದಲ್ಲಿ ಇಲ್ಲ. ನಾವು ಮೊನ್ನೆ ಕನಕಪುರದ ಕಡೆ ಯಾವುದೋ ಒಂದು ಹಳ್ಳಿಗೆ ಹೋಗಿ ಇದೇ ಥರ ಒಂದು ಸರ್ವೆ ಮಾಡ್ತಾ ಇದ್ದೆ. ನಾನು ಸ್ವಂತವಾಗಿ ಒಂದು ಸರ್ವೆ ಮಾಡ್ತಾ ಇದ್ದೆ. ಕೋಡಿಹಳ್ಳಿ ಅಂತ ಒಂದು ಊರಿದೆ, ಅಲ್ಲಿ ಇದೆಯಾ ಅಂದರೆ ಬಹುಶಃ ಇನ್ನೂ ಆ ಯೋಜನೆ ಇನ್ನೂ ವಿಸ್ತಾರ ಆಗಬೇಕು ಅನ್ಸುತ್ತೆ. ಖಂಡಿತ ದಟ್ ಇಸ್ ಎ ಕಾಂಬಿನೇಷನ್ ಆಫ್ ಜನೌಷಧಿ ಕೇಂದ್ರ ಇಸ್ ಎ ಕಾಂಬಿನೇಷನ್ ಆಫ್ ಅಫೋರ್ಡಬಿಲಿಟಿ, ಅವೈಲಬಿಲಿಟಿ ಆ್ಯಂಡ್ ಆಕ್ಸೆಸಿಬಿಲಿಟಿ. ಇದು ರಿಪ್ಲಿಕೇಟ್ ಆಗಬೇಕು. ಈ ರಿಪ್ಲಿಕೇಟ್ ಆಗಿದ್ರೆ ಈ ಬೆಸ್ಟ್ ಪ್ರಾಕ್ಟೀಸು ಬಹುಶಃ ಅರ್ಧ ಪ್ರಾಬ್ಲಮ್ ನಮಗೆ ಸಾಲ್ವ್ ಆಗುತ್ತೆ ಅನ್ನೋದು ಒಂದು. ಇದು ಈ ರೀತಿಯಾಗಿರುವಂಥ, ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ಇವಾಗ ಈ ಫಾರ್ಮಸಿಗಳಿಂದ ನಮಗೆ ಆಕ್ಸೆಸಿಬಿಲಿಟಿ ಸಿಗ್ತಾ ಇದೆ ಅಂತ ನಾವು ಅನ್ಕೋತಾ ಇದ್ದೀವಿ ನಾವು. ಸೊ ಈ ಫಾರ್ಮಸೀಸ್ ಎಲ್ಲಿದೆ? ಸೊ ದಿಸ್ ಅನದರ್ ಇಂಪಾರ್ಟೆಂಟ್ ಇಶ್ಯೂ. ಅದರಲ್ಲಿರುವಂಥ ಇನ್ನು ಬೇರೆ ಬೇರೆ ಪ್ರಾಬ್ಲಮ್ಗಳಿದೆ, ಸೇಫ್ಟಿ ಅದು ಇದು ಏನೇನೋ ಬರ್ತಾ ಇದೆ. ಅದಕ್ಕೆಲ್ಲ ಟೈಮ್ ಅಲ್ಲ ನಮಗೆ, ಯಾಕೆಂದ್ರೆ 10 ನಿಮಿಷದಲ್ಲಿ ನಾವು ಮುಗಿಸ್ಬೇಕಾಗಿರುವಂಥದ್ದು. ಸೊ ಇದು ಈ ರೀತಿಯಾಗಿರುವಂಥ 43.16% ಬ್ರೂಕಿಂಗ್ ಸ್ಟಡೀಸ್ ಪ್ರಕಾರ, ಬ್ರೂಕಿಂಗ್ ಇನ್ಸ್ಟಿಟ್ಯೂಷನ್ ಅಂತ ಒಂದಿದೆ, ಆ ಸ್ಟಡಿ ಪ್ರಕಾರ ಇತ್ತೀಚೆಗೆ 21ರಲ್ಲಿ ಮಾಡಿರುವಂಥ ಒಂದು ವರದಿ ಪ್ರಕಾರ ಒಬ್ಬರು ಸಾಮಾನ್ಯ ಮನುಷ್ಯ 43% ಆಫ್ ದಿಸ್ ಇನ್ಕಮ್ ಆರ್ ಎಕ್ಸ್ಪೆಂಡಿಚರ್ ಆನ್ ಹೆಲ್ತ್ ಗೋಸ್ ಓನ್ಲಿ ಫಾರ್ ಮೆಡಿಸಿನ್ಸ್. ಅದು ಕೋವಿಡ್ ಆದಮೇಲೆ ಸ್ವಲ್ಪ ಜಾಸ್ತಿ ಆಗಿದೆ. ಅಫ್ಕೋರ್ಸ್ ಅದಕ್ಕೆ ಸ್ವಲ್ಪ ಕುಷನ್ ಕೊಡಬೇಕಾಗತ್ತೆ. ಎನಿವೇ ದಟ್ಸ್ ಒನ್ ಥಿಂಗ್. ಸರಿ, ಸೊ ವಾಟ್ ಕನ್ಸ್ಯೂಮರ್ಸ್ ಎಕ್ಸ್ಪೆಕ್ಟ್ ಅಂತ, ಇವಾಗ ಏನು ಎಕ್ಸ್ಪೆಕ್ಟ್ ಮಾಡ್ತೀವಿ ನಾವು ಇಂಥ ಒಂದು ಪರಿಸ್ಥಿತಿಯಲ್ಲಿ? ತುಂಬ ಕಷ್ಟ ಇದೆ ನಮ್ಮಂಥ ದೇಶದಲ್ಲಿ, ಇವೆಲ್ಲವನ್ನೂ ಕೊಡೋಕ್ಕೆ ಕಷ್ಟ ಇದೆ ಅಂತ. ಒಂದು ಕ್ವಾಲಿಟಿ ಅಥವಾ ಸೇಫ್ಟಿ, ಇಟ್ ಈಸ್ ಟೈಡ್ ಟು ಕನ್ಸ್ಯೂಮರ್ ರೈಟ್ಸ್ ಆಲ್ಸೋ. ಇದಕ್ಕೆ ಮುಂಚೆ ನಾನು ಇನ್ನೊಂದು ಹೇಳಬೇಕು, ಅಮರೇಶ್ ಅವರು ಎಸೆನ್ಷಿಯಲ್ ಡ್ರಗ್ ಮೆಡಿಸಿನ್ಸ್ ಬಗ್ಗೆ ಒಂದು ಮಾತಾಡ್ತಾರೆ. ಬಹುಶಃ ನಿಮ್ಗೆ ತುಂಬ ಜನಕ್ಕೆ ಗೊತ್ತಿರಬೇಕು, 60ರ 70ರ ದಶಕದಲ್ಲಿ ಜೈ ಸುಕ್ಲಾಲ್ ಹತಿ ಕಮಿಟಿ ಅಂತ ಒಂದಿತ್ತು. ಅವರು ಒಂದು ಎಸೆನ್ಷಿಯಲ್ ಡ್ರಗ್ ಲಿಸ್ಟು ಮಾಡಿದ್ರು. ಭಾರತಕ್ಕೆ ಬೇಕಾಗಿರುವಂಥ ಒಂದು ಎಸೆನ್ಷಿಯಲ್ ಡ್ರಗ್ ಲಿಸ್ಟ್ ಅಂತ. ಅಫ್ಕೋರ್ಸ್ ಅದು ಚೇಂಜ್ ಆಗಲೇಬೇಕು. ಆ ಕಾಲಕ್ಕೆ ಒಂದು 130 ಮೆಡಿಸಿನ್ಗಳು ಎಸೆನ್ಷಿಯಲ್ ಡ್ರಗ್ಸಲ್ಲಿ ಇದ್ದವು. ವರ್ಷಾನ್ಗಟ್ಟಲೆ 80ನೇ ಇಸ್ವಿವರೆಗೂ ನಾವು ಏನೂ ಮಾಡಲಿಲ್ಲ ಎಸೆನ್ಷಿಯಲ್ ಡ್ರಗ್ಸ್ ಬಗ್ಗೆ. ಇದ್ರ ಮಧ್ಯೆ ಏನಾಯಿತು, ಬಾಂಗ್ಲಾದೇಶದ ಪ್ರೈಮ್ ಮಿನಿಸ್ಟರ್ಗೆ ಕಣ್ಣು ಏನೋ ನೋವು ಬಂತಂತೆ, ಸಮಥಿಂಗ್. ಅವನ ಹಾಸ್ಪಿಟ್ಲಿಗೆ ಕರ್ಕೊಂಡು ಹೋದ್ರು. ಅಲ್ಲಿ ಯಾವುದೋ ಒಂದು ಔಷಧಿ ಹಾಕಿದ್ರು, ಇದ್ದ ಕಣ್ಣು ಹೊಟ್ಟೋಯ್ತು ಅವನಿಗೆ. ಸಡನ್ನಾಗಿ ಅವನು ಎಚ್ಚೆತ್ಕೊಂಡು ವಾಟ್ ಈಸ್ ದಟ್ ಮೆಡಿಸಿನ್ ಹೌ ಅಂತ ಚರ್ಚೆ ಶುರುವಾಯಿತು, ಇನ್ವೆಸ್ಟಿಗೇಷನ್ ಶುರುವಾಯಿತು. ಆವಾಗಿಲ್ಲ, ಇದು ಬ್ಯಾಂಡ್ ಮೆಡಿಸಿನ್ ಆಗಿದೆ ಅಥವಾ ಬ್ಯಾನ್ ಮಾಡಬೇಕಾಗಿರೋ ಮೆಡಿಸನ್ನು ಅಂತ. ನಮ್ಮ ಹತ್ರ ಒಂದು ಲಿಸ್ಟ್ ಇದೆಯಾ ಬಾಂಗ್ಲಾದೇಶಲ್ಲಿ? ಇಲ್ಲ, ನಮ್ಮ ಹತ್ರ ಲಿಸ್ಟ್ ಇಲ್ಲ. ಮತ್ತು ಯಾರು ಮಾಡಿದ್ದಾರೆ? ಇಂಡಿಯಾದವ್ರು ಮಾಡಿದ್ದಾರೆ ಪಕ್ಕದಲ್ಲಿರೋದನ್ನ, ತಗೊಂಬನ್ನಿ ಅದನ್ನು ಅಂತ. ಸೊ ಬಾಂಗ್ಲಾದೇಶ್ ಬಿಕೇಮ್ ದ ಫಸ್ಟ್ ಕಂಟ್ರಿ ಟು ಅಡಾಪ್ಟ್ ಅವರ್ ಓನ್ ಎಸೆನ್ಷಿಯಲ್ ಡ್ರಗ್ ಲಿಸ್ಟ್. ದಿಸ್ ಈಸ್ ದ ಹಿಸ್ಟ್ರಿ ಆಫ್ ಎಸೆನ್ಷಿಯಲ್ ಡ್ರಗ್. ಆಮೇಲೆ ಬೇಕಾದಷ್ಟು WHO ಎಲ್ಲ ಮಾಡ್ತಾ ಇದ್ದಾರೆ, ಇವಾಗ ಇಂಡಿಯಾ ಗೌರ್ಮೆಂಟು ಮಾಡಿದ್ದಾರೆ. ಈ ಎಸೆನ್ಷಿಯಲ್ ಲಿಸ್ಟ್ ಅಂದಾಗ ಅದರ ಅಫೋರ್ಡಬಿಲಿಟಿ ನೋಡಬೇಕಾಗತ್ತೆ, ಅವೈಲಬಿಲಿಟಿ ನೋಡಬೇಕಾಗತ್ತೆ. ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ಗೌರ್ಮೆಂಟ್ ಹಾಸ್ಪಿಟಲ್ ಆಮೇಲೆ ಶುರು ಮಾಡಿದ್ರು, ಬರೀ ಎಸೆನ್ಷಿಯಲ್ ಡ್ರಗ್ಸ್ ಮಾತ್ರ ಕೊಡ್ತೀವಿ, ಬೇರೆ ಕೊಡಲ್ಲ ಅಂತ. ಇಫ್ ಐ ರಿಮೆಂಬರ್ ಕರೆಕ್ಟ್ಲಿ, ಇನ್ ಬ್ಯಾಂಗ್ಳೂರ್ ಮಾರ್ತಾಸ್ ಹಾಸ್ಪಿಟಲ್ ವಾಸ್ ದ ಓನ್ಲಿ ಹಾಸ್ಪಿಟಲ್ ವಿಚ್ ವಾಸ್ ಗಿವಿಂಗ್ ಎಸೆನ್ಷಿಯಲ್ ಮೆಡಿಸಿನ್ಸ್. ಆಫ್ಟರ್ವರ್ಡ್ಸ್ ಎಲ್ಲ ಚೇಂಜ್ ಆಗಿದೆ. ಸೊ ಏನು ಎಕ್ಸ್ಪೆಕ್ಟ್ ಮಾಡ್ತಾ ಇದ್ದೀವಿ ನಾವು? ಈ ಅಫೋರ್ಡಬಿಲಿಟಿ ಸಮಯ ಬಂದಾಗ ಮತ್ತೊಂದು ಇದಿದೆ, ಏನೋ ಒಂದು ಭಾಗ ಇದೆ. ಅದೇನಪ್ಪ ಅಂದರೆ, ಇವಾಗ ಈ ಕೋವಿಡ್ ಹಿನ್ನೆಲೆಯಲ್ಲಿ ನೋಡುವಂಥದ್ದು ವ್ಯಾಕ್ಸಿನೇಷನ್ಗೆ ಪೇಟೆಂಟ್ ಬೇಕೋ ಬೇಡವೋ ಅನ್ನೋದೊಂದು. ಬಹುಶಃ WTO ಇದು ಒಂದು ದೊಡ್ಡ ಚರ್ಚೆ. ಇದು ಇನ್ನೂ ಅದಕ್ಕೇನು ಉತ್ತರ ಸಿಗ್ತಾ ಇಲ್ಲ ನಮಗೆ. ವೆದರ್ ಇಟ್ ಶುಡ್ ಬಿ ಕಮಿಂಗ್ ಅಂಡರ್ ದಟ್ ಆರ್ ಕಂಪಲ್ಸರಿ ಲೈಸೆನ್ಸಿಂಗ್ ಕೊಡಬೇಕಾ, so that vaccination can become quite cheaper or easier availability, all those things will come into picture. ಇದೆಲ್ಲ ಮಾಡಬೇಕಾದ್ರೆ ನಂಗೆ ಅನ್ಸುತ್ತೆ ಡ್ರಗ್ಸ್ ಕಂಟ್ರೋಲ್ ಅವರು ಒಂದಿನದ ಕಾರ್ಯಾಗಾರ ಇಟ್ಕೋಬೇಕು, ಸೊ ದಟ್ ವಿ ಕ್ಯಾನ್ ಟಾಕ್ ಅಟ್ಲೀಸ್ಟ್ 45 ಮಿನಿಟ್ಸ್ ಅಥವಾ ಮಾಡ್ಬೋದು. ಕ್ವಾಲಿಟಿ ಆ್ಯಂಡ್ ಸೇಫ್ಟಿ, ದಿಸ್ ಅನದರ್ ಮೇಜರ್ ಇಂಪಾರ್ಟೆಂಟ್ ಫಾರ್ ಕನ್ಸ್ಯೂಮರ್ಸ್. ನಮ್ಮ ಗ್ರಾಹಕರ ದೃಷ್ಟಿಯಿಂದ ಇವತ್ತು ನಮ್ಗೆ ಬೇಕಾಗಿರೋದು ಕ್ವಾಲಿಟಿ ಅಥವಾ ಸೇಫ್ಟಿಗೆ ಸ್ವಲ್ಪ ಲಿಂಕ್ ಇದೆ ಅಂತ ಇಟ್ಕೊಳ್ಳೋಣ. ಇಲ್ಲಿ ಪಾಸಿಟಿವ್ಗಿಂತ ನೆಗೆಟಿವ್ ನ್ಯೂಸೇ ಜಾಸ್ತಿ ಬರ್ತಾ ಇದೆ. ಬಹುತ್ ಮೀಡಿಯಾಲಾಗಿರ್ಬೋದು, ಬೇರೆ ಕಡೆ ಆಗಿರ್ಬೋದು, ಎಲ್ಲೇ ಆಗಿರ್ಬೋದು. ಅಯ್ಯೋ, ಕರ್ನಾಟಕದಲ್ಲಿ ಎಲ್ಲ ಮೆಡಿಸಿನ್ಗಳು ಸಬ್ ಸ್ಟ್ಯಾಂಡರ್ಡ್ ಅಂತ ನಾಟ್ ಪಾಸಿಬಲ್. ಇಲ್ಲಿ ಜಗಶೆಟ್ಟಿ ಅಂತ ಇದ್ರು ಒಬ್ಬರು ಡ್ರಗ್ಸ್ ಕಂಟ್ರೋಲರು. ಅವಾಗ ಅವ್ರೇನು ಮಾಡಿದ್ರು, ಸರ್ ನಾವೊಂದು ಮಾತಾಡಿದೆ ಅವ್ರ ಹತ್ರ, ಎಲ್ಲರೂ ಈ ಥರ ಅಪನಂಬಿಕೆ ಇದ್ದಾರೆ ಅನ್ನೋ ರೀತಿಯಲ್ಲಿ. ಆವಾಗ ಅವರು ಹುಡುಗರು ಮತ್ತು ಕಾಲೇಜ್ ಹುಡುಗರು ನಮ್ಮಂಥವ್ರನ್ನೆಲ್ಲ ಕರ್ಕೊಂಡೋಗಿ ನಾವೇ ಬೇರೆ ಬೇರೆ ಅಂಗಡಿಯಲ್ಲಿ ಔಷಧಿಯನ್ನು ತಗೊಳ್ಳೋದು, ಓಪನ್ ಮಾರ್ಕೆಟ್, ನಥಿಂಗ್, ಸುಮ್ಮನೆ ಯಾವುದೋ ಒಂದು ಪ್ರಿಸ್ಕ್ರಿಪ್ಷನ್ ತೊಗೊಂಡು ಹೋಗುವಂಥದ್ದು. ಅದನ್ನು ಇಲ್ಲಿ ಟೆಸ್ಟ್ ಮಾಡಿದ್ರು ಈ ಡ್ರಗ್ಸ್ ಲ್ಯಾಬಾರೇಟ್ರಿಯಲ್ಲಿ. ಎಷ್ಟು ಸುಮಾರು ಒಂದು 300 ಟೈಪ್ಸ್ ಆಫ್ ಮೆಡಿಸಿನ್ಸ್ ಏನೋ ಟೆಸ್ಟ್ ಮಾಡಿದ್ವಿ ನಾವು. ಮಾಡಿದ್ರೆ ಈ ಡ್ರಗ್ಸ್ ಕಂಟ್ರೋಲರ್ ಲ್ಯಾಬಾರೇಟರಿ ಟೆಸ್ಟ್ ಮಾಡಿ 0.05% ಸುಪೂರಿಯಸ್ ಅಂತ ಗೊತ್ತಾಯ್ತು. ಅದು ಸಬ್ಸ್ಟ್ಯಾಂಡರ್ಡ್ ಅಥವಾ ಮಿಸ್ಲೇಬಲಿಂಗ್ ಆ ಥರ, ಇಟ್ ಇಸ್ ನಾಟ್ ಸೀಕ್ರೆಟ್ ರಿಲೇಟೆಡ್. ಸೊ ಈ ರೀತಿ ಗ್ರಾಹಕರಲ್ಲಿ ನಂಬಿಕೆ ಹುಟ್ಟುವಂಥ ಕೆಲಸಗಳು ಯಾರಿಂದ ಆಗಬೇಕು? ನಮ್ಮಿಂದ ಅದರ ಪ್ರಯೋಜನ ಇಲ್ಲ, ಡ್ರಗ್ಸ್ ಕಂಟ್ರೋಲರಿಂದಾನೇ ಆಗಬೇಕು, ಬೇರೆ ದಾರಿಯಿಂದ ಸಾಧ್ಯನೇ ಇಲ್ಲ. ಬೇರೆ ಯಾರು ಮಾಡೋದು ನಂಬೋದಿಲ್ಲ ನಾವು. ಸೊ ಐ ಆಮ್ ಕಮಿಂಗ್ ಟು ದ ಲಾಸ್ಟ್ ಪಾಯಿಂಟ್ ಆಸ್ ಫಾರ್ ಆಸ್ ಕನ್ಸ್ಯೂಮರ್ ಇಸ್ ಕನ್ಸರ್ನ್. ಒಂದು, ಈ ನಂಬಿಕೆ ಹುಟ್ಟೋದು ಹೇಗೆ? ವಿ ಆರ್ ನೌ ಲೂಸಿಂಗ್ ಟ್ರಸ್ಟ್ ಇನ್ ಮೋಸ್ಟ್ ಆಫ್ ದಿ ಪಬ್ಲಿಕ್ ಇನ್ಸ್ಟಿಟ್ಯೂಷನ್ಸ್. ಕೋರ್ಟ್ ಆಗಲಿ, ಎಲೆಕ್ಷನ್ ಕಮಿಷನ್ ಆಗಲಿ, ರೆಗ್ಯುಲೇಟರಿ ಅಥಾರಿಟೀಸ್ ಆಗಲಿ, ಕಮಿಷನ್ಸ್ ಆಗಲಿ, ಇವಾಗ ಡ್ರಗ್ಸ್ ಇದು ಯಾವುದು ನಾರ್ಕೋಟಿಕ್ ಡ್ರಗ್ಸ್ ಯಾವುದು NCB ಇದು ಭಾಳ ಚರ್ಚೆಯಲ್ಲಿದೆಯಲ್ಲ, ಅದ್ರ ಮೇಲಿದ್ದ ವಿಶ್ವಾಸನೂ ಹೋಗ್ಬಿಡ್ತಾ ಇದೆ ಇವಾಗ. ಯಾಕೆ ಅಂದರೆ ಅವರ ಆ್ಯಕ್ಟಿವಿಟಿ, ಟ್ರಾನ್ಸ್ಪರೆನ್ಸಿ, ಅಕೌಂಟಬಿಲಿಟಿ ಇವೆಲ್ಲ ಬರುತ್ತೆ ಅಲ್ಲಿ ಪ್ರಶ್ನೆಗಳು. ಸೊ ಡ್ರಗ್ಸ್ ಕಂಟ್ರೋಲ್ ಅವರು ಈ ಅಟ್ಲೀಸ್ಟ್ ಕರ್ನಾಟಕದಲ್ಲಿ ಏನು ಮಾಡ್ಬೋದು ಅನ್ನೋದನ್ನು ನಾನು ಯೋಚನೆ ಮಾಡ್ತಾ ಇದ್ದೆ. ನಾನು ಹಾಗೆ ಮಾಡಿದಾಗ ಅನಿಸುತ್ತೆ ಈ PMRU ಎಲ್ಲೋ ಇದೆಯಲ್ಲ, ಅದೊಂದು ಸೊಸೈಟಿ ಮಾಡಿದ್ದಿರಲ್ಲ, ಎಲ್ಲ ಸ್ಟೇಕ್ ಹೋಲ್ಡರ್ಸ್ ಇದ್ದಾರೆ, ಕನ್ಸ್ಯೂಮರ್ಸ್ ಇಲ್ವಲ್ಲ. ಫರ್ಗೆಟ್ ಅಬೌಟ್ ಎನಿಬಡಿ, ಒಂದು ಕನ್ಸ್ಯೂಮರ್ ಗ್ರೂಪ್ ಇರಬೇಕಲ್ಲ ಅಲ್ಲಿ, ಅಥವಾ ಕನ್ಸ್ಯೂಮರ್ ಆಕ್ಟಿವಿಸ್ಟ್ ಯಾರು ಬೇಡ, ಅವ ಕನ್ಸ್ಯೂಮರ್ನ ರೆಪ್ರೆಸೆಂಟ್ ಮಾಡೋರು ಯಾರು ಒಬ್ರು ಇರಬೇಕು. ಬಟ್ ಹಿ ಮೇ ನಾಟ್ ಬಿ ಹ್ಯಾವಿಂಗ್ ಮಚ್ ಕೆಪಾಸಿಟಿ ಟು ಡಿಸ್ಕಸ್ ವಿತ್ ಯು, ಬಟ್ ಸ್ಟಿಲ್ ಈ ರಿಪೋರ್ಟ್ ಇನ್ಪುಟ್ ಕೊಡೋಕ್ಕೆ. FDAಲಿ ಏನು ಮಾಡಿದ್ದಾರೆ, US FDAಲಿ ಕನ್ಸ್ಯೂಮರ್ ಡ್ರಗ್ ಮಾನಿಟರಿಂಗ್ ಆ್ಯಂಡ್ ಇನ್ಪುಟ್ ಯೂನಿಟ್ ಅಂತ ಇದೆ ವಿತ್ ಇನ್ ದಿ ಡ್ರಗ್ಸ್ ಕಂಟ್ರೋಲ್ ಅಥಾರಿಟಿ, ದಟ್ ಇಸ್ FDA. ಸೊ it is so trustworthy, but any consumer can go and give a sample and get it tested. ಆ ಥರ ಈ ರೀತಿಯಾದಂಥ ಕೆಲಸಗಳು ನಮ್ಮ ರೆಗ್ಯುಲೇಟರಿ ಅಥಾರಿಟಿಯಲ್ಲಿ ಆಗಬೇಕಾಗಿರುತ್ತೆ. ಬಹುಶಃ ದಟ್ ಈಸ್ ದ ಫಸ್ಟ್ ಅಜೆಂಡಾ ಯು ಹ್ಯಾವ್ ಟು ಡೂ ಅಂತ ಅನಿಸುತ್ತೆ ನನಗೆ. ಎರಡನೇದು, ಎಸೆನ್ಷಿಯಲ್ ಡ್ರಗ್ ಲಿಸ್ಟನ್ನು ಮಾಡ್ತಾ ಅದರ ಅಫೋರ್ಡಬಿಲಿಟಿಗೆ, ಅದರ ಅವೈಲಬಿಲಿಟಿಗೆ ಯೋಚನೆ ಮಾಡಬೇಕಾಗುತ್ತೆ. ಜನೌಷಧಿ ಇಸ್ ಒನ್, ಬಟ್ ದೇರ್ ಇಸ್ ಎನಿ ಅದರ್ ವೇ. ದ ರೋಲ್ ಆಫ್ ಪ್ರೈವೇಟ್ ಸೆಕ್ಟರ್ ಇನ್ ಹೆಲ್ತ್ ಕೇರ್, we cannot simply say no you go away ಅಂತ ಹೇಳೋಕ್ಕಾಗಲ್ಲ. They have done a lot of good job, particularly in the COVID-19 system. ಸೊ ಅವರ ಕನ್ಸರ್ನ್ಸ್ ಏನಿದ್ರಲ್ಲಿ, ಇದನ್ನು ನಾವು ಯೋಚನೆ ಮಾಡಬೇಕಾಗತ್ತೆ. ಹೀಗೆ ಮಾಡಿದಾಗ ಒಂದು, ನಾನು ಹೇಳ್ತಾ ಇರೋದಲ್ಲ ಅನೆಕ್ಡೋಟಲ್ ಅನ್ನಿಸ್ಬೋದು ನಿಮಗೆ, ಬಟ್ ದಟ್ ಶುಡ್ ಬಿ ಇನ್ಸ್ಟಿಟ್ಯೂಷನಲೈಸ್ಡ್ ವಿತ್ ಇನ್ ದಿ ಡ್ರಗ್ಸ್ ಕಂಟ್ರೋಲ್ ಡಿಪಾರ್ಟ್ಮೆಂಟ್. ಇನ್ಸ್ಟಿಟ್ಯೂಷನ್ ಅಂದರೆ ಒಂದು ಈ PMRU ಇದನ್ನು ಯು ಟೇಕ್ ಇಟ್ ಟು ದಿ ಡಿಸ್ಟ್ರಿಕ್ಟ್ ಲೆವೆಲ್. ಖಾನಾಪುರ ಹತ್ರ ಹೇಳ್ತಾ ಇದ್ದೆ ನಾನು, ಕ್ಯಾನ್ ವಿ ಟೇಕ್ this sort of programs in district level or even taluka level, where we can tell people that this is what your medicine availability ide illa, matte ee consumer grievances ಏನಿದೆ ನಿಮ್ಮಲ್ಲಿ ಅನ್ನೋದು. The last point is, because I am running short of time, we are having the Consumer Protection Act 2019 that has ಅದು ಈ ಅಫೋರ್ಡಬಿಲಿಟಿ, ಅವೈಲಬಿಲಿಟಿ, ಕ್ವಾಲಿಟಿ ಮೇಲೆ ಅತ್ಯಂತ ಹೆಚ್ಚು ಪರಿಣಾಮ ಬೀರುವಂಥ ಅಂಶಗಳನ್ನು ಹೊಂದಿದೆ. ಐ ಜಸ್ಟ್ ಫ್ಲಾಗ್ ಓನ್ಲಿ 2-3 ಇಶ್ಯೂಸ್. ಒಂದು, ಮೆಡಿಕಲ್ ಡಿವೈಸಸ್ ರೂಲ್ಸ್ 2017 ಬರ್ತಾ ಇದೆ. ಇಟ್ಸ್ ಅ ಬಲ್ಕಿ ಡಾಕ್ಯುಮೆಂಟ್. 5-6 ಸಲ ಓದಿದ್ರು ಇನ್ನೂ ಅರ್ಥ ಆಗ್ತಿಲ್ಲ ನನಗೆ. ಸೊ ಆ ಒಂದು ಅದರ ಎಫೆಕ್ಟು ಕನ್ಸ್ಯೂಮರ್ ಮೇಲೆ ಏನಾಗ್ತಾ ಇದೆ, ಡಿವೈಸಸ್ ಎಷ್ಟು ಕಾಸ್ಟ್ಲಿ ಇದೆ ಇವತ್ತು, ಯಾಕಷ್ಟು ಕಾಸ್ಟ್ಲಿ ಇದೆ, ಅದನ್ನು ಅಫೋರ್ಡಬಲ್ ಮಾಡೋಕ್ಕಾಗತ್ತಾ ಇಲ್ವಾ. ಇಲ್ಲಿ ಏನಾಗ್ತಾ ಇದೆ ಅಂದರೆ, ಈ ಬೆಂಗಳೂರು ಅಂತ ರಾಜ್ಯದಲ್ಲಿ ಅಥವಾ ಇಲ್ಲಿರೋರೆಲ್ಲ ನಾವೆಲ್ಲ ಆರ್ಗನೈಸ್ಡ್ ಪೀಪಲ್, ಇಲ್ಲ ಗೌರ್ಮೆಂಟ್ ಸೆಕ್ಟಾರ್ಲಿದ್ದೀವಿ, ಇಲ್ಲ ಯಾವುದೋ ಒಂದು ಒಳ್ಳೆ ಪ್ರೈವೇಟ್ ಸೆಕ್ಟಾರ್ಲಿದ್ದೀವಿ, ಎಲ್ಲರಿಗೂ ಇನ್ಶೂರೆನ್ಸ್ ಇದೆ, ಯಾರೂ ನಯ ಪೈಸೆ ಖರ್ಚು ಮಾಡಬೇಕಾಗಿಲ್ಲ. ವಿ ಡೋಂಟ್ ನೋ ದಿ ಪೇಯ್ನ್ ಆಫ್ ದಟ್ ಎಕ್ಸ್ಪೆಂಡಿಚರ್. ಅಫ್ಕೋರ್ಸ್ ಎ ಲಿಟಲ್ ಬಿಟ್ ಇರುತ್ತೆ. ಐ ಆಮ್ ಟಾಕಿಂಗ್ ಫ್ರಮ್ ದಿ ಪರ್ಸನ್ ಹೂ ಡಸಂಟ್ ಹ್ಯಾವ್ ಎನಿ ಆಫ್ ದೀಸ್ ಥಿಂಗ್ ಎಕ್ಸೆಪ್ಟ್ PHC ಆ್ಯಂಡ್ ಗೌರ್ಮೆಂಟ್ ಹಾಸ್ಪಿಟಲ್. ಇದು ಆ ರೀತಿಯಾಗಿ ಮಾಡುವಂಥದ್ದು ಒಂದು. ಎರಡನೇದು, ಆ ಕನ್ಸ್ಯೂಮರ್ ಪ್ರೊಟೆಕ್ಷನ್ ಆ್ಯಕ್ಟಲ್ಲಿ ಪ್ರಾಡಕ್ಟ್ ಲಯಬಿಲಿಟಿ ಅಂತ ಒಂದಿದೆ. ಅದು ಹೊಸ ಕಾನ್ಸೆಪ್ಟು. ಇಟ್ ಟೇಕ್ಸ್ ಟೈಮ್, ಐ ಡೋಂಟ್ ವಾಂಟ್ ಟು ಡಿಸ್ಕಸ್ ವಿತ್ ಯು ಟೂ ಮಚ್ ಇನ್ ಟೂ ಲಾಂಗ್, ಬಟ್ ದಟ್ಸ್ ಹೌ ಇಟ್ ಎಫೆಕ್ಟ್ಸ್ ದಿ ಕನ್ಸ್ಯೂಮರ್ಸ್ ಅಫೋರ್ಡಬಿಲಿಟಿ ಆ್ಯಂಡ್ ಕ್ವಾಲಿಟಿ ಆಫ್ ದಿ ಮೆಡಿಸಿನ್ಸ್ ಆ್ಯಂಡ್ ಮೆಡಿಕಲ್ ಡಿವೈಸಸ್ ಪುಟ್ ಟುಗೆದರ್. ಥರ್ಡ್ ಈಸ್ ಪ್ರಾಡಕ್ಟ್ ರೀಕಾಲ್. ಈಗ ಔಷಧಿ ಏನಾರ ಸರಿ ಇಲ್ಲ ಅಂದರೆ ಒಂದು ಬ್ಯಾಚ್ ನಂಬರ್ ಹಾಕ್ಬಿಟ್ಟು ನಮ್ಮ ಡ್ರಗ್ಸ್ ಕಂಟ್ರೋಲ್ ಅಥಾರಿಟೀಸ್ ಎಲ್ಲೋ ಒಂದು ಸಣ್ಣದಾಗಿ ಪೇಪರ್ ಬರುತ್ತೆ, ಇಟ್ ಹ್ಯಾಸ್ ಬಿನ್ ರೀಕಾಲ್ಡ್ ಅಂತ, ಅಥವಾ ಇಟ್ ಇಸ್ ಬ್ಯಾಂಡ್ ಅಂತ ಹೇಳ್ತಾರೆ. ಆ ಬ್ಯಾಚ್ ನಂಬರನ್ನು ಕಟ್ಕೊಂಡು ನೋಡಿ ಮಾಡುವವರು ಯಾರಿದ್ದಾರೆ? ಹಿಯರ್ ಕಮ್ಸ್ ಕನ್ಸ್ಯೂಮರ್ ಇನ್ಫಾರ್ಮೇಷನ್ ಸೆಂಟರ್ಸ್ ವಿತ್ ಇನ್ ದಿ ಡ್ರಗ್ಸ್ ಕಂಟ್ರೋಲ್ ಡಿಪಾರ್ಟ್ಮೆಂಟ್. ಈ ಥರ ಹಾಗೆ ಯಾರೋ ಫೋನ್ ಮಾಡಿದ ತಕ್ಷಣ ಮಾಡಬೇಕಂತ ಹೇಳುವಂಥ. ಇವಾಗ ನೋಡಿ, ಅನ್ಫಾರ್ಚುನೇಟ್ಲಿ ಈ ಮೊನ್ನೆ ಯಾವತ್ತೋ ಒಂದು ಸಲ ಹೆಲ್ತ್ ಆ್ಯಂಡ್ ಫ್ಯಾಮಿಲಿ ವೆಲ್ಫೇರ್ ಡಿಪಾರ್ಟ್ಮೆಂಟ್ ಅಥವಾ ಫುಡ್ ಸೇಫ್ಟಿ ಲ್ಯಾಬಾರೇಟರಿದ ಯಾವುದೋ ಒಂದು ಹೆಲ್ಪ್ಲೈನ್ ಕಾಲ್ ಮಾಡಿದ್ರೆ, ಕಾಲ್ ಮಾಡಿದ್ದು ನಾನು ಹೇಗಪ್ಪ ಮಾಡಿದ್ದು ಅಂದರೆ ಈ ಔಷಧಿ ಸಿಕ್ಕತ್ತಾ ಇಲ್ವಾ ಅಂತ ಕೇಳಕ್ಕೆ. ಆದರೆ ತೊಗೊಂಡ ತಕ್ಷಣ ಆ ಲೇಡಿ ಮಲೇರಿಯಾ ಬಂದರೆ ಮನೆ ಹತ್ರ ನೀರು ಬಿಡಬೇಡಿ ಅಷ್ಟು. ದಟ್ ಈಸ್ ನಾಟ್ ಮೈ ಕನ್ಸರ್ನ್ ಅಟ್ ಆಲ್. ಆವಾಗಲ್ಲ ನಾನು ಕೇಳ್ತಾ ಇರೋದು ನಮ್ಮ ಪ್ರಶ್ನೆಯನ್ನು ಕೇಳಕ್ಕೆ ಮುಂಚೆನೇ ಉತ್ತರ ಕೊಡ್ತಾರೆ ಅವ್ರು. ಬಹುಶಃ ರೆಕಾರ್ಡೆಡ್ ಏನೋ ನನಗೆ ಗೊತ್ತಿಲ್ಲ. ದ ಲಾಸ್ಟ್ ಈಸ್ ಓವರ್ ಪ್ರೈಸಿಂಗ್. ಕನ್ಸ್ಯೂಮರ್ ಪ್ರೊಟೆಕ್ಷನ್ ಆ್ಯಕ್ಟ್ 2019 ಓವರ್ ಪ್ರೈಸಿಂಗಿಗೆ ಸೆಂಟ್ರಲ್ ಕನ್ಸ್ಯೂಮರ್ ಪ್ರೊಟೆಕ್ಷನ್ ಅಥಾರಿಟಿ ಅಂತ ಮಾಡಿದ್ದಾರೆ. ಈ ಥರ ಓವರ್ ಪ್ರೈಸಿಂಗ್ ಆದರೆ ಇನ್ಮೇಲೆ ನಮ್ಮ ಕೆಲಸಗಳು ಕಡಿಮೆ. ಯಾರ್ದು? ಕನ್ಸ್ಯೂಮರ್ಸ್ದು. ಡೆಪ್ಟಿ ಕಮಿಷನರ್ ಆಫ್ ದಿ ಡಿಸ್ಟ್ರಿಕ್ಟ್ ಹೀ ಈಸ್ ಮೇಡ್ ಇನ್ ಚಾರ್ಜ್. ಅವ್ರ ಕೆಲಸ ಕಮ್ಮಿ ಅಂತ ಇದನ್ನು ಬೇರೆ ಸೇರಿಸಿದ್ದಾರೆ. ಬಟ್ ಏನು ಮಾಡೋಕ್ಕಾಗಲ್ಲ. ದಟ್ ಇಸ್ ದ ಲಾ. ನೋ ಹಿ ಹ್ಯಾಸ್ ಟು ಟೇಕ್ ಕಂಪ್ಲೇಂಟ್ಸ್ ಆ್ಯಂಡ್ ಫಾರ್ವರ್ಡ್ ಇಟ್ ಟು ಕನ್ಸರ್ನ್ಡ್ ಅಥಾರಿಟೀಸ್ ಫಾರ್ ಅಡ್ರೆಸಲ್ ಆಫ್ ಗ್ರೀವೆನ್ಸಸ್. So here comes the role of the regulator as far as Consumer Protection Act 2019 is concerned. Your responsibility increases, sir. You have to be very careful. You have to get up to the situation. So ultimately ನಾನು ಹೇಳ್ತಾ ಇದ್ದೀನಿ, ಒಬ್ಬ ಗ್ರಾಹಕ ಎಕ್ಸ್ಪೆಕ್ಟ್ ಮಾಡೋದು ಇನ್ಫಾರ್ಮೇಷನ್ ಅಬೌಟ್ ದಿ ಡ್ರಗ್ ಅಥವಾ ಮೆಡಿಸನ್, ಅದು ಎಷ್ಟು ದುಡ್ಡು ಆಗುತ್ತೆ ಅಂತ. ನೀವು ಕೇಳ್ಬೋದು, ಸರ್ ವಿದ್ಯಾರ್ಥಿ ಭವನದಲ್ಲಿ ಜಾಗ ಇರಲ್ಲ, ಸೊ ಅಷ್ಟಿರುತ್ತೆ, ಇನ್ನು ಔಷಧಿ ತೊಗೊಳಕ್ಕೆ ಯಾಕೆ ಕೊಡಬಾರ್ದು ದುಡ್ಡು. ಅಗ್ರೀಡ್, ದಟ್ಸ್ ಆಲ್ಸೋ ಎ ಪಾಯಿಂಟ್ ಇಸ್ ದೇರ್. ಮೂರನೇದು ಅವೈಲೇಬಿಲಿಟಿ ಆಫ್ ಮೆಡಿಸಿನ್ಸ್. ಈ ಮೂರನ್ನು ಮ್ಯಾಸಿವಾಗಿ ಕ್ಯಾಂಪೇನ್ ಮಾಡಿದ್ರೆ, ಬಹುಶಃ ಇಂಥ ಒಂದು ಸಮಾರಂಭಗಳು ಜಿಲ್ಲಾ ಮಟ್ಟದಲ್ಲಿ ನಡೆದರೆ ಜನರಿಗೆ ಅದು ಹೆಚ್ಚು ಮುಟ್ಟತ್ತೆ, ಅವರಿಂದ ಇನ್ನೂ ಹೆಚ್ಚು ಅವೇರ್ನೆಸ್ ಬೆಳೆಯುತ್ತೆ. ಅನ್ಫಾರ್ಚುನೇಟ್ಲಿ ಡ್ರಗ್ಸ್ ಕಂಟ್ರೋಲ್ ಮೇಲೆ ಕೆಲಸನೂ ಜಾಸ್ತಿ ಆಗುತ್ತೆ. ಸೊ ಲಾಸ್ಟ್ ಪಾಯಿಂಟ್ ಈಸ್ 40% ಆಫ್ ದಿ ಡ್ರಗ್ಸ್ ಕಂಟ್ರೋಲ್ ಡಿಪಾರ್ಟ್ಮೆಂಟ್ ಈಸ್ ವೇಕೆಂಟ್ ನೌ. ದಟ್ಸ್ ವಾಟ್ ಐ ಫೌಂಡ್. So that needs to be filled up as quickly as possible in the interest of consumers rather than in the interest of the government. Thank you very much. Thank you.
Sir. Thank you, sir. Thank you. It was a great talk. Managing Director, Managing Trustee of Great has given a great C badlu G substitute Martin, sir. It was a great talk. Thank you. I request Mr. Umesh, Deputy Drugs Controller, to present a potted plant to Shri Muralidharan as a token of remembrance. Certificate. Thank you, Mr. Umesh. Thank you, sir. Yes. Next, the manufacturers. Health is a fundamental need of every citizen, every individual in the society. Over the years, the pharmaceutical industries has ensured effective drug manufacturing. With a growing number of health disorders on the global level, this sector has evolved in producing medicines and drugs that improve quality of living. To talk on the subject, Manufacturers Initiative to ensure affordability and promoting Make in India, we request Mr. Harish Jain, President, Karnataka Drugs and Pharmaceutical Manufacturers Association, KDPMA, to kindly address the gathering.
Thanks, Mr. Bhaskaran. I would like to thank the Drugs Control Department, and especially headed by the Principal Secretary. Today, when we are talking about under the banner of 75 years of Azadi Ka, what we have done for last 75 years, And I think the previous speaker had told that there is a trust factor in every place. Sir, you can trust the pharmaceutical industry. Today, as a representative of the Indian pharmaceutical industry, and I will tell you how you can trust us with facts and figures. I think many of my seniors who were in trade and who have been senior for last 3 or 4 decades, when we were kids, like my father had a pharmaceutical distribution business. That time, I'm talking about early 80s. A tablet of ciprofloxacin manufactured by a multinational company, when the dollar price was 10 rupees a dollar, was costing 35 rupees a tablet. I'm talking about those days. And there was ofloxacin tablet by name Tarivid, was costing 32 rupees a tablet. Let us not go so far. We go around 10 years back. Plavix, it's a very essential drug, clopidogrel tablet, used to manufactured by Pfizer, used to cost 100 rupees a tablet. And I'll give you figures today. Same ciprofloxacin today, when the dollar price is 72, is costing around 4 rupees a tablet. Ofloxacin is around 7 to 8 rupees a tablet. The Plavix, the same Plavix manufactured by the same company, is costing around 8 to 9 rupees a tablet. This is the kind of benefit to the consumers and the availability, and in fact there is no problem with the availability, is what we have done as a pharmaceutical industry in last 75 years. Now starting with my presentation, now we talk about NPPA. I think NPPA is the agency which enforces the price control. Many of my industry colleagues has a misnomer, and when I always talk with them, I always say for NPPA, for the Indian pharmaceutical industry, is a strict and responsible father. Without NPPA, we will not survive. Against that onslaught of multinational companies, we will not survive. And NPPA is a strict father, and we should respect them. Next slide, please. Now, having said that as an opening remark, I would like to, next slide, please. Now, since 1947, what is the achievement of, next please. When we were independent, we had just got our independence. No, go back. Previous slide, please. Yeah, we were 100% importer of medicines, and from today, every part of this world, the medicines are supplied by Indian pharmaceutical industry. There is no country in this world which doesn't get Indian medicines. The domestic market has shifted from a multinational dominated to the Indian industry. We have not only made medicines available to the domestic market, but also to the global markets. The Indian industry has made medicines affordable to all, especially poor population in Africa, reeling under the impact of dreaded diseases like AIDS and malaria. Malaria is, if you're talking about during the COVID, the malaria is a much bigger disease than COVID in Africa. Helped by the patent policies of Government of India in 1970s and 80s, industry has not only grown in size, but also prices have fallen drastically, as I gave you the example of ciprofloxacin and all such things. Now, prices of essential medicine to Indian patients are amongst the lowest in the world and available everywhere in the country. In March 2020, we had plenty of, there was no shortage of any, March and April 2020, there was no shortage of any essential medicine in this country. But in UK, there was a severe shortage of paracetamol tablet. I don't know how many of you are aware of it. Can't they afford? They have huge amount of money. But then there was a shortage of paracetamol tablets, which is one of the most essential drugs, especially for fight against COVID. We never had that kind of a shortage. So when you talk about availability and accessibility, India is an example for the whole world. Next slide, please. Indian industry, the kind of role what we have played in making availability of quality and affordable medicine is unparalleled anywhere in the world. We are strictly following the price control for scheduled and non-scheduled formulations, even though there is no, we are the only industry. Our prices on inputs, there is no price control. But my finished product has a cap on the prices. And I'll tell you in the next few of the slides how the input prices have gone up. The cost of all essential medicines has remained the same, almost the same for last 5 years. Competition keeps prices low. Over 10,000 companies ensures that the prices remain low. This is the kind of competition what we have. Products are made available in the most remotest village of this country. The government of India may not have been able to reach every part of this country by electricity or the potable water, but we have ensured that the medicines are available everywhere. And what quality what you get in Bangalore or Delhi or metro cities, the same quality of the products is available in the most remotest part of this country. Companies regularly invest in upgrading of all the facilities of quality and still maintain the same prices. I talked about that ciprofloxacin, which was available at 35 rupees a tablet. During those days, there was no GMP guidelines. There was no pharmacopoeia. No pharmacopoeia specification. Today we have one of the most stringent GMP requirements anywhere in the world in this country, and we also have pharmacopoeia specification which is on par with the United States or the European pharmacopoeia. We are following all those things. And when we talk about Jan Aushadhi, the Jan Aushadhi project is largely supported by the supplies made from the private companies like us. And not only Jan Aushadhi, all the other healthcare initiatives of Government of India and state governments by supplying high quality products. Last but not least, what I want to say is during the pandemic, we have put so much of effort to bring the COVID medicines into this country at a very short time. But even during that time, the non-COVID medicines were not in short supply. Next slide, please. I think we can skip this because these are all the healthcare, I think, for the paucity of time. Next slide, please. Just a brief overview of what in last 75 years what the Indian pharmaceutical industry has done. Today we are third largest in terms of volume and 14th largest in terms of value in the whole world. Total market including exports are expected to grow to US $100 billion by the end of, I'm talking about Indian pharmaceutical industry, by 2025 and $130 billion by 2030 from current $42 billion in 2020. Strong domestic market of around $20 billion. Largest number of, India has the largest number of US FDA approved plants in the whole world, even more than what US has. This is what talks about the Indian pharmaceutical quality of the products which are maintained by the Indian pharmaceutical industry. High dependency on, we have high dependency on generics and off-patent, largest provider of generic medicines globally and expected to expand even further with many drugs going off patent, approximately US $250 billion, offering a great opportunity to Indian pharmaceutical industry. Exports to, as I said, we have exports to nearly 200 countries. We are powerhouse of vaccines. We are the largest, India is the largest manufacturer of vaccines anywhere in the world. Next slide, please. We have a strong, what are our strengths? We have a strong manufacturing base. Cost of setting up a production plant is 40% lower than anywhere in the Western countries. Cost effective manufacturing, labor costs are 50 to 55% cheaper than in Western countries, and overall cost of production is nearly 33% lower than US. Availability of high quality skilled force. We have a huge amount of skilled force thanks to the prudent policies of Government of India in promoting the pharmacy colleges and other national institutes of pharmaceutical education and research. We have a strong knowledge of chemistry and pharmacy, more than 50 years of experience in manufacturing. Next, please. when we talk about strengths, we should also talk about weaknesses, and that is where the Indian pharmaceutical industry today focuses on. We have a low investment in innovation and R&D. We need more PLI. I should congratulate Government of India with coming out with production-linked incentive schemes for manufacture of bulk drugs and other formulation. But then we also require the PLI kind of a scheme for R&D. Lack of resources to develop new chemical entities, which cost nearly $2 billion to develop a single NCE with a timeline of around a decade. Only top 20 to 30 companies are large enough to bear costs associated with sustained exports and comply with the entry regulations in the developed market. Low level of linkages between industry and academia. That is why I think this is a kind of a good platform. We have friends from the academic here, also so that we can work together and how we can bring the best of the medicines at the affordable prices to these masses in this country. Next slide, please. I think we have a lot of challenges. I think I will not go deep into it. Next slide, please. Yeah, this is the slide which I will probably would like to conclude. This is one of the biggest challenge today what our country is facing due to supply side disruptions. There have been huge, since the pandemic has begun, there has been a huge supply chain challenges what we have. Now that has related in the, I've given you just an example of around 30 to 33 molecules. For last 1.5 years, how my prices of the raw material or the API is increased. You take the classic example of paracetamol. The price has gone up from 250 rupees a kg to 900 rupees a kg today. And there is a supply issue itself. A simple product like glycerin, you can check the prices somewhere around from 56 it has gone up to 360 rupees. You have said that this is all the examples. So today the maintaining prices for my formulation, especially for the essential scheduled drugs, is a challenge. Availability will be a challenge. Essential drugs for government supplies, Jan Aushadhi and trade supplies, unless what we have been asking the government is that government should invoke para 19 of the DPCO. I'll be failing in my duty if in this forum I don't bring in this fact. We have been asking the government to invoke para 19 in DPCO to increase the price on a higher side. They have powers under extraordinary circumstances, and these are the extraordinary circumstances. If we don't do that, availability and accessibility is going to be a challenge in coming days. Next slide, please. Way forward, again, it's more of industry related. I don't want to what I can only think is we need to improve process efficiency and supply chain so that we can decrease cost and enable large scale manufacturing. Next slide, please. Next. I think we are almost to the end of my presentation. Only I think another thing what my fellow speaker had said was that we have been asking the government, like they have been concentrating price control on almost like 700 to 800 drugs. But most of these drugs which we talk about are falling in the bracket of 1 rupee a tablet or 5 rupees a tablet or something like that. Sri Amresh Tumbagi had mentioned in this country we manufacture product from 1 rupees a tablet to almost like 14 to 15 crore rupees a tablet. So why not we concentrate our time, strength and energy on that 16 crore rupees, bring down that prices, and we have been always recommending just to start with, why not we have like a drug which costs around say 5 rupees per dose. We should keep them away from the price control so that our energy is concentrated. See, most of us, what happens, as you said, as we age as 50 plus, the diseases started catching up. So what happens is we get into all those expensive medicine. One vial will cost you 5,000 rupees, 10,000 rupees. And the government of India has taken a right step by taking what is called as a trade margin rationalization. So this is probably is going to make the things much more better. Why not we concentrate on those medicines which really pinches your pocket rather than you like, say for example, like paracetamol tablet, I give you around 2013, it was costing around 2 rupees a tablet. We have brought down to 1 rupee a tablet, but on the overall terms we must have saved crores of rupees for the consumers. But then for an individual patient, how much we have saved? Would not have been better if you have talked from 1,000 rupees, we have brought down to 500 rupees. With that small thing, I'm concluding my talk. Thanks for the patient listening. Thank you.
Thank you, Mr. Harish. Thank you, Mr. Harish, for giving the insight of the pharmaceutical industry and the drug availability. I request Shri Nazir Ahmed sir, Deputy Drugs Controller, to hand over the potted plant and the certificate to Mr. Harish as a token of remembrance. One kind request, as we are running short of time, I request the further speakers to wind it up within 10 minutes, short of time. Now we have the pharmacists. Pharmacists play a key role in provision of effective health care by managing the medication therapy for patients to ensure medications are used in an appropriate manner to achieve health goals more effectively and minimization of cost. To talk on the subject, role of chemist or pharmacist to ensure availability of drugs to patient and consumers. We have 3 speakers from different sectors to enlighten us about the said topic. Let's start with Shri Ajay Reddy, Senior Marketing Officer, PMBI, Pradhana Mantri Jan Aushadhi Kendra. Sir, please.
A very good evening, one and all, and thank you PMRU Society and MPPA for giving me this opportunity to talk about the role of the chemist ensuring the availability of the essential drugs to the people. And so my name is I am myself Ajay Reddy. I am the marketing officer for Pradhan Mantri Bharatiya Janaushadhi Pariyojana. Here I am happy that both of my previous speakers mentioned about Janaushadhi, something about Janaushadhi. That is good to know actually. And I'll just brief about Janaushadhi and its achievements also, along with the role of pharmacist. As we are discussing about the affordability and availability of essential medicines to the public, that is, we have taken the main objective of our Janaushadhi, Pradhan Mantri Bharatiya Janaushadhi, that making the quality generic medicines at affordable prices, especially for the poor people. And this we have launched in the year of 2008 by the Government of India. But in 2015, we named it as a Pradhan Mantri Bharatiya Janaushadhi Pariyojana by our Honorable Prime Minister. Our main objective is to make the available products, quality generic medicines at affordable prices, to reduce the out-of-pocket expenditure for the end consumer. And also we are creating awareness about the generic medicines among the masses, and also to dispel the prevalent notion that low-priced generic medicines are of inferior quality or less effective, but it is not true. And also we are working on to ensure the availability of menstrual health services to the women across the country, and creating and generating employment by individually engaging the individual pharmacists especially to open the Janaushadhi Kendras as well. And currently more than 8,400 Janaushadhi Kendras are functional across the country, and we are having our basket contains more than 1,450 quality medicines which are procured from GMP and WHO GMP certified manufacturers only. And each of the drugs from each batch will be tested at laboratories which are accredited by NABL certification for quality assurance, and before being released into the market. And under Pradhan Mantri Bharatiya Janaushadhi Pariyojana, a medicine is priced on the principle of maximum of 50% and the average price of top 3 branded medicines in the market. So that is the reason we are able to serve the nation with the low price generic medicines, the quality medicines. And I like to highlight few achievements of Janaushadhi, that as I mentioned is ensuring the availability of menstrual hygiene products, that we have launched Janaushadhi Suvidha, that is sanitary napkins, that now it is available at all Janaushadhi Kendra, 1 rupee per 1 pad. So this is a privileged product for us. And it is since 27th August 2019, it is freely available all Janaushadhi Kendras. And 7th March every year, Janaushadhi Divas is being celebrated. In this celebration, we'll conduct variety of activities to propagate the scheme benefits, to create awareness about Janaushadhi also. And apart from Janaushadhi, the role of pharmacists, simply I'll just mention few words about this one. Today, most of the drugs actually which comes from the pharmaceutical companies in standardized doses as well as pre-packed forms. So things that, therefore, most of the people think that what is the necessity of the pharmacist, ignoring the fact that pharmacists are having more importance in the context of Indian healthcare system. But pharmacists has crucial role to play. In fact, pharmacists are remarkably underutilized and ignored, given their education, given their profession, or requirement to the community also. So the honorable courts have also underlined the importance of pharmacists, that a little mistake in the compounding or mixing or preparing the drugs also, it will may prove to be very fatal actually, and it cause very irreplaceable loss to the patients who are already suffering in that. And in a nutshell, I can say that pharmacist is a gatekeeper for appropriate medication management for the public, and we all should work together to establish and give the rightful position to the pharmacists in the society. And I am taking this opportunity to thank you all the pharmacists here and virtually attended. Keep up the great work. Thank you so much.
Thank you, sir. Thank you, Mr. Ajay. I request Mr. Venkatesh, Assistant Drug Controller, Headquarters, to hand over the potted plant as a token of remembrance. Thank you, Mr. Venkatesh. I request Shri Gangadhar Yavagal, President KPSC, KSPC, to talk on the same subject. Role of chemist or pharmacist to ensure availability of drugs to the patient and consumers.
Good afternoon, dignitaries on the dais and invitees. Today's topic is the role of pharmacist to ensure affordability and availability of essential drugs to patients and public. India is a country with a significant drug use problems. International and unnecessary prescribing is a common, and antibiotic resistance is widespread. These problems are because of variety of economic, social, political, occupational, medical and regulatory factors. The most important of these includes lack of awareness about drug medicines information center, availability of approximately 1 lakh plus formulations, lack of awareness of principles and principles of rational drugs, used drugs, doctors, pharmacists, widespread sale of prescription drug over the counter, despite these being illegal, and high level illiteracy, poverty among patients. Impact in quality of drug and therapy and medical care like ADR, adverse drug reactions increases with irrational prescription under dosage of antibiotics leads to the emergency of resistance, stain, etc. Friends, kindly excuse me, my health is not permitting to talk anything. I request our Deputy Registrar, please come and ask and read this.
Good evening, everybody. I'll just continue with Sir's talk. As Sir was explaining, due to lack of awareness about the Drug and Medicine Information Center, as well as there are a lot of approximately available more than 1 lakh plus formulation in the country. Lack of awareness about the rational drug use among the doctors, pharmacists, and widespread of sale of prescription drugs over the counter, etc. And again, impact on the quality of drugs is one of the major concern which we can see in the market. Impact on cost. So this is all certain issues which comes across the essential drugs supply. So when it comes to essential drugs, what is essential drugs? That is one of the major question which comes into the mind of a public. So essential medicines are those that satisfy the priority healthcare needs of the population. It also is very much important that it is selected based on the disease prevalence, evidence on the efficacy as well as safety, and comparative cost effectiveness. Even the essential drug list is one of the most important public health tools, and essential medicines are generally safe, efficacious, and cost effective. Already our previous speakers has expressed all these things in detail. The concept of essential drug list already one of our speakers has already mentioned. It was defined in the year 1975 and followed up in the year 1977, and the World Health Organization has brought out the model list of essential medicine book in the country. In 2001, the Karnataka State Pharmacy Council has published the essential drug list for the state of Karnataka through the World Health Organization Essential Drugs Program and Delhi Society for the Promotion of Rational Use of Drugs. So we were the first state pharmacy council to bring essential drug list for the state of Karnataka, and it was not further updated. It was only just in 2001 we were given to the state of Karnataka. And various importance of essential drug list, just I don't want to highlight much since the time is very short. In making a policy making, essential drug list is very important. Financing, procurement, distribution, quality assurance, etc. Again, coming over everything, rational drug use is the main motto of the essential drug list which is introduced. Coming into the affordability, when you speak about the essential drug list, it is one of the key dimension for access to essential medicines, and poor affordability delays access to treatment in health facilities. The concept of affordability is associated with the issue of unwanted expenditure. The provision of affordable and appropriate essential medicines is a vital component of well-functioning health system. Coming into the availability, already our eminent speakers has explained very in detail. Availability of essential medicines to the patient or the public is one of the challenging situation that has especially occurred during the last pandemic, the 2 years which we have already seen. But the COVID-19 outbreak has unearthed the new opportunities for the pharmacist. Community and hospital pharmacists have indeed played a key role during the COVID-19 pandemic, suggesting that a fully integrated intersectoral and interprofessional collaboration is necessary to face the crisis and public health emergencies. Pharmacies around the state were one of the few places that were kept open day and night for the public services even during the strict lockdown. So this is very appreciable for the pharmacist community. Community pharmacists and their teams were vital healthcare providers during this outbreak. They remain on the front line of the public health by serving as direct point of access for their patient, especially hospital, both private as well as government hospital, ESI, primary health centers, etc. also has played a key role in the COVID outbreak. Our pharmacists are ensured a stable supply of medicine, establishing close contacts with the pharmaceutical companies and manufacturers when necessary, and provided medicine supply such as home delivery of medicine for the elderly, comorbid patients, and very risky situation pharmacist himself has gone to the patient's home and delivered the medicine. There are very live examples which can be seen during the COVID time. So the pharmacists themselves has taken all the risk of their life and they served the community or the public. Preliminary emerging evidence seems to suggest that probably a new era in the history of pharmacy has begun, with pharmacists acquiring more professional standing, being authentic heroes and frontline health workers. Many of our registered pharmacists in hospitals, both private and government, retail, are serving as frontline COVID warriors and serving as a direct point of access to the distribution. Even the manufacturing companies, sir has already spoke, they played a major role in providing medicines and essential supplies in the top priority. Coming into the department, sir has already spoken, Tumbiki sir has already told, their service is very rememberable. During this COVID time, the Drugs Control Department of Karnataka has ensured the availability and supply of essential medicines very much in the state of Karnataka. The department was very great support to the actual cause of the COVID patient by opening a helpline control room at the time of that situation and also coordinating the supply of oxygen cylinders and various other medicines for the general public to the private as well as the government hospitals. Coming into the lastly, the role of Drugs Control Department as well as the Karnataka State Pharmacy Council, both Drugs Control Department and the KSPC should ensure that licensed registered pharmacists are physically present in the pharmacy outlets during the dispensing of drugs. This will improve the image of pharmacy profession and pharmacists in the society, and the public will identify them as a key person in the healthcare team. Not only that, the government should recognize, or the government has to recognize, the pharmacy profession and the services for the society of the pharmacists to the public. With conclusion, with these words, I sincerely thank on behalf of KSPC for giving, actually our president was not keeping well, so I just take this opportunity. Thank you everyone. Thank you once again.
Thank you, sir. I request Mr. Ramesh, Deputy Drugs Controller, to hand over the potted plant as a token of remembrance. Thank you, Mr. Ramesh. I request Sri Mahesh, member of the Chemist Association, to talk on the same subject. Time is running out. Can you please, as soon as possible, make it 5 to 6 minutes, please.
Good afternoon, ladies and gentlemen. At the outset, I thank organizers for providing a chance to address the gathering. I thank Government of India, especially NPPA, for giving me an opportunity to speak on the occasion of Azadi Ka Amrit Mahotsav. In India, there are 8.5 lakhs of chemists serving the nation by making availability of drugs in each nook and corner of the country 365 days a year without any financial assistance from the government. Chemists are the custodians of health next to doctors. We welcome the move of central government for launching the program of Pradhan Mantri Janaushadhi Pariyojana for providing affordable medicine to the needy with subsidy, but fails in making availability of the drug to nook and corner of the country. Unfortunately, these Kendras are selling generic other than the approved Janaushadhi medicines. We, the chemist fraternity, like to partner in selling Janaushadhi brands by making it available with conventional chemists across the country for easy access and availability to general public. We request the concerned authority to take necessary steps to make availability of Janaushadhi drugs in chemist stores. Given an appointment, we will come and meet you, sir. Till 2020, the supply chain of medicines were not disturbed and easy availability of medicines to the needy was ensured with the prevailing system. We manufacture indigenous. We supply indigenous. Retailers are indigenous. Now I have to talk the next problem, which is eating our head. Entry of online players with huge discounts in violation of rules. Pharma trade is affected if no action is initiated to stop the illegal sale of medicines through online, like FMCG products. Most of our conventional chemists will be forced to close their business, which in turn affect the easy availability of drug to patients and consumers. Only tech-savvy people can access the medication. Now, consolidation of pharma wholesale into the hands of very few countable corporates. From 1,000, let us take an example, from 1,000 to 5-6 people. This consolidation will ruin the entire wholesale setup. For cost cutting, corporate wholesalers are moving to the periphery of the city, which increase cost and time for the logistic and delivery and supply time. The whole supply chain was indigenous. By consolidating, one day finally supply chains will be controlled by multinational, whose motto is to make profit, not the service to the mankind. I request central government to closely watch these forces and make necessary amendments in law to safeguard indigenous flora of supply chain. On behalf of chemists, I request NPPA to consider the expenses incurred by chemists to run the store with while fixing the retail margins. Presently, it is around 15%, which is not sufficient for the efforts and time they invest to serve the needy patients. Thank you.
Thank you, Mr. Mahesh. I request Mallikarjun Nagur, Assistant Drugs Controller, to hand over a potted plant as a token of remembrance. Thank you, Mallikarjun. Next, we move on to doctors. Some heroes don't wear capes. We call them doctors. This one-liner said by an anonymous person is something we have felt at some point or the other in our lives. Indeed, doctors play a significant role in our lives. The absolute first and the last event of the human are both certified by the doctors at the maternity and the mortuary. A doctor is a person with extensive knowledge in the domain of medical science who applies and dedicates his knowledge to identify the medical problem faced by the patient and then uses his skill to prevent or cure it. To talk on the subject, doctor's role in promoting generic drugs at the affordable price, we request Dr. Prasanna HM, President, Private Hospitals and Nursing Home Association. Please, sir.
Good evening, everyone. I take this opportunity to thank Mr. Kanapure, Mr. Amrish Tambagi, with whom we had endless days of hard work during the second wave, and Government of India and Karnataka for bringing doctors into this forum, because I don't remember any one of us participating in your deliberations in the previous past. And all my friends who are here and who are online. I am here to talk, can I have the first slide please? The generic drugs and how doctors are to prescribe it, and what are the pros and cons of generic drugs. With sir's permission, I'd like to have a small survey. How many of you in this hall who are present here take any prescribed drugs on a day-to-day basis? It may be antihypertensives, antidiabetics, or for cholesterol, thyroid. If you can rise, see, I take antihypertensive drug every day. How many of people present here take, at least for your family members, how many of you buy drugs month on month, this life-saving drugs? Okay. great number of them. If I want to know how many of you buy generic drugs out of this, how many of you? When I compare to the hands raised, now it's nearly about 30% of it. See, we ourselves present here are not open to generic drugs because there is lot of awareness problem and assurance problem. So today's topic is mainly on affordability and availability, and it's a time we talk about generic drugs and the role of doctors in prescribing generic drugs, because that is a way forward. That's what we feel. Sir, can I have the first slide, please? See, world over, when we see in America or any forward countries which we see, like who are totally to the top of the level, 90% of the drugs dispensed in the dispensaries, hospitals and pharmas and chemists are generic drugs. I myself have worked worldwide. I have seen 90% of it is generic drugs, and it is clearly mentioned on the label what is the drug, what is the strength, and what are the side effects to be aware of for the patients. That is a kind of labeling it is done, and clearly it is dispensed by every chemist. They explain to the patients how it is to be taken. That's what happens in a developed world. And India, on the cusp of becoming a developed world, we have to look at this perspective in a fresh mind, and mainly the doctors, manufacturers and a lot of chemists are here. We have to come into a proper understanding so that we don't compromise with the outcomes what we expect from our patients. So this is a brief introduction on what is a generic drug and what are the pros and cons. Next slide, sir. So a generic is a medication that has all the active ingredients of a branded drug, but without a brand name. But it has the same therapeutic effect. That's why we call this as a generic drug, but without a brand name. That's a generic drug. And it has the same safety, efficacy, and the same side effects what has been mentioned in the pharmacopoeia for any branded drug. And generic drugs need not have the co-ingredients what a branded drug have, because that need not be there, but the safety and efficacy is the same as any branded drug. However, a branded drug can come in as a generic drug after certain amount of time elapses. Like usually it takes about 15 to 20 years after it is patented by FDA, it can come in as a generic drug. That's the present thing. And I think in the future that time may come down when the generic drugs can come at an earlier stage. So next please. The cost, the main advantage of a generic drug is the cost difference. A branded drug to a generic drug, almost the cost difference is about 5 times the cost of a generic drug. Like one of our speakers told, ciprofloxacin, a branded one, Cifran was the earliest brand which came, used to cost about 50 rupees. I was an house surgeon at that time. Now we get a generic brand for 5 rupees also. So that is a huge cost difference between both, and it makes lot of vast difference in a country like us. See, we may call ourselves one of the developed countries now, but our population is so huge. When we look at the numbers, even though it's a small amount, but when we calculate in few crores, it turns out to be few thousand crores. That's why the cost of every drug is important. And generic drugs do not have to spend money on R&D, because a fresh drug, when it comes as a branded drug, a lot of money goes into research and development. Then they have to do phase 1, phase 2, phase 3 trials in multiple countries. So millions of dollars are spent on these drugs, but the advantage for generic manufacturers is they don't need to spend on that. They have to spend only on the quality control. That's the advantage of being a generic manufacturer. Next, sir. So when we see anywhere from 30 to 90% it is cheaper, and the lower the cost of a generic drug, the more compliance with the patient. More and more number of patients are compliant because it will not burn their pocket. As an orthopedic surgeon, I write a medication for a month. When I write a big brand with a huge cost, not many people will take it for the entire month. Maximum they take is for a week. That's what I've seen in my 25 years of practice. But when I write a low-cost drug which is affordable to their pocket, they complete the course for 30 days and then they come for a follow-up. That is the main advantage of writing a generic drug, because it's more likelihood that your patient will take the entire course of suggested drugs. But I want to tell you some disadvantages where we can't write a generic drug. Ajay Reddy was here, he was promoting generic drugs, but there are certain circumstances when we are also constrained where we can't write a generic drugs, especially when it takes, like some drugs have a long patent period, those drugs can't come in as generic drugs, and the appearance of a generic drug may change from manufacturer to manufacturer, and sometimes for illiterate patients it becomes difficult for them to take the drug, because if they are used to a certain brand which comes in a certain appearance and size, because you get a lot of patients from rural public who just tell by the color and size of the tablet. So when we change the manufacturer, the appearance may change, and that may lead to non-compliance. And in India, at least by 2017, I'll tell you in my next slide, not all generic drugs are patented by bioequivalence studies. Bioequivalence is where we do a trial to prove that this generic drug has the same bioavailability in the blood as a branded drug. So what happened prior to 2017, all the drugs were not made mandatory to do the bioequivalence study. So it was flooded with generic drugs which were inferior in quality, which did not have the same safety standards as a branded drug. But at least in 2017, next slide please, we have a new law which makes it mandatory. I think Tambagis will agree that all generic drugs have to give the bioequivalence study so that their drug is also equally safe and potent as the main branded drug. Next please. So why generic drugs are not so popular in India, even though we are giving a huge push? Because a lot of people are influenced by brand names. We doctors are also responsible. We make them think that only branded drugs are effective, generic drugs are not effective. But that slowly it's changing. Lack of awareness, as I told you, not many doctors are aware about the efficacy of generic drugs. Even though like Cipla manufactures a generic drug, we look at it in a different way than a branded drug like Ciplox. So lack of awareness, quality issues, like I told, before 2017 there was no regulation. A lot of these generic drugs flooded the market, and that gave a bad influence on the doctors and on the patients both, because I have seen a lot of patients, especially diabetics and hypertensives, who are on long-term medication. When they went in for generic drugs, they had an issue of fluctuation of diabetes and hypertension, which is a lifestyle disease. So it becomes very important for us to ensure that all generic drugs have the same quality as a branded drug. And mistrust, this led, because earlier days what happened in the government supply chain, a lot of generic drugs used to come. So people used to take them home, but as I told you, there was no bioequivalence studies available for most of these drugs. They just compete on the source of being the lowest in the quotation. They get the tenders, they supply to the government chain, and most of these drugs were ineffective. So people think when you give a free drug from a government dispensary or a PHC, they think it doesn't work. So that needs to be gradually weaned out so that people know that the present day drugs are equally effective as a branded drug. And support by the doctors. See, doctors are influenced by many external forces. Pharma industry is one of them which influences doctors. But at the same time, we can't tell pharma industry is doing a wrong thing. Without the support of pharmaceutical industry, I can categorically tell 90% of our doctors can't afford to go for a training program or a higher education program, because we can't see only the doctors who are in the metros or in the cities. What about the doctors in tier 2 cities, 3 cities, taluka levels? They're all funded by the social initiatives by major companies, which gives them updated knowledge, makes them better, but at the same time the doctor has to be like Vaidyo Narayano Hari, they call him. So when we are at the cusp of writing what is required for the patient, we have to think what is essential for the patient in terms of his economic status, affordability. We have to be their family friend, see the size of the family, who is the breadwinner, how much they can afford. Then we have to make a decision of which drug to write. That's where we come into this one, because the patient doesn't know anything. He doesn't know about pharmacovigilance. He doesn't know anything. He will trust only the doctor. So what he writes is the, like we tell, is the gospel. It is the Bible. It is the Bhagavad Gita for him. So we have to be responsible citizens of India and a human being, and think in terms of humanitarian consideration, and then customize our prescription according to the need of the patient, not according to the need of the pharma industry. We have to be very sensitive in that. Next, please. So, you know, a lot of us spoke about COVID. COVID has put a huge burn in our pockets. A lot of people have gone below the poverty line. We had about nearly, it was about 35% of the rural population. Now it will go up to about 39 to 42% will go one notch below their earning capacity and become poorer. So this is where generic drugs plays a huge role, because 70% of a patient's expenditure, like one of the speakers told, of his earnings, sometimes goes to buying medicines. So when we write, we have to be responsible citizens and write what is affordable to the patient. This is where generic drugs make a huge difference to the affordability and also the availability of the drugs. Many patients and their families lose their lifetime savings sometimes, because in COVID also we saw few families, the whole family fell sick. Even if they spend 50,000 rupees per person, they had to spend about 4 or 5 lakhs for getting COVID treatment. If they didn't get a free treatment in the government, they lost a huge savings for the families. And this will affect our economic growth in the future, because you are spending a lot on the drug, you are losing your earnings, you are losing your manpower earnings, you are not productive. So this will affect the definitely economy of any country, and also the employment opportunities will come down, because somebody is constantly sick taking drugs. So the loss of manpower hours, the output of any economy will come down. Next, please. So the need of a generic drug policy is very important, because lack of access to essential medicines for especially non-communicable diseases. Because in India we have a program for tuberculosis, malaria, we have everything, but we don't have national programs for controlling diabetes, hypertension. These two are the major killers which kill the population, they increase the mortality rate. So we need proper policies and national programs, because I have seen not many people can take these medicines properly. That's why we see huge number of cardiac patients, huge number of renal complications ending in dialysis and people dying. So we need a national policy, and see to that either through Janaushadhi or through PHCs, these patients get regular supply of drugs to control their diabetes and hypertension, so that we save many lives. And not but the least, I would like to add 2 more things which is very, very essential. We need a policy for treating arthritis. Of late, we are seeing huge number of young patients who are getting affected by rheumatoid arthritis and ankylosing spondylitis, and these patients need lifelong treatment because there is no cure. So when somebody is earning about 20 or 30,000 rupees per month and he has to spend about 10,000 rupees to buy rheumatoid drugs, anti-rheumatoid drugs, he is losing 30% of his revenue. So we need a national policy for treating arthritis and osteoporosis. Osteoporosis is one of the major killers of people who are age 60 and above. Most of these osteoporotic fractures, especially hip and spine, 30% mortality in the next 1 year because they don't get treated properly. So we need generic drugs to treat these lifestyle diseases, especially diabetes, hypertension, high lipids, arthritis, and osteoporosis. So these things, if we can do, then we can call ourselves as a developed country. Then based on WHO essential medical concept, a lot of people who spoke on the national drug policy and essential drugs, that's been done. NPPA is doing a wonderful initiative in India because a lot of branded drugs have come under NPPA. People are able to afford even branded drugs at a lower cost. Only thing we have to have a caution is, I being an orthopedic surgeon, lot of our implants have come under NPPA, but somewhere we need to allow the new technology to come into the country. So we have to give a window of opportunity for newer implants and newer devices to come into the country. Who don't come under NPPA for a certain period of time. Otherwise, last 5 years I am seeing we are not getting any good newer implant or device into the country because these are all under NPPA. So that's one thing I request the NPPA to look into that and give a window of opportunity for newer devices and newer implants to come into the country so that we are not deprived of the latest technologies. Done last. So then we have the CDSO and National Pricing Authority. People have spoken about it. Next, please. So next one, you can just go to the. As we spoke about Pradhan Mantri Jan Aushadhi Kendra, we had only about 99 stores in 2014. Now we have about 3,000 and odd. I think by 2021 it has increased more. This is about the country. Yeah, now we have nearly about 8,000. Next, please. So these are the price which made a huge difference by getting generic drugs from Jan Aushadhi. Next. Next. Next one, please. Only one concern we have is there are two things. One is called as an NTI, narrow therapeutic index drugs. There are certain drugs, even a minor error can make a big change in a person's health. See, like digoxin, we have warfarin. So these are the drugs we have to be very careful when we go for generics. They need to be really of high quality standard drugs. And biological drugs have come in a big way now for anti-cancer treatment, anti-rheumatoid. Next, please. So they are called biosimilars because we don't call them as generic here. They are called as biosimilar drugs, and these biosimilars also have made a huge impact in this one. One example of teriparatide I will tell you. I was one of the principal investigators in 2004 when Eli Lilly introduced. Each injection was about 50,000 rupees per month, teriparatide, anti-osteoporotic drug. Now, because we have biosimilars, we are able to give at 4,000 rupees per month. It may come down in future. So this is a huge leap where our pharma industry is doing biosimilars, and we have a huge advantage over the branded, which was almost exorbitantly expensive. Next, please. So conclusion, I'd like to add that it's a huge opportunity to the pharma industry because the number of patients available in India are very huge because we are 1.3 billion. Then bioequivalence study and quality certification is a must for all generic drugs so that we can bring the confidence into the consumer and the doctors both. Awareness of quality assurance to doctors. Every prescription, every box of the batch should have the quality assurance certificate with that. Then effective implementation of policies by the drug controllers department, and accountability has to be fixed. If you all remember, Ranbaxy was fined about $500 million by FDA for failing to provide quality drugs, generic drugs in the USA. but we have not seen any such example in India so far. So I want the Drug Controllers Department to be more vigilant and bring them to books who are not following the quality standards. And as one of our friends told, generic drugs should be available in regular pharma in future so that it reaches more and more people. And last but not the least, lot of our chemist friends are here. Once we write the generic drugs, the doctor's role ends there. So you people are the most important people in the chain. When you dispense any generic drug, please be responsible while doing it. See to that these bioequivalence study and quality certification has been done to these drug manufacturers before dispensing them to the public. Because we just write the generic drug, but then the onus is on the chemist to give a quality product to the patient so that there is no problem to the patient. Level of our responsibility, and please do it as a sacred duty to human mankind and do your duty well. Thank you.
Thank you, Dr. Prasanna. I request Shri Kempaya Suresh, Deputy Drugs Controller, to present the audit plant as a token of remembrance. Thank you, Mr. Suresh. Next, academics. We are running short of time. The speakers, I request the speakers to wind it up within 5 to 6 minutes. Academics, in a globalized world, the role of research in an academic institution is significant for its sustainability and development, and it is imperative to have knowledge-driven growth based on the innovation. It is well accepted that academic research has contributed enormously to find solutions to many problems faced by our society and industry. There have been multiple instances where industries have turned into academics for finding solutions to vital issues. The need for sharing knowledge between the research institutions and industry has become increasingly evident. The emerging importance of interdisciplinary fields has given rise to institutional collaborations that allow knowledge to be pulled together. Often, it is the industry which is ultimate beneficiary. Needless to say, academic research is an integral part of the global development. To talk on the subject, involvement of academic in promoting research and innovation, out-of-box solution to ensure quality and affordable drugs, we request Dr. Salahuddin, General Secretary, Karnataka State Pharmacy College, Principals Association. Thank you. Dr. Sir.
Thank you. As present in the hall. It's very much unjustified because the mother of the pharma profession is going to be the academics. So I would like to say that I have been given 10 minutes. I am going to take additional 5 minutes of Mr. Vijay because he has spoken only 5 minutes. So please do allow me. I have been given a big task because I have to bridge it. That how the academics is going to, promote the research and innovation, and apart from that give the solution how we are going to provide or play an important role into providing the affordable medications. Well, you all have come across through the academics, the importance, the challenges, and apart from that you also know that with what time we are going across. Now in this scenario, I have been given a responsibility. I will take it very fast for you people, wherein we are celebrating the 75 years with the Azadi Ka Amrit Mahotsav, and I have been given the opportunity. Thank you. Next slide, please. Well, I'll be talking through the references. This is my disclaimer. Next slide. And I'll be talking on my topic, on three segments, that is how involvement of academia in promotion of the research and innovation, solutions to ensure quality and affordable drugs, and take home message. Within quickly I will be carrying out this activity. Please, next slide. Well, I'll be talking with my first segment, that how to involvement of the academia in promoting research and innovation. If you all know it, how the education system has been, and I do find that this pandemic has taught a big lesson not only to the business, apart from that it has given a lesson to especially to the institutions. The moment lockdown has occurred, we were not much prepared with the technology, and we are all still able to see that in the institutions we are still using the blackboard and chalk piece, and we have suffered a lot. And those institutions which have prepared well with the technology and have upgraded themselves from the blackboard classroom to the smart classrooms have survived. But now we have come to such a segment where the smart classroom also do not work at all. We need to have the e-classroom. We are talking about online classroom. We need to talk about the studio classroom, where you cannot force a student to come to the class. The student has the desirable activity of attending the class. In such a scenario, the institutions need to work on upgradation of their infrastructure with the technology. Today, Mr. Srinivas has said that the almost 200 to 300 people are attending over here in the classroom, that is in the hall, and there are around 3,000 plus people are watching online. That's the advantage of the technology. And this technology has to be brought into the classroom, into the institutions. If at all, if we wanted to upgrade our profession, when I am talking about industry which has upgraded 10 times fold, when we are talking about the community pharmacy services, when we are talking about the hospital, we are talking about clinical pharmacy industry where technology is being used. But when we are talking about teaching, we are still lacking behind. We are depending on the textbooks, where probably this is unjustified. We have to go with the time, and that's how I do feel that this is one area which the institutions needs to upgrade. And now innovation in the teaching methodology, that is what needs to be adopted. Creating research environment. Now we are talking about how to come out with the effective medications, cost affordable medications. If at all you wanted to come out of that, at the industry level it is happening. How it can be brought into those technology, tech transfer activity, it has to be taught. In our postgraduate programs, we are talking about research, but still research we are taking up of last 10 years back what has happened. We need to create an environment where the students need to be given an liberty where they can work on it and they can provide the research work. That's how the upgradation of the institutions are happening. This is one area which needs to be improved. Need to create startups and incubation center. Though the government of India is very fast in bringing up into the institutions through the AICT and other various agencies, creation of the startups and the incubation centers, but still due to the lacking of the technology, due to the lacking of the infrastructure facilities, many institutions, I can say to the tune of 80% of the institutions, still not in a position to go with time. I'm talking about time. Today's time is demanding that how much easy technology. When we are talking about e-pharmacy, when we are talking about online pharmacy, probably in future, we may not see the pharmacy stores. We have to agree. We may not see the pharmacy stores as it is been said. Now we have got the Ola service. How many of you know that where is the Ola office? But still you are getting the services. In future it is going to happen in a similar way. Probably you may see the pharmacies available at one place but operating at multiple places. That's how the technology is. We need to bring up in our institutions. We need to adapt to this change. We have to accept to it. That is where I do feel that we have to create the startups and the incubation centers, need to revise the syllabus. We are still reading, we are in the 1947. though the regulations have been revised, but the way the industry is getting, getting into change, that the way it is in a faster note, the syllabus is not being taught in a similar way. And I do feel that a regular revision needs to be done. And in this case, we need to have the interdisciplinary syllabus. When I talk about interdisciplinary, probably I do feel that we never heard about artificial intelligence. Artificial intelligence was limited only to engineering. The 3D technology was only limited to engineering segment, but probably this is going to be part of the pharmaceutical sector. When this is going to be part of the pharmaceutical sector, it has already been there, then it is must that we have to incorporate the same in our curriculum, and this revision needs to be done. Our Dr. B. Suresh, who is instrumental in bringing up this change, he was telling that recently, when an engineering interview was being conducted, the graduate was offered a package of 25 to 30 lakhs rupees. In a similar way, when a graduate pharmacy goes, probably he will be offered 3 lakhs, not probably 3.5 lakh. There is a big gap. And we need to go with technology in order to see that how valuable we become and how very important we become. I can only say in a simple way that we are giving the two-wheeler license to a pharma graduate and we are asking him to go and drive the four-wheeler. That is the difference. We need to upgrade it. We have to go with the time in order to see that the way the regulation is changing from the regulatory department, the industry is changing in a similar and faster way. We need to have a changes in our curriculum. Probably we had a decade to bring up these changes. We have to cut down the timeline, and we have to make it probably once in 3 years. This is much needed, and need to look for interdisciplinary and develop ready to employ graduates. Nobody is having time. Probably if the same graduate goes to Mr. Harish for the employment, he will definitely ask how much you are having the experience. And this is definitely, if I will be there in place of him, I will definitely ask that what is your experience. Nobody wants to have the fresher. Now what we need to have the curriculum is that we need to have curriculum where the students should get the education, he should also get training, he should also get the employment opportunity training. That's how a blended mode of activity is being required over here. And in this case, I do feel that the regulators as well as the industries can play a very important role. And there is a big gap between the industry and the academia and the regulator. Though every student becomes a regulator, every student of the pharma graduate becomes the industry, community pharmacy and the hospital pharmacy. But can we bridge this, the gap what is been available with bringing up the innovations, the ideas where these graduates who comes out becomes ready to be employed. And that's how in many of the forums I am talking about how to employ, how to make it a compulsion that the pharmacy graduate, when it comes out, he should be employed into the industry. It should be made mandatory, as the KSPC in his speech, Mr. Gangadhar Yavagal sir was telling that compulsion of the pharmacist has to be made into the community pharmacy or the hospital pharmacy. I also demand that there should be a compulsion of availability of the pharmacist into the industry. Right now, the science graduates have been made as the requirement, pharmacy or science graduates. Why don't we make it only the pharmacy graduate? Probably when the law was available, the pharmacists were not available. The amendment was being done. Now the output is large enough. We need to bring up the amendments into our D&C Act, where we can see that only the pharmacists should be employed even in the industry, so that it becomes a quality activity and helps in affordable, bringing up the affordable medications, and bring them in direct contact with the business practice models. As I said, when we have a project, most of the students in Bangalore gets an opportunity to go and do the projects, whether it is postgraduate. Now we also have the undergraduate projects where they get direct exposure of the industries. They get exposed of the activity that is happening in the industry. But the people away from Bangalore is not getting that much of opportunity. This needs to be done where if they get exposure of what technology is being used in the industry, probably 3D printing is going to be part of the dispensing, and how this needs to be implemented. probably they should get training, and they should also be, made to get aware of these technologies. I do feel so. Next slide, please. Now, what is the pillars of research? I do feel that small steps can make a difference. We all have to feel that in the education system, the research has to be part of it if at all we wanted to bring the quality and affordable medications. Here, the student made to be a driven force in order to carry out the activity. So at the institution level, probably few academicians have come. I must say that your activity related to the research becomes very much important in order to bring up the quality output product. When I say quality output product, it is nothing related to the medicine, it is related to the quality employee, the service who is going to give, whether it is in pharmaceutical industry or in regulator. Establishing support systems that can boost morale and enhance a positive research. They should have an environment where every time the discussion related to the research needs to be done. And this really helps in order to bring up the output, the research activity. And if you see the many of the Nobel Prize who gets in the medicine, they are majorly the professors or the researchers. They are not, many of them are the industries, from the industry. That means the research start from the educational institutions or from the universities. So here, most of the institutions which are working affiliated, they don't have that much of the facilities. Probably here, this gap can be reduced if the industries come forward and have a MOU and helps the institutions in establishing this research activity. Ensure everyone is on the same page, working with different fields, but having a collaboration makes a lot of difference. The one best thing today it has happened is that apart from the pharmacists, we have also seen one of the doctor who is also giving the, the insight of what is being required to, in order to bring down the cost of the price of the medicines. That is how we have to see that we have to ensure everyone is on the same page or on the same field. Research culture, cafes are an excellent way to share the best practice. Probably in the institutions, if you are having the, cafeteria, a place where you can create for discussion for the students or for the teachers or for the researchers. So such type of environment, if can be created, it helps a lot to bring out the best research and the molecules which can help in reducing the price. And I have seen already few of the universities have already started, like JSS, where they have the research cafes where the teachers goes, professors goes, out of their discussion, they sat and they start discussing to it. And that's how a different mindset will be there, where innovative ideas come, and that helps a lot for the research. And this is a major important organization, department and team leaders leading by example in promoting an excellent research culture. This is most important, where the heads, the researchers who are there, they should lead and they should set an example by encouraging their juniors in order to carry out the research activity. And discuss training gaps for all. This is where today, if we are sitting over here, it is nothing but the sharing of knowledge. And this is what it has been required even for the teachers, even for the professors. That's how the drug control department is doing its activity. Many of the industries are doing in order to, we call it as, some call it as the CME by the doctors, we call it as the CPE, that is continuous pharmacy education. So this type of activity, if it is being done, it helps a lot in improvement of the research activities. And we need to have the embedded research culture at an institution level. We need to have it. So next slide, please. Just last slide. Yeah. I do feel that in order to have it, the quality and affordable drugs, we need to have the encouraging for establishment of the IIPC, that is Institution Industry Partnership Cell. And in Karnataka, it has already started, where the Indian Pharmaceutical Association, along with the various, the industries, through the KDPMA, it has already been started, where few of the organizations have been called, and they are having the MOU so that there can be a mutual interaction. The gap what I am talking about, there is a gap between the industry and the institution, that can be minimized so that it helps in, bringing up the quality activity in order to come out with the affordable medicines. And concentrate more on implementation of pharmacoeconomics in clinical practice. With the advent and availability of the PharmD, I can say that we are working more on thinking about pharmacoeconomics, probably this is one area pharmaceutical sector was trying from its own marketing way in order to promote the medicine, but still with the availability of the clinical pharmacists in every hospital, probably another 5 years it may take, where I can see that we can work on it, and the clinical pharmacists like PharmD graduates or pharmacy practice people can play a very important role in bringing down the cost by directing, advising to the doctors that how best and affordable medications can be prescribed to the medications, and this competition definitely will help a lot in reducing the prices. And encourage to open Jan Aushadhi Kendra at college premises. Yes, this is very important when we talk about the Jan Aushadhi, which has been started by our Honorable Prime Minister, and as Mr. Vijay has said, probably we have got around 88,000 throughout the India. Now, I do feel that the Pharmacy Council of India has already instructed in 2019 to all the pharmacy institutions that in their premises, wherever the space has been available, they should open the Jan Aushadhi Kendra. This is one of the best steps been taken by the Pharmacy Council of India, and there are around 3,500 institutions throughout our country. And if these 3,500 countries, the 3,500 colleges in our country, if they take the initiation of establishing the Jan Aushadhi Kendra, we set an example by bringing up, the cost of the medicine and the competition where definitely the pharmaceutical sector will come down with the prices. And sponsored research programs at all levels for improved research activities. This is very much important, and I do feel, next slide please, that the institution needs to done. And I would like to conclude the curriculum update as per the demand. I told you the syllabus needs to be changed regularly, need to upgrade and bring more of interdisciplinary teachings. We need to teach about what is artificial intelligence, what is the 3D printing, and what is going to be the machine learning, and all these things we need to teach in our syllabus. That becomes very much important. Concentrate more on practice school teachings. The student needs to be trained, and apart from the coaching theoretical part, we need to teach them more of the practical part. That's how we are going to make up more effective level. Innovative and flexible academic programs, including an online education and digital education strategy. This is what it has been required. Now the multiple degree programs have come up. You cannot say that in 4 years you have to take only 1 degree. It's gone days. You can have in 4 years, you can have 3 degrees. No doubt the national education policy has its own way, but because of this online system, a regular program, one with online degree, you can have it. Such a type of the dual degree programs will help a lot to bring up the quality activity in the pharmaceutical sector. I do feel it. And prepare ready to employ graduates. This is where I do feel the institution, the regulators, and the industry people play a very important role. And I do feel that with all these things, we'll definitely make our professions to make it to the best. I would like to conclude. Thank you to with a quote, like I wanted to say that a modern tomorrow makes a better nation. We need to bring up a change. We have to accept the modernization with technology in our system, and also with the change that we are bringing up, whether in your job or in our academia, we have to accept to that change. I would like to conclude. Thank you to the Drugs Control Department, Drugs Controller, the Additional Drugs Controller, and to the PMRU Society as well as DCT Department, all the officials, and to all the attendees for patiently listening me for the 10 to 15 minutes. Thank you so much.
Thank you, Dr. Salahuddin, for your valuable inputs. I request Shri Onkar, Assistant Drugs Controller, to present the planted. Thank you, Mr. Onkar. Next, we are running short of time. I've been requesting the speakers to conclude it as soon as possible. Next subject will be the civic society. The civic society is an essential building block of development and national cohesion. In a country blessed with peace and stability, civic society fills this space untouched by the government and the private sector. In a fragile and conflict-ridden country, it plays a very important role of providing service, normally the responsibility of the state and business, and can lay the foundation for reconciliation. To talk on the subject, role of civic society, civil society, NGO in creating the awareness of affordability and availability of essential drugs, we request Sri Somashekar VK, Managing Trustee, Grah Shakti. Sir, please.
Respected dignitaries who participated in today's function, Mr. Kanapure, the drug controller, Mr. Ambrish, additional drug controller. Well, it makes me feel like I'm back at home. I don't know if I am a guest here or a host. The reason is very simple. My subject itself speaks like that. Basically, this drug control department, one of the regulators, we have been working very, very closely with them. And in 2013, on August 23rd, thanks to the dynamism of the drug control department and the principal secretary then, here the Dr. Jaga Shetty, I should remember, and the principal secretary was Dr. Madan Gopal. We organized an All India conference, which was remembered and spoken of in most of the conference whenever I went abroad, whenever I went to those places. The point I'm trying to make is NGOs, consumer organizations are willing to work with the system, and like it has happened today, I'm very glad, I'm not disappointed. I'm having the salad actually. All sorts of varieties of food has been served. The salad part of it, the ice cream, nice thing, of course nowadays most of them skip it, like it has happened here also. That salad part of it is left to me, and it definitely will taste the thing for you. The part that I am trying to make is the role of civil society organizations. As you all remember, Mr. Venkatesh, our additional drug controller Mallikarjun, they were part of this training program of all stakeholders in National Institute of Biological Studies in Delhi, Noida. For 2 days we spent a lot of time working out the system of how to conduct a massive national survey on spurious drugs and unwarranted this thing. At that system, we spent a lot of time discussing how synergy can be maintained with the civil society organization. Then we went with all the assistant controllers here. We went with them to the field. We learnt a lot. The learning process was happening. And as I was mentioning to you, in Karnataka, we are proud that the regulator is very proactive. We have plenty of interactions, and as recently as this thing, I'll tell you how we synergize into this. And my friend, closest friend and colleague, Muralidharan mentioned about accessibility, which I felt very essential, and I wanted to share a small anecdote. During this COVID time, I lost one of my best friends in the consumer movement. He was very close to me. We lost him. Just 1 week later, his father was sick and he was taken for black fungus. Suddenly I got a call from his brother saying that the medicine is not available. Forget affordability. It is to save a life now. Accessibility. We are not able to get the medicine. What do you do? They said the control department controls this particular thing. So can you influence to get this medicine? All strange kind of words, because I knew the drug control department. I said, listen, I don't think anything like that happens and all that, distribute, all that. But anyway, let me check it out, because saving a life is important. Then I called up Mr. Kanapure. First I called my very good closest friend, Khalid Ahmad Khan. And he suggested certain ways to go about it. Then I called the drug controller. He was proactive. He was very, he said, listen, Somashekar, you want it this way, please talk to so and so, get that organized. That was not, I mean, by the time I contacted some kind of technology, whatever, then I contacted drug controller Jagar Shetty. You wouldn't believe, within about say half a day, he had organized the thing. He said one manufacturer will call you, you will get the medicine. And it will reach that gentleman. It was a little late anyway, but it reached, so that it had to be replaced or whatever. Then it was given to him. So the question is how the synergy, how the meeting of minds. I'm not going to talk about the availability, accessibility, cost, all that factor we'll discuss another day. How NGOs working with the department makes us understand the situation, makes us come together as a family, makes us really vibrant and reach out to people. The basic thing that is required is capacity building. See, we learnt a lot of things. Today is a learning process for me. Every day is a learning process. We learnt a lot of things from different stakeholders. Huge points. In fact, I would request the organizers to share with us this material that was given to us. And we in turn will share whatever has to be done with the civil society organizers. Bear with me. I, on behalf of all 31 districts, including the new one, Vijayanagara, we got every district, we have got our representative. There, I mean, we can reach out to people. We are willing to work with you. Genuine, honest, passionate people are there. Let us discuss how to conduct surveys, how to work together, how can we make things happen. Our principal secretary coming from education, Mr. Anil Kumar, I hope he is also listening. And previously Javed Akhtar also, I had interacted with him pre-COVID times. And he was very interesting. In fact, I had an opportunity as a consortium of South India consumer organizations. I was invited to Kerala. I was there with that thing. Kerala had a lot of issues to share. And when they said Karnataka, their eyes brightened. They said, you have got a wonderful system there, sir. In the typical kind of thing. I was so delighted. I was so enlightened. So people across also sing. And we have also a learning process to happen. Tamil Nadu out there does a lot of activity with the NGOs on iodine. FSSAI is working very closely with our consumer organizations on iodine, reaching out to people and all that. So why not structure this? Why not institutionalize the programs? Why not include? See, for example, Silk Mark organization. All stakeholders are included. And like what Muralidharan says, I was there in the inauguration. We had been invited. We have worked with the Silk Mark organization. Consumers are not there. And recently, very recently, I met one of the senior officials of the Silk Mark organization. He said the biggest blunder we did was not involving consumer organization. You are a vital net we are a vital thing to the chain, and we missed you out. This realization comes only when they get hit. The consumer organizations that we represent are voluntary, are passionate people who are in different volitions of this thing. And all of you are involved in the civil society. So why not we synergize? Why not we work together? Why not we make opportunities into this thing, saying that reaching out to people? And one last thing that I would like to mention. Anand Kumar is a former Union Minister, Parliamentary Affairs and Chemical and Fertilizers. He's a very close, very good friend of mine for decades, family friends. So the day he did Jana Aushadhi, I happened to meet him. He mentioned one word. He was so shrewd, so very intelligent. He mentioned to me, he patted me, he said, "Are Somshekar, kidi hachipatidini, jwale madadu nim kelsa." Sir, artha aglilla. Re kidi hachipatidini re, jwale madadu nimdu. I said, explain to me. Then he called me. He said, "Ee kelsa jana aushadhi idiyalla, sumne idu agalla. ಗ್ರಾಹಕರು ಪ್ರಿಫರ್ ಮಾಡಬೇಕು. ಅವ್ರು ಮೆಂಟಲಿ ದೇ ವಿಲ್ ಬಿ ದಿಸಿಂಗ್ ಅದು ಸಿಗೋದಿಲ್ಲ ಅಂತಾರೆ, ಅದು ಸರ್ಕಾರ ಅದು ಮಾಡಬೇಡಿ ಅಂತಾರೆ. ಇದೆಲ್ಲ ಪಿಕಪ್ ಆಗುತ್ತೆ ಲಾಬಿಯಿಂದ. ಲಾಬಿಯಿಸ್ಟ್ I don't want to mention who they are and all that, in a collective last, this thing that I am going to speak on, they will prevent this to succeed. Affordable medicines alla idu madakagalla ರೀ ಇಂಡಿಯಾಲಿ. ಅದನ್ನು ತಗೊಂಡು ಹೋದ ಗ್ರಾಹಕರಿಗೆ ನಿಮ್ಮ ಕೆಲಸ ರೀ, ನಿಮ್ಮ ಡ್ಯೂಟಿ, ನೀವು ಮಾಡಿರಿ ಆ ಕೆಲಸನ. ಸೊ ಅಫೋರ್ಡಬಲ್ ಇದು ಎಲ್ಲಿ ಬರುತ್ತೆ ಅಂತ ಹೇಳಿದ್ರೆ, ಇನ್ವಾಲ್ವ್ ದ ಪೀಪಲ್ ಅಫೆಕ್ಟೆಡ್, ವಿಚ್ ಇಸ್ ಯು, ಮೀ, ಎವ್ರಿಬಡಿ. Involve them. Let us come together, work together. Then we can reach out. Same thing will happen 2 days now, workshop, pharmacopoeia vigilance ಇದ್ವಿ. ಬ್ರಿಲಿಯಂಟ್ ಇತ್ತು, ಎಷ್ಟೋ ವಿಷಯ ಕಲ್ತ್ವಿ. ದಟ್ಸ್ ನಾಟ್ ರೀಚ್ಡ್ ಪೀಪಲ್. ರಿಯಾಕ್ಷನ್ಸ್ ಹೆಂಗಾಗುತ್ತೆ, ಹೌ. ಆ್ಯಂಡ್ 2 days we took to cover ಪುಸ್ತಕಗಳು ಹೆಂಗೆ ಮಾಡಬೇಕು, ಹೌ ಟು, ವಿಚ್ ಲ್ಯಾಂಗ್ವೇಜ್ ಇಟ್ ಹ್ಯಾಸ್ ಟು ರೀಚ್, ವಿಚ್ ಇಸ್, ವಾಟ್ ಆರ್ ದಿ ಕನ್ಸ್ಯೂಮರ್ ಪಾಯಿಂಟ್ ಆಫ್ ವ್ಯೂ ದಟ್ will be troublesome. ಅದನ್ನು ಹೇಗೆ ಬಿಡಬೇಕು, ಹೇಗೆ ತಗೋಬೇಕು, ಇಷ್ಟು ಚರ್ಚೆಗಳಲ್ಲಿ ಬಂದು we had evolved some system. Unfortunately, what happens is the governments are hard pressed for time, hard pressed for their funds. Therefore, there is a disconnect. A disconnect ಆಗದೆ ಇರೋ ಥರ, I am happy that we are given a role here. Please, we will all work together and make this ಈ ಆತ್ಮನಿರ್ಭರ್ ಭಾರತ್. ಎಂಥ ಬ್ಯೂಟಿಫುಲ್ ಕೆಲಸ ಮಾಡಿದ್ವಿ ನಾವು ಈ ಟೈಮಲ್ಲಿ. ವ್ಯಾಕ್ಸಿನ್ ಕೇಸಲ್ಲಿ PPE ಕಿಟ್ಸನ್ನು ನಾವು ಚೈನಾದಿಂದ ಇಂಪೋರ್ಟ್ ಮಾಡ್ತಾಯಿದ್ವಿ. ಈಗ ನಾವು ವಿ ಹ್ಯಾವ್ ನಾವು ಪ್ರಿಪೇರ್ಡ್ ಫಾರ್ ಇಟ್. ಎಷ್ಟು ಕಡೆ ನಾವು ವಿ ಹ್ಯಾವ್ ಟೇಕನ್ ದಿಸ್ ಆಸ್ ಅನ್ ಆಪರ್ಚುನಿಟಿ, ಕನ್ವರ್ಟೆಡ್ ದಿ ಆಪರ್ಚುನಿಟಿ ಟು ಎ ಗೋಲ್. ಆ್ಯಂಡ್ ಟುಡೇ ವಿ ಆರ್ seeing in the world. All my brothers are in US. They say that what India has achieved is something brilliant. 100 crore people have been covered under vaccination. It's a brilliant program. Yes, no, Supreme Court case bandido and who fought and all that I know very well. That's a different issue. There is a point there also. But to reach out to 100 crore people is not a joke in this great country. We have tremendous potential. Our officials are excellent people. They have potentials. Leave out the black sheep. Like, as much as I speak with all due kind of this thing, I will have to tell you, there are black sheep within us also. I am not saying that we are absolutely pure and all that. Therefore, we as consumer organizations, please call us anytime. We will come with you, we will participate, and we can make this into a Bhavya Bharat. And the future is reckoning us. Let us do whatever best it can be done. Thank you very much for listening.
Thank you, sir. Thank you for your encouraging words. One more applause for patting us. Thank you so much. I request Srimati Yashoda to present the potted plant to Sri Somsekhar as a token of remembrance. Thank you, Srimati Yashoda. Now the technical session. Last speaker. Patient safety and affordable healthcare has emerged as major concern all over the world, and more so among the developing nations. India, a country with centuries old heritage of medical science, first became familiar with the modern medicine in the 17th century. There have been various developments in the healthcare sector in the post-independence era, but problems like higher population density, low socio-economic status of the significant number of people, and low intensity rate in some of the parts of the country have resulted in poor health indicators. In time to come, we hope to see a happy and healthy India. To talk on the subject, changing scenario of health sector for the past 75 years since independence and future prospect, we request our respected Additional Drugs Controller, Sri Amrish Sir, to present. Sir, please.
So, 75 years scenario, we are crossing a little time and I will try to finish it up a little early. So, auditorium nalliruva ella ಗಣ್ಯರಿಗೆ ಮತ್ತೊಮ್ಮೆ ನಮಸ್ಕರಿಸುತ್ತಾ. See, India's healthcare system, if you go to the ancient India, what was the mechanism of treatment, how it was being taken forward. I wanted to say within one or two sentence. See, if you go through ancient India, Vedic period, what was the system? Earlier it was an Ayurvedic. Charaka was the physician who worked in King Kanishka's court, and he was considered as a medicine father. At the same time, Susruta, he made it as a surgeon who is considered to be an healing, who gave an healing factors. Thereafter, if you come to the Buddhist period, Lord Buddha himself was involved in treating patients. He established several Buddha viharas where hospitalized and sick people were treated. Afterwards, if it comes to the Akbar period, we have seen Akbar always greater affinity towards amalgamation of Unani and Ayurveda. He made it in a bigger way, and thereafter, if we come to the 19th century, we have where missionaries were working as nuns and monks were trained in it, and churches were being a part of our hospitals. It has been treated in that fashion, and they have been learned. And if you come to the pre-independence, India was then a bigger way. It was been developing in a hospitals were there during Maurya's period also, and now also. So thereafter, after post-independence, we comes to know that we have several policies have came out. When British left out, we have made government of India has made a ministry for the health and family welfare. Thereafter, during 1950, we have made a planning policy to within the available resources to address the health system. In 1956, during Constitution, it was given a bigger affinity to the citizens that health is a constitutional rights. Thereafter, in 1983, we made health policies, and 2000 and after 2000, and where we made it an universal health package system, and 2002 it has been given. Now it has been taking place. Today's budget, we are crossing around almost more than 1 lakh crores of rupees on the union government itself. So basically, so now in India, health is considered as a state subject, and state subject is addressing in a bigger way. So that is with respect to, if you consider how the hospital were treated. If you consider the affordability and availability of drugs, as our KDPM President Dr. Harish Jain said, there was no drugs in India when it was being allopathic drugs, especially when there was not there. During that time, it was to be imported. So afterwards, government of India made an industrial policies, 1956. During industrial policy, it made first Bengal chemical and pharmaceutical industry was started. Thereafter, it was started HAL, then IDPL. Like this, they have made 5 institutions. At the same 5 institutions, along with other institutions which were there. Now, believe it or not, after when I going through the research, reviewing literatures, I saw Alembic was started in 1907. Jandu was started in 1902. See, there are several pharmaceutical industries which have been coped up to make available of drugs. So not today. During that time also, with limited resources, they made that. We must be thankful for those people who contributed, and we made big industrial gap of making availability of drug. It's not that today we have a lot of resources where we can do it. If you go through the literature review, we have seen, though Ayurvedic drugs were manufactured, some of the drugs were manufactured in outside the India, raw material were being imported and formulation were converted and came back to the India. That was the system. So if you consider, so today what we have seen is we are extremely in a bigger side now. The availability of drug is concerned and affordability is concerned. If you see, so why? Because what has happened during 1970, we made a patent act. Thereafter, we made 2005 amendment to the patent acts. We made DPCOs. See, these are all the milestones where we made affordability of the drugs. So today, if somebody is not trying to give a license of one product which is required for India, we have a compulsory licensing powers. An ex-factory which is having a patent on the Y product, if JED wanted to produce in India, if it is needed for India, we have a compulsory licensing system. That has been enlightened, it has been taken care of in the Patent Act. That IPR activities has been cut down. So today it was a process patented, now it has become a product patented. With IPR, which has been supposed to be considered for 15 years, now it has been reduced to 7 years. Like that, in the same way, DPCO, if we consider during 1995, there are only 84 APIs were there, where there were a little margin of affordability was to be made out. Now, we have during 2013, we have a market-based activity, where today we have made around 800 drugs affordability. Apart from that, there is one more exercise has been made, exercised under Paris, this thing. So where a TMR activities has been made. That means a trade margin rationalization has come. Trade margin rationalization is a one thing which has made all products reasonably available and affordable also. So when I saw some of the medical devices, if you see, trade margin rationalization, if you see 5 products, especially oxygen concentrators, glucometers, nebulizer, BP, and oximeters. The cost of the drug, if you produce it, if you see, so imported items, which was in oxygen concentrator, which was selling at 1,30,000 rupees, now it is selling at 84,000. That means the cost of the drug has been reduced from 1,34,000 to 84,000. That means around 70% of the drug cost has been reduced. If you see oximeters, the same way it has. See why I wanted to, because some of the manufacturers are here, some of them are logged in, and why I wanted to tell you is the importance of trade margin rationally and ceiling price. Trade margin rationalization has came into the picture because a medical devices, one manufacturer will not be the same with others. It has got entirely activities are different. There we cannot make as in this thing. At the same time, whereas in case of drug, we can make in a ceiling price. For example, drug eluting stents, it is the same. That we converted into a DPCO under ceiling price. Whereas oximeters, we have not converted because oximeters of one companies are different and their technology is different, other person technology is different. It depends upon, at the same time, government has protected everybody's interest in that. So government has seen that, see 70% after a lot of deliberation with the producers and the consumers, it has been brought out to 70% to be given to the manufacturers or importers who first sellers. In the same way, if you see the quantity of our drug manufactured, if you see the DOP annual report in 2021, around 2,89,000 crores of drugs have been marketed. Out of that, 1.46 lakhs crores has been exported. So I am really surprised. Still, we are not in a position to accommodate all drugs, though our export is more than the drug we manufacture. If you see the report, around 50 lakhs thousand of drugs still we are importing. So that means we need to address some more gaps in that. We need to take forward bigger way. So what is the, now we have came to the drug which we could able to make it out easily available and affordable also. At the same time, which are not been manufactured here, we need to make it all also. I request a way forward activities here is IT based newer technology has to be developed. It is not that today's health tech activities does not restrict to only an pharmaceutical industry or medical device, vaccine or drug formulations. It needs to go to the procedural aspects also, where we require a lot of information technology, a computerization activity is required for even for operations also. It is not that today by people are treating several patients by treating on an by e-hospital activities. Government has encouraged everybody in e-hospital activities. We require a lot of e-data also. It may be a confidential that one somewhere we need to have an data maintenance and data protections. At the same time, we need to have an what Salahuddin sir was telling. So AI and machine learning has to be put into place. We need to take care of it. So the future plan of a prospective activity is a game changer in the system is only a new technology has to be reduced, has to be put in place. If, for example, if a paracetamol tablet somebody is manufacturing at ₹1, you need to reverse it, whether it can be reduced back to the lesser rate. That also be done by them. Not that now we are giving at ₹1, we could stand here only. It's not like reducing cost of it, it is also making affordability of that. And another one thing is strengthening has to be, a policies has to be developed between an ease of doing business and safety and efficacy of the drug. See, with this, last 75 years, Government of India has brought bigger way in the production of pharmaceutical products and medical devices, and also in a bigger way with all vaccines. So if you see the amount of vaccine manufacturing speed, the amount of technology we have brought, India is not in the same way. It has been, turbojet activities has been done in bigger R&Ds. See, today we have in 3 companies, Karnataka itself wanted to manufacture vaccine required for a co-vaccine. I mean, Covaxin is one of them. We have a Sputnik, we have one unit for somebody and another one unit for somebody. So these are all the things Government of India and Government of Karnataka has made best possible for the affordable drugs and make it available also. When there was a scarcity of the drug, Government of India took over that and we made a rationalizing system. At the same time, we saw that people will not be affected. A needy patient has been given. A blackmailing system is to be cut off that. In spite of that, good and bad are there everywhere. We have already also addressed it. So when, at the end of the day, I wanted to say, after 75 years, India has made bigger changes. From Ayurvedic to modern medicines may not only for self-sufficient, it has also started to make exporting activities also. We made a quality drugs. Today, our inspections are not being done by only state controller. It is done by central. It is also done by foreign regulators of regulated market as well as emerging market also. We have seen several units which have been approved by them. We have also taken care of them. It's a matter of pride that Karnataka Drug Manufacturing Association has put a bigger safe in the global activities. Today we have manufacturing around the amount of quality of the compared to Government of India's this thing, we are in the 5% of our stakeholders. 10,500 manufacturing places, we have in around 406 places units here, around 430 we have in manufacturing loan licenses. At the same time, if you see, we have an innovative activities in Karnataka. See, if you see the biotechnology, we are in a pioneer. Today, one is in Bamsandara, another is towards Kolar. We have several. Now we are coming with biotechnology in Dharwad also. We have seen some of the big companies, yesterday some of the big companies have applied here a loan license. It's a matter of pride that government drugs manufactured in Karnataka has got biggest rating activities in the global activities. Because one man, when I was granting a license to GSK, who has been withdrawn for some other personal thing, he was telling me that if somebody wants to come to start any industry, any one location, it is not that only a subsidy or anything. It also includes all industrial friendly activities. It is not that only for certain activities it is to be done. It has been done in a bigger way. A licensing facility, it may be an licensing facility, it may be an allocation of the land of facility, it may be an conducive activities for this thing has to be done. At the same time, Government of India, if you consider 75 units, we brought up lot of things. It may be a Pharma Vision 2020, it may be a BRAC, it may be an ICMR, it may, lot of research activity has been forced. Today, Covaxin has came because of the ICMR and Bharat Biotech coalitions. See, the Government of India is also assisting in technology driven, procedure level and all others. It is a matter of pride that Government of India and Government of Karnataka has done best of its best to make our affordability and availability of drugs. In spite of that, certain things which we have to address, I am really thankful to all stakeholders who have really given a bigger enlighten there what it is ground reality. We need to address it. We will address it, sir. Thank you. Thanks a lot.
Sir, thank you so much, sir, for such a detailed information about the entire range of pharmaceuticals and the government policies. Maybe we need a bigger session for this, bigger deliberations to understand the reality of this. I request Shri Sunil Atavar to present a potted plant to Shri Amrish sir as a token of remembrance. Thank you, Mr. Sunil Atavar. Sir, sir. There is a small announcement. We are coming to the end of the technical session. There is a small announcement. And see and give you prizes for the person who answers the correct answers. Today quizzes are interactive platforms where participation will not only fetch you prize but also gain knowledge. It's a form of revision and learning from whatever you have learned from this session. I request Sri Sunil Chiplankar, Vice President, Group Pharmaceuticals Limited, to present the quiz. Sri Sunil Chiplankar contribution in organizing this program is really commendable. Please put on your hands. Thank you, sir. Thank you for all the support. Please take over.
Thank you very much. So don't worry, this is not going to be a longest session, and all of you are going to smile a lot in this session. I first request Mr. Amrish sir to come over, because you will have to, I request my colleagues there to please give the slips which I have given. My colleagues, please give the slips. Okay. So the quiz format is very easy. There will be only two questions. Okay. Now you will have to answer the quiz in the slip of paper which we are giving, and that will be collected back, and there will be a lucky dip for that also. So there is no rigging anywhere, no match fixing. So question is also unrigged. The winner will also be through lucky dip, provided he has given the right answer. So sir, we will do a dummy trial. So first you pick the question. Okay. So this is a dummy question. If you want, you can read it loudly.
Why was the one popular multi-fold ingredient PPA?
Okay. So what he has read out is, why was the popular anti-cold, anti-cough ingredient PPA banned? So the slip is coming to you. Now don't write for this. This is a dummy question. You have to write the answer and fold the this thing. Write your name also and if mobile number. So please give two slips to each person. 2 slips to each person. So please pass on the slips. It will be done very fast and they will collect back the slips and there will be a lucky dip and the person who has answered the correct question and on lucky dip he will get the prize. So I think we can go now. Bekotpode. Everybody is fidgety, restless, hungry. They have not gone to the restroom also. So everybody is very, very. Harish Jain sir, 99.9 percentile. Take the sheet. Hello, you report. Okay. So first question. Sir, first question. This is all reals, not dummy. First question. So you write question 1 on the sheet. Okay. Generic drugs have gained popularity thanks to Janaushadhi concept. What should the pharmacist advise the patient who is purchasing pantoprazole? Okay, so pure pharmacist question. Don't whisper the answer to anybody. Write down in the sheet of paper. First write 1, that is the first question, and write the name of your name and then write the answer. Now if a person is dispensing pantoprazole, he is supposed to give one good advice, the best advice regarding pantoprazole. So what is that? That is what you should know. Harish Jain sir already knows, he has already written. I request question number 1 cover alli collect madಕೊಳ್ಳಿ. Hello. Question number 1 ಅಲ್ಲಿ collect ಮಾಡ್ಕೊಳ್ಳಿ. Very good. Amrish sir has correctly reminded me, what if a person is answering online in YouTube, we are already watching who are the persons who are responding. The first person who gives the right answer, we will be couriering him the lucky dip gift. Sorry, the gift. Okay, so I am again repeating the question. Please answer the question and give it in to the volunteers. The volunteers will put it in packet number 1. Please put it in question number 1. Don't mix up. There are only 2 questions. Packet number 1 and packet number 2. So put it in packet number 1. I'll read the question again. Generic drugs have gained popularity thanks to the Janaushadhi concept. What should the pharmacist advise the patient who is purchasing pantoprazole? If a patient is purchasing pantoprazole, you are supposed to give one advice. So let us see who will answer the right point in that. Well, Bhagoji sir has come right on time. Amrish sir, your telepathy is fantastic. Bhagoji sir, please for the second question. Sir, improve Bhagoji sir, he has taken the first question. Okay. Now let us see for whom the second question will be. Lucky. Somebody. Question ಬರೆಯೋದು ಬೇಡ. ಒಂದೊಂದು ಬರೆದ್ರೆ ಸಾಕು. ನಾನೇ ಓದ್ತೀನಿ ಬಿಡಿ ಸ್ವಲ್ಪ ದೊಡ್ಡದಾಗಿದೆ. Okay, don't worry. Okay, question number 2. Online viewers also please make a note of it. Question number 2. Bhagoji sir has taken one long question. Of course, the question was created by me. Pharmacist counseling is vital for patient well-being, correct? That is what we are emphasizing. Where is Mahesh, Yasho Pharma? A patient is regularly taking diazepam. Okay, listen carefully. A patient is taking diazepam regularly, but after taking it frequently for a few days or a few weeks or a few months, he is saying the product is not that effective as it was in the first dose. But the pharmacist says, and so the patient is feeling he is addicted. But the pharmacist is saying some other technical word to describe what it is. So 2-3 people have got it. You please write down the right answer there in the, put it as question number 2 and write your name, please. Write your name in both the chits, not just one chit, because it will go to 2 separate packets. So what is that phenomenon because of which the drug probably is not eliciting the same response? We call it something, one particular technical word we pharmacists say for that particular phenomenon. You keep taking a drug for a long period of time, it doesn't produce the same response. That is called something. What is that? So think back, it is something very nice, it's a good word. So only two questions because of paucity of time. Packet number 1 ready idre tanbudi. Packet number 2. Packet number 1 ready idre tanbudi. Packet number 2 ge contributions of answers tagobidi. Cash gish hakbedi, bribe doesn't work here. I am very strict, no rigging.
Sir, hello.
Yarappa,
we are receiving the reply from the online also.
Yes, yes, sir. Online alli ನೀವು first person ಯಾರು correct ಉತ್ತರ ಕೊಡ್ತಾರೋ ಅವ್ರ ಹೆಸರು ಬರೆದುಬಿಡಿ ಅಷ್ಟೇ. I will take care of the rest.
So for second question also.
Sir. Okay. Very good. Thank you. So one good thing is engagement is happening from the online also. Congratulations to both of you for a fantastic and a very successful hybrid event. So one is closed, the packet has come here, and one of them, Amrit sir is the first question, so he'll only pick the lucky dip, or we'll cross it. We'll make Bhagoji pick the lucky dip, and for him you pick the lucky dip. Is it okay, Amrit sir? Packet 1, I am taking it for lucky dip. Is it okay? Packet 1, question number 1. Tago, question number 1, aur tago bodo. Question number 1 matra kodi. Question number 2 ಆಮೇಲೆ ಕೊಡಿ. Question mix ಮಾಡಬೇಡಿ. Question number 1 ಇದ್ರಲ್ಲಿ ಹಾಕಬೇಕು. Question number 1 ಎಲ್ಲರದು ಬಂತಾ? Can I give it for lucky dip? Question number 1. Question number 1 ಟೈಮ್ ಆಯ್ತು ಬೇಗ. ಫಾಸ್ಟೆಸ್ಟ್ ಫಿಂಗರ್ ಫಸ್ಟ್ ಫಾಸ್ಟ್ ಇರಬೇಕು ಅಂತೀವಿ. ಅದು ನಡೆಯಲ್ಲ ಅಂದ್ರೆ ಅಷ್ಟೇ ಕ್ಲೋಸು. ರಾಂಗ್ ಇದ್ರೆ ಎಲಿಮಿನೇಟು ಅಷ್ಟೇ. ಲಕ್ಕಿ ಅನ್ಲಕ್ಕಿ ಫೆಲ್ ಅವರು ಇಲ್ಲ ಒಂದ್ಸತಿನೇ ಒಂದೇ ಪ್ರೈಸು. ಆರ್ ವಿ ಕ್ಯಾನ್ ಡೂ 2 prizes 3 prizes ನೋ ಪ್ರಾಬ್ಲಮ್. ನೋಡೋಣ. ಓಕೆ ಸರ್. ಇದು ಪ್ಯಾಕೆಟ್ ನಂಬರ್ 1 ಯಾರು ತಗೋತೀರಾ? ಚೇಕ್ ಮಾಡಿ ಆಯ್ತು ನೋಡ್ಬಿಟ್ಟಿದ್ದೀರಾ. ಈಗ ಆನ್ಸರ್ ಏನು? ಪ್ಯಾಂಟೋಪ್ರಜೋಲ್ should be taken before. ಗುಡ್. ಕೈ ಕೊಡಿ ಪ್ಲೀಸ್. ಮಲ್ಲಿಕಾರ್ಜುನ್ ಸರ್ಗೆ ಪ್ಲೀಸ್ ಗಿವ್ ಅ ಬಿಗ್ ಹ್ಯಾಂಡ್. ಮಲ್ಲಿಕಾರ್ಜುನ್ ಸರ್. Answer, pantoprazole should not be taken, should be taken before meals. It should be taken on empty stomach. Sir, ಎಲ್ಲರೂ ಬರ್ತಿರ್ಬೋದು, ಅದಕ್ಕೆ ಲಕ್ಕಿ ಅನ್ನೋದು. ಆಯ್ತು, ಇನ್ನೊಂದು ಲಕ್ಕಿ. Okay, on popular demand, second winner. 2 more. Okay, ನಾನು ತಂದಿದ್ದೀನಿ ಪ್ರೈಸು. ನಾವೆಲ್ಲ ಬಾಕ್ಸ್ ತಂದಿದ್ದೀವಿ. ಎಣ್ಣೆ ಇಲ್ಲ ಹಾಕ್ಬೇಕಾ? ಫೋನ್ ಮಾಡಿ ಆಗ್ತಿತ್ತು. ಮಲ್ಲಿಕಾರ್ಜುನ್ ನೀವು ಇಟ್ಕೊಳ್ಳಿ. ಆನ್ಸರ್ ಕರೆಕ್ಟ್ ಅಂತ ನೋಡೋಣ. Advice to take before food. Very good. P. Ramesh sir. ಎಷ್ಟು ಮಾಡೋದು? 4 ತಗೊಳ್ಳೋಣ. ನಾನು ತಂದಿದ್ದೀನಿ. Take before food on empty stomach. Bhaskaran. ಇನ್ನೊಂದು ಯಾರು ನೀವು Next, Srinivas, take on empty stomach. 80317. H. Srinivas. Oh, very good. Balcony. Very good. So, ಈ 4 ಪ್ರೈಸ್ ವಿನ್ನರ್ಸ್ಗೆ ತಾವುಗಳು ಪ್ರೈಸ್ ಕೊಡಬೇಕು. ಇಲ್ಲೇ ಇದೆ. ಅದನ್ನು ಹೆಲ್ಪ್ ಬೇಕು ಸರ್. 4 ಇನ್ನೂ ಇದೆ. ಓಕೆ, ರೈಟ್. ಇದು ನಾನು ಫಸ್ಟ್ ಈಗಲೇ ಕೊಡ್ತೀನಿ. ಮಲ್ಲಿಕಾರ್ಜುನ್ ಸರ್. ಮಲ್ಲಿಕಾರ್ಜುನ್ ಸರ್. ರಮೇಶ್ ಅವರು ನೀವು ಹೋಗಿ ಸರ್ ಇಬ್ರು ಕೈ ಇಟ್ಕೊಳ್ಳಿ. ನಿಮ್ಮವರೇ ಎಲ್ಲರೂ. ಮಲ್ಲಿಕಾರ್ಜುನ್ ಸರ್ ಆಯ್ತು. ನೆಕ್ಸ್ಟ್ ಪಿ ರಮೇಶ್ ಸರ್. ಪಿ ರಮೇಶ್ ಸರ್. ಸಕ್ಸಸ್ಫುಲ್, ಇಲ್ಲೂ ಸಕ್ಸಸ್ಫುಲ್. ಪಾರ್ಟಿ ಸರ್, ದೊಡ್ಡ ಪಾರ್ಟಿನೇ ಸರ್. ಸ್ವಲ್ಪ ಸೆಂಟರ್ ಬರ್ಬೇಕು. ವೆರಿ ಗುಡ್, ಥ್ಯಾಂಕ್ ಯು ಪಿ ರಮೇಶ್ ಸರ್. ನೆಕ್ಸ್ಟ್ ಸರ್ ಇದು ನೀವು ಕೊಟ್ಬಿಡೋಣ. ಮಲ್ಲಿಕಾರ್ಜುನ್ ಸರ್. ನೆಕ್ಸ್ಟ್ ಭಾಸ್ಕರನ್ ಸರ್. ಬನ್ನಿ. ಇಲ್ಲ, ಇದೆಲ್ಲ ರ್ಯಾಂಡಮ್ ಸೆಲೆಕ್ಷನ್ ಬಿಡಿ. ಎಚ್ ಶ್ರೀನಿವಾಸ್. ಬಂದಿದ್ದ ಬಾಲ್ಕನಿಯಿಂದ ಬಂದ್ರೆ ಕೆಳಗಡೆ. ಓ, ಲಾಂಗ್ ಟೈಮ್ ಯಾರ್. ಏನ್ರೆ ಸಮಾಚಾರ? ಎಷ್ಟು ದಿವಸ ಆಯ್ತು? ಈ ಕಡೆ ಬಂದು. ಓಕೆ, ಇದು ತಗೊಳ್ಳಿ ನಿಮ್ಗೆ ಮೆಮೊರೇಬಲಿ, ಸ್ವೀಟ್ ಮೆಮೊರಿ ನಿಮ್ದೆ. ಓಕೆ, ಸೊ ವೇರ್ ಇಸ್ ದ ನೆಕ್ಸ್ಟ್ ಒನ್? ನೆಕ್ಸ್ಟ್ ಪ್ಯಾಕೆಟ್. ಈಗ ನೆಕ್ಸ್ಟ್ ಪ್ಯಾಕೆಟ್. ನೆಕ್ಸ್ಟ್ ಹಾ. ಸೊ ಸರ್ ಹ್ಯಾಸ್ ಗಿವನ್ ದ ಫೀಡ್ಬ್ಯಾಕ್ ಫಾರ್ಮ್. ಸುರೇಶ್ ಸರ್ ಅದಾಯ್ತು. ಇವಾಗ ನೆಕ್ಸ್ಟ್ ಕ್ವಶನ್ ಆದ್ರೂ ನೆನಪಿದ್ಯಾ? ಏನಿತ್ತು ಹೇಳಿ. ವಾಟ್ ಆರ್ ದ ಕ್ವಶನ್? ವರ್ಡ್ ಏನಿದೆ? ಓಕೆ, ಆನ್ಸರ್ ಇಸ್ ಟ್ಯಾಕಿಫೈಡ್ ಆಕ್ಸಿಸ್. ಐ ವಾಸ್ ಲುಕಿಂಗ್ ಫಾರ್ ದಿ ಆನ್ಸರ್, ಟ್ಯಾಕಿಫೈಡ್ ಆಕ್ಸಿಸ್. ಇಲ್ಲ, ಇವರೆಲ್ಲ ಉಮೇಶ್ ಸರ್ ಅಂತ ಆನ್ಸರ್ ಟ್ಯಾಕಿಫೈಡ್ ಆಕ್ಸಿಸ್. One of the most important pharmacological questions we learned. I request volunteers to give the white chits to everybody. Patient has not said, but the pharmacist describes it with a technical word. What was that word the pharmacist used? That was my question. That was my question. I expect pharmacists to be of that order. He should say the word tachyphylaxis. Last question. Okay. Okay, since all of you wanted an easy question, I am giving you an easy question. Amrit sir has picked an easy question. Which country is the largest producer of vaccines? Bardbodi, bega, bega. Write it in that sheet and give it to me. Cheat il baribeko. Oh, kai etputra agala. Question 3. Which country is the largest producer of vaccines? Easiest question. Even online people can answer. Yeah, we are taking. Super. Kempaya Suresh, dynamic doctor Kempaya Suresh from JSS. ಇಲ್ಲ ಅವ್ರು ಹೋಗಿದ್ದಾರೆ, ದೇ ಆರ್ ಕಲೆಕ್ಟಿಂಗ್ ಇಟ್. ದೇ ಅಲ್ಲಿ ಕೊಡ್ತಾ ಇದ್ದಾರೆ. Please quickly give your chits. I have asked a very easy question because the chance you wanted an easy question. Amrit sir has asked. I have not. No rigging. Lucky dip question, lucky dip answer. Yes sir. Yes sir. Hey, ತಗೊಂಡ್ ಬಾರಪ್ಪ ಆದ್ರೆ. They want to close. Q&A ಇದೆ, ಒಂದು ನಿಮಿಷ. ಇದು ಅಲ್ಲಿ ಕೊಡಿ, ಅಲ್ಲಿ ಬೇಗ ಕ್ಲೋಸ್ ಮಾಡೋಣ. ಯು ಪ್ಲೀಸ್ ಗಿವ್ ದ, ವಿ ಆರ್ ಟೇಕಿಂಗ್ ಲಕ್ಕಿ ಡಿಪ್ ಕ್ವಿಕ್ಲಿ. ಈ ಕ್ವಶನ್ಗಂತೂ ಎಲ್ಲರೂ ಉತ್ತರ ಕೊಟ್ಬಿಟ್ರು ನೋಡಿ. ಆಹಾ, ಟ್ಯಾಕಿಫೈಲಾಕ್ಸಿಸ್ ಒಬ್ಬನೂ ಕೊಟ್ಟಿಲ್ಲ. ಅಷ್ಟು ಡೆಸ್ಪರೇಟ್ ಆಗಿದ್ದೆ ನಾನು. ಆಯ್ತಾ, ಕೊಡಿ. ಅಲ್ಲ ಬನ್ನಿ, ಅದು ತಗೊಂಡ್ ಬಾರೋ. ಬೇಗ ಅದು ಬೇಡ ರೀ, ಅದಾಕ್ಬೇಡಿ. ನೋಡ್ರಿ, ಎವ್ರಿಥಿಂಗ್ ಇಸ್ ಇನ್ ಓಪನ್. ಯಾವುದೋ ಒಂದು ಟಿವಿ ಪ್ರೋಗ್ರಾಮ್ ಬರ್ತಿತ್ತು, ನಾವು ಚಿಕ್ಕವರಿದ್ದಾಗ ಪೋಸ್ಟ್ ಕಾರ್ಡ್ ಎಲ್ಲ ಬರ್ತಿತ್ತು ಹಿಂದಿ. ಇದು ಸಂಶುದ್ಧಿ. ಇದು ಯಾರು ಡಾಕ್ಟರ್ ಅನ್ಸತ್ರಿ, ಫಾರ್ಮಸಿಸ್ಟ್ ಹೋದ್ರಿ ಯಾರಾದ್ರು ಬ್ರ್ಯಾಂಡ್ ನೇಮು ಸೂರಿ. ನನ್ಗೆ ಗೊತ್ತಾಗ್ತಾ ಇಲ್ಲ ಹ್ಯಾಂಡ್ ರೈಟಿಂಗ್. ಸಂಸ್ಕೃತಿ ಅಂತಿದ್ದಾರ ಡಾಕ್ಟರ್ ರಾಜೇಂದ್ರ ಸರ್. ಓಕೆ, ದಿವ್ಯಲಕ್ಷ್ಮಿ ಎಸ್. ದಿವ್ಯಲಕ್ಷ್ಮಿ ಹೌದಪ್ಪ, ಎಲ್ಲಾರ್ಗೂ ಕೊಡ್ತೀವಿ. ನಾನು ಅಲ್ಲಿ ಶಕ್ಕೆ ತಗೊಂಡು ಬಂದ್ಬಿಡಿದೀನಿ. ಓಕೆ, ಬನ್ನಿ ಒನ್ ಬೈ ಒನ್. ಸೂರಿ ಡ್ರಗ್ ಇನ್ಸ್ಪೆಕ್ಟರ್ ಯಾರು? ಆರ್ಡರ್ ಸೂರಿ. Ladies are unlucky today. Gender equality. Divya Lakshmi, ladies. Divya Lakshmi, ladies. ಯಾರು Divya Lakshmi? ಬನ್ನಿ. ಸರ್, ಒಂದು ನೀವು ಕೊಡಬೇಕು. ಒಟ್ಟಿಗೆ ರಾಜೇಂದ್ರ ಬರ್ರಿ ಸರ್. ಡಾಕ್ಟರ್ ರಾಜೇಂದ್ರ, ಕಾಂಗ್ರಾಟ್ಸ್. ಇದು ಸಂಶೋಧನೆ. ಓ, ಇದೇನು ಔಷಧಿನ ಸರ್? ನಿಮಗೂ ಅಲ್ಲೇ ಬಾಕ್ಸ್ So thank you very much for your kind cooperation. I hope it was a lively quiz. I enjoyed it. And now we will have another lively session. You can sit down and it's over to
Thank you, Mr. Chiplankar. It was a wonderful session. It was a wonderful session. I request our drugs controller, respected drugs controller, Shri B.T. Kanapure, to hand over a potted plant to Mr. Sunil Chiplankar as a token of remembrance. With certificate. With certificate.
Sir, one certificate is
Thank you, Mr. Chiplankar. Chiplankar avare. Thank you, Mr. Chiplankar, for making the event very lively. Maybe we can sit for another session also. I request our additional controller, Shri Amrish sir, to take over the question hour. Questions can be asked. Any clarifications regarding can be sought. The answer will be given by our additional director controller. One or two questions.
ನಮಸ್ಕಾರ. ಇಷ್ಟೊತ್ತು ನಡೆದಿದ್ದ ಸೆಷನ್ಗೆ ತಮ್ಮೆಲ್ಲರಿಗೂ ನನ್ನ ಹೆಸರು ರಾಘವೇಂದ್ರ ವಿಕೆ ಅಂತ, ಕೆಮಿಸ್ಟ್ ಆ್ಯಂಡ್ ಡ್ರಗಿಸ್ಟ್ ಅಸೋಸಿಯೇಷನಲ್ಲಿ ಇದ್ದೀನಿ. ಕೆಮಿಸ್ಟ್ ಮೆಡಿಕಲ್ ಫೌಂಡೇಶನ್ ಅಂತ ಮಾಡಿದ್ದೀನಿ. ಅಫೋರ್ಡಬಿಲಿಟಿ ಎಸೆನ್ಷಿಯಲ್ ಡ್ರಗ್ಸ್ಗೆ ಇಷ್ಟು ಇಂಟ್ರೊಡ್ಯೂಸ್ ಮಾಡಿರೋದಕ್ಕೆ ತುಂಬ ಸಂತೋಷ ಆಯಿತು. ಆದರೆ ನನಗೆ ಒಂದು ಅರ್ಥ ಆಗಬೇಕಾಗಿರೋ ಮ್ಯಾಟ್ರ್ ಏನಂದರೆ, ಅಜಯ್ ರೆಡ್ಡಿ ಅವರು ಎದ್ದೋದ್ರು ಅನಿಸುತ್ತೆ. ಅವರು ಇವಾಗ ಪ್ರಧಾನಮಂತ್ರಿ ಜನೌಷಧಿ ಕೇಂದ್ರಗಳು ಮಾಡ್ತಾ ಇದ್ದೀರಲ್ಲ, ಅದೇ ಮೆಡಿಸಿನ್ಸ್ ಒಂದು ಪ್ರಧಾನಮಂತ್ರಿ ಜನೌಷಧಿ ಕೇಂದ್ರ ಮಾಡಬೇಕಾದ್ರೆ ಸರ್ಕಾರನೇ 5 ಲಕ್ಷದಿಂದ 7 ಲಕ್ಷ ರೂಪಾಯಿ ಕೊಡ್ತಾ ಇದೆ. ಆಮೇಲೆ ಅದಕ್ಕೆ ಒಂದು ನಿಯಮ ಇಟ್ಟಿದೆ, 1 ಕಿಲೋಮೀಟ್ರ್ ಅಂತ ಹೇಳ್ಬಿಟ್ಟು. ನಾವು ಕೇಳ್ತಾ ಇರೋದೇನು ಅಂತ ಹೇಳಿದ್ರೆ, ಕರ್ನಾಟಕದಲ್ಲಿ 28,000 ಮೆಡಿಕಲ್ ಶಾಪ್ಗಳಿದ್ದಾವೆ, ಬೆಂಗಳೂರಲ್ಲಿ 11,000 ಮೇಲೆ ಮೆಡಿಕಲ್ ಶಾಪ್ಗಳಿದ್ದಾವೆ, ಆಲ್ ಓವರ್ ಇಂಡಿಯಾದಲ್ಲಿ 8.5 ಲಕ್ಷ ಮೆಡಿಕಲ್ ಶಾಪ್ಗಳಿದ್ದಾವೆ. ನೀವು ಮಾಡೋ ರೂಲ್ ಯಾವುದು? ಆಲ್ರೆಡಿ ಲೈಸೆನ್ಸ್ಡ್ ಕೆಮಿಸ್ಟ್ಗಳಿಗೆ ಒಂದು ಕಡೆ ಈ ಶಾಪಲ್ಲಿ ಇಂಥ ಕಡೆ ಜನೌಷಧಿ ಮೆಡಿಸಿನ್ ಸಿಗುತ್ತೆ ಅಂತ ಮಾಡಿದ್ದಿದ್ರೆ ತುಂಬ ಚೆನ್ನಾಗಿರ್ತಾ ಇತ್ತೇನೋ. ನಾನು ಈ ವೇದಿಕೆ ಮೂಲಕ ಕೇಳಬೇಕು ಅಂತ ಹೇಳ್ಬಿಟ್ಟು ತಮ್ಮಲ್ಲಿ ಮನವಿ ಮಾಡ್ಕೊತಾ ಇದ್ದೀನಿ. ಯಾಕಂದರೆ 5 ಲಕ್ಷ ಕೊಟ್ಟು ಇನ್ನೊಂದು ಶಾಪ್ ನಮ್ಮ ಪಕ್ಕದಲ್ಲೇ ಮಾಡೋದಕ್ಕಿಂತ ಇರೋ ಶಾಪ್ಗೆ ಯಾಕೆ ಇದನ್ನು ಪರ್ಮಿಷನ್ ಕೊಡಬಾರ್ದು? ಆಮೇಲೆ ತಾವು ಏನು ಜನೌಷಧಿ ಕೇಂದ್ರ ಅಂತ ಮಾಡ್ತಾ ಇದ್ದಾರೆ, ಅದರಲ್ಲಿ ಬರೀ ಜನೌಷಧಿ ಮಾಡ್ತಾ ಇಲ್ಲ. ಆಲ್ರೆಡಿ ಮಹೇಶ್ ಅವರು ಕೇಳಿರ್ಬೋದು, ಅದರಲ್ಲಿ ಎಲ್ಲ ಮೆಡಿಸಿನ್ಸು ಅವರು ಫಾರ್ಮ್ 20 ಫಾರ್ಮ್ 21 ತಗೊಂಡಿರ್ತಾರೆ. ಎಲ್ಲ ಮೆಡಿಸಿನ್ಸು ಅವ್ರೇನು ಮಾಡ್ತಾ ಇದ್ದಾರೆ, ಇವಾಗ ಎಥಿಕಲ್ ಬ್ರ್ಯಾಂಡೆಡ್ ಮೆಡಿಸಿನ್ಸ್ ಏನು ಬರ್ತಾ ಇದೆ 15% 20% ಡಿಸ್ಕೌಂಟ್ ಕೊಟ್ಟು ನಮ್ಮಲ್ಲೇ ಅನೆಥಿಕಲ್ ಪ್ರಾಕ್ಟೀಸ್ ಮಾಡಿಸ್ತಾ ಇದ್ದಾರೆ. ಇದರಿಂದ ಏನಾಗ್ತಾ ಇದೆ, ನಾವು ಸಗಟು ವ್ಯಾಪಾರಿಗಳಾಗಿ ನಾವು ಬದುಕೋದೇ ಕಷ್ಟ ಆಗ್ತಾ ಇದೆ. ಇಲ್ಲಿ ನಮ್ಮನ್ನು ಇಷ್ಟು ದಿನ ನಾವು ಸರ್ವಿಸ್ ಮಾಡಿದ್ದೀರಿ. ತಾವೆಲ್ಲ ಹೇಳ್ದಂಗೆ ಕೋವಿಡ್ ಟೈಮಲ್ಲಿ ಇರ್ಬೋದು, ನನಗೂ ಕೋವಿಡ್ ಬಂದಿತ್ತು. ಪ್ರಾಣವನ್ನು ಪಣಕ್ಕಿಟ್ಟು ನಾವು ಜನರ ಸೇವೆ ಮಾಡಿದ್ದೀವಿ ಸ್ವಾಮಿ. ಆದರೆ ಇವಾಗ ನಮ್ಮಲ್ಲೇ ಕೆಮಿಸ್ಟ್ ಮದ್ದುಗಳಲ್ಲಿ ಏನಾಗ್ತಾ ಇದೆ ಅಂದರೆ, ಅವರು ಡಿಸ್ಕೌಂಟ್ ಕೊಡ್ತಾರೆ, ನೀವು ಕೊಡ್ತಾ ಇಲ್ಲ. ಆನ್ಲೈನು ಯಥೇಚ್ಛವಾಗಿ ನಡೀತಾ ಇದೆ. ಇದ್ರ ಬಗ್ಗೆ ನಾವು ತಮಗೆ ತುಂಬ ಸರಿ ಮೆಮೊರಾಂಡಮ್ಗಳು ಕೊಟ್ಟಿದ್ದೀವಿ. ತುಂಬ ಅಸೋಸಿಯೇಷನ್ಸ್ ಬಂದಿರ್ತವೆ, ಕೊಟ್ಟಿರ್ತವೆ, ನಮ್ಮ ಕಷ್ಟಗಳು ಹೇಳ್ಕೊಂಡಿರ್ತೀವಿ ಸ್ವಾಮಿ. ಆದರೂ ಎಷ್ಟೋ ಸಾರಿ ಕೇಸ್ಗಳು ಹಾಕ್ಸ್ಕೊಂಡಿದ್ದೀವಿ. ಆನ್ಲೈನ್ ಪೋರ್ಟಲ್ ಎಲ್ಲೋ ಇರ್ತಾನೆ, ಎಲ್ಲೋ ಡೆಲ್ಲಿಯಲ್ಲಿ ಇರ್ತಾನೆ, ಅವ್ನು ಮ್ಯಾನೇಜ್ ಮಾಡ್ತಾ ಇರ್ತಾನೆ, ನಮಗೆ ಕಂಟ್ರೋಲ್ ಸಿಗ್ತಾ ಇಲ್ಲ. ಆದರೆ ತಮ್ಮನ್ನು ಬಯಸೋದೇನೆಂದರೆ, ಈ ಅನೆಥಿಕಲ್ ಪ್ರಾಕ್ಟೀಸ್ಗಳನ್ನ ತಾವು ಕಂಟ್ರೋಲ್ ಮಾಡೋಕ್ಕಾಗಲ್ವಾ? ಪ್ರತಿಯೊಂದಕ್ಕೂ ಅಸೋಸಿಯೇಷನ್ಗಳಾಗ್ಬೋದು, ನಾವಾಗ್ಬೋದು, ಬಂದು ಹೋರಾಟಗಳು ಮಾಡಬೇಕಾ? ಯಾಕೆ ಜನೌಷಧಿ ಕೇಂದ್ರದಲ್ಲಿ ಜನೌಷಧಿ ಮೆಡಿಸಿನ್ಸ್ ಬಿಟ್ಟು ಬೇರೆದು ಮಾರೋದಾದರೆ ನಮ್ಮ ಕೇಂದ್ರಗಳಲ್ಲಿ ನಮ್ಮ ಫಾರ್ಮಸಿಸ್ಟ್ಗಳಾಗಿ ನಾವು ಯಾಕೆ ಜನೌಷಧಿ ಮೆಡಿಸಿನ್ನ ನಾವು ಮಾರಬಾರ್ದು? ಆ ಶಾಪ್ಸ್ ನೀವು ಗುರುತಿಸ್ಬೇಕಾ, ನಿಯಮ ನಿಬಂಧನೆಗಳಾಗಬೇಕಾ? ಹಾಕ್ರಿ. ನಮ್ಗೆ ಯಾಕೆ ಒಂದು ಅವಕಾಶಗಳು ಕೊಡಬಾರ್ದು? ನೀವು ಯಾಕೆ 5 ಲಕ್ಷ 7 ಲಕ್ಷ ಕೊಟ್ಟು ಮಹಿಳೆಯರು ಮಾಡಂಗಿದ್ರೆ 7 ಲಕ್ಷ ಕೊಡ್ತಾ ಇದ್ದಾರೆ, ಕ್ಯಾಟಗರಿ ವೈಸ್ ಮಾಡಂಗಿದ್ರೆ ಗ್ರೂಪ್ಗೆ ಅದಕ್ಕೆ 2 ಲಕ್ಷ ಎಕ್ಸ್ಟ್ರಾ ಕೊಡ್ತಾ ಇದ್ದಾರೆ. 5 ಲಕ್ಷ ರೂಪಾಯಿ ಏನು ರೆಗ್ಯುಲರ್ ಆಗಿ ಯಾರಾದರೂ ಜನೌಷಧಿ ಕೇಂದ್ರ ಮಾಡಬೇಕಾದ್ರೆ 5 ಲಕ್ಷ ರೂಪಾಯಿ ಫರ್ನಿಚರ್ಗೆ 2.5 ಲಕ್ಷ ಸಮಥಿಂಗ್ ದೇ ಆರ್ ಗಿವಿಂಗ್. ನಮ್ಮ ಹತ್ರ ಆಲ್ರೆಡಿ ಇನ್ಫ್ರಾಸ್ಟ್ರಕ್ಚರ್ ಇದೆ, ನಮ್ಮ ಹತ್ರ ಆಲ್ರೆಡಿ ಫಾರ್ಮಸಿಸ್ಟ್ ಇದ್ದೀವಿ, ನಮ್ಮ ಹತ್ರ ಆಲ್ರೆಡಿ ನಾವು ವಿ ಆರ್ ಹ್ಯಾವಿಂಗ್ ಫಾರ್ಮ್ 2021 ಲೈಸೆನ್ಸ್, ನಾವು ರೆಡಿ ಇದ್ದೀವಿ ಸರ್ವಿಸ್ ಮಾಡಲಿಕ್ಕೆ. ನಮಗೆ ಯಾಕೆ 2 ರ್ಯಾಕಲ್ಲಿ ಇಡೋದಕ್ಕೆ ಅವಕಾಶ ಕೊಡ್ತಾ ಇಲ್ಲ? ನಾನು ಕೇಳ್ತಾ ಇರೋದು ತಪ್ಪ? ಸರ್ಕಾರದ ಬೊಕ್ಕಸಕ್ಕೆ ನೀವು ಹೇಳಿದ್ರೆ ಅವಾಗಲೇ 4,000 ಮೆಡಿಕಲ್ ಶಾಪ್ಗಳಿದ್ದಾವೆ ಆಲ್ ಓವರ್ ಇಂಡಿಯಾ ಅಂತ ಹೇಳಿದ್ರಿ. 4,000 ಇಂಟು 5 ಲಕ್ಷ ರೂಪಾಯಿ ಹಾಕಿದ್ರೆ ಕಾಮನ್ ಆಗಿ ಎಷ್ಟು ಕೋಟಿ ಆಯ್ತು ಸ್ವಾಮಿ? ಇದು ಸರ್ಕಾರದ ಬೊಕ್ಕಸಕ್ಕೆ ಲಾಸ್ ಆಗ್ತಾ ಇಲ್ವಾ? ಇದನ್ನು ನೀವು ಯಾಕೆ ಸರ್ಕಾರದ ಗಮನಕ್ಕೆ ತಂದಿಲ್ಲ? ಸರ್ಕಾರದ ಕೆಲಸ ದೇವ್ರ ಕೆಲಸ, ನಾವು ಮಾಡ್ತೀವಿ. ಬೀಯಿಂಗ್ ಎ ಫಾರ್ಮಸಿಸ್ಟ್ ನಾವು ಮಾಡ್ತೀವಿ, ನಮ್ಗೆ ಯಾಕೆ ಅವಕಾಶ ಕೊಡ್ತಾ ಇಲ್ಲ? ಅವ್ರು ನಮ್ಮ ಪಕ್ಕದಲ್ಲೇ ಆಗ್ತಾರೆ. ನಾವು ಅಮರೇಲಿ 330 ಇದ್ರೆ ನಾವು 330ಗೆ ಮಾರ್ತೀವಿ ಅಂದರೆ ಅವ್ನು ಎತ್ಕೊಂಡೋಗಿ 250ಗೆ ಮಾರ್ತಾನೆ. ನಮ್ಮ ಮೆಡಿಸಿನ್ ಬ್ರ್ಯಾಂಡೆಡ್ ಮೆಡಿಸಿನ್ ಅವರಲ್ಲಿ ಮಾರ್ತಾ ಇದ್ದಾರೆ. ತುಂಬ ಸರಿ ಮೆಮೊರಾಂಡಮ್ಸು ಕೊಟ್ಟಿವಿ. ಅವನು ಫಾರ್ಮ್ 2021 ತಗೊಂಡಿದ್ದಾನೆ ರೀ, ಅವನು ಮಾರ್ತಾ ಇದ್ದಾನೆ. ಇದು ಅವನು ಈ ಬ್ರ್ಯಾಂಡ್ ಮಾರಂಗಿದ್ರೆ ನಮಗೆ ಯಾಕೆ ಆ ಜನೌಷಧಿ ಮೆಡಿಸಿನ್ಸ್ ನಾವು ಯಾಕೆ ಮಾರಕ್ಕೆ ಅವಕಾಶ ಕೊಡ್ತಾ ಇಲ್ಲ? ಅಜಯ್ ರೆಡ್ಡಿ ಅವರು ಇದ್ದಿದ್ರೆ ಚೆನ್ನಾಗಿರೋದು. ಮತ್ತೆ ಹೊಸ ಶಾಪ್ಗಳನ್ನ ಯಾಕೆ ಹಾಕಬೇಕಾಗಿತ್ತು? 10,000 ಪಾಪ್ಯುಲೇಷನ್ ಇರೋ ಕಡೆ ಒಂದು ಮೆಡಿಕಲ್ ಇದ್ರೇನೆ ಸಾಕಾಗುತ್ತೆ. ರೋಡ್ಗೂ ಬೀದಿಗೂ ಮೆಡಿಕಲ್ ಆಗ್ತಾ ಇದೆ. ಅದರಲ್ಲೂ ನಾವು ಕೋವಿಡ್ ಸಮಯದಲ್ಲಿ ನೀವೇ ಹೇಳ್ದಂಗೆ ಎಷ್ಟೋ ಸರ್ವಿಸ್ ಕೊಟ್ಟಿದ್ದಾರೆ ಕೆಮಿಸ್ಟ್ಗಳು. ಆದರೆ ಏನಾಗ್ತಾ ಇದೆ ಇವತ್ತು? ನಮ್ಮ ಪರಿಸ್ಥಿತಿ ಏನಾಗಬೇಕು? ಮುಂದೆ ಹಿಂಗೆ ಹೋದ್ರೆ ಏನಾಗಬೇಕು? ನಾವು ದಯವಿಟ್ಟು ಇದ್ರ ಬಗ್ಗೆ ಸೂಕ್ತ ಕ್ರಮ ಕೈಗೊಳ್ಳಿ. ಆಮೇಲೆ ಇವಾಗ ನಾನು ಯಾವುದೋ ಒಂದು ಮೆಡಿಸಿನ್ ಎತ್ಕೊಂಡು ನಾನು ನಮ್ಮ ಹತ್ರ ತಗೊತಾ ಇದ್ದಿದ್ದು ಮೆಡಿಸಿನ್ಸು ಏನೋ ನಿಮ್ಮ ಟೈಮ್ ಏನು ವೇಸ್ಟ್ ಮಾಡಲ್ಲ ಅಂತ ನಾನು ಅನ್ಕೊಂತೀನಿ. ಇವಾಗ ಸಸ್ಟೈನ್ಡ್ ರಿಲೀಸ್ ಮೆಟ್ಫಾರ್ಮಿನ್ ಹೈಡ್ರೋಕ್ಲೋರೈಡ್, ಯಾರೋ ಪೇಷಂಟ್ ಹೋಗಿ ಅಲ್ಲಿ ನಮ್ಮ ಹತ್ರ ತಗೊಂತ ಇದ್ದವರು ಜನೌಷಧಿ ಮೆಡಿಸಿನ್ಸ್ ತಗೊಂತಾರೆ. ಜನೌಷಧಿ ಮೆಡಿಸಿನ್ನಲ್ಲಿ ಸಸ್ಟೈನ್ಡ್ ರಿಲೀಸ್ ಟ್ಯಾಬ್ಲೆಟ್ ಅನ್ನೋದು ಸಿಗಲ್ಲ. ಅಲ್ಲೇನು ಸಿಗ್ತದೆ? ಯಾವುದೋ ಫಿಲ್ಮ್ ಕೋಟೆಡ್ ಕೊಡ್ತಾನೆ, ಅದು ವರ್ಕ್ ಆಗಲ್ಲ. ಯಾಕಂದ್ರೆ ಅವನು ಅಫೋರ್ಡಬಲ್ ರೇಟಲ್ಲಿ ಕೊಡೋಕ್ಕಾಗಲ್ಲ. ಇವಾಗ ನಮ್ಮ ಹರೀಶ್ ಸರ್ ಹೇಳ್ದಂಗೆ ಎಂಬೈಟಿಕ್ ಅವರು ಮಾಲಿಕ್ಯೂಲ್ ಪ್ರೈಸ್ಗಳೇ ಹೈಕ್ ಆಗೋಗಿದೆ. ಪ್ಯಾರಾಸಿಟಮಾಲ್ ಬರೋ ಕಾಸ್ಟ್ಗಿಂತ ಇನ್ನೂ ಕಮ್ಮಿ ಕೊಡಿ, ಒಂದು ಪ್ರೊಡಕ್ಷನ್ ಕಾಸ್ಟೇ ₹1 ಇತ್ತು ಅಂದರೆ ಎಲ್ಲಿಂದ ಅವರು DPCO ಮೇಲ್ಗಡೆಯಿಂದ ಕುಟ್ತಾ ಇರುತ್ತೆ, NPPA ಮೇಲ್ಗಡೆಯಿಂದ ಕುಟ್ತಾ ಇರುತ್ತೆ. ವಿ ಆರ್ ರೆಡಿ. ಎಸ್, ಅವಾಗಲೇ ಸಾರ್ ಯಾರೋ ಕ್ವಶನ್ ಕೇಳಿದ್ರು, ವಿಚ್ ಈಸ್ ದ ಹೈಯೆಸ್ಟ್ ವ್ಯಾಕ್ಸಿನ್ ಪ್ರೊಡ್ಯೂಸಿಂಗ್ ಕಂಟ್ರಿ ಇನ್ ಇಂಡಿಯಾ? ಇಂಡಿಯಾ ಇಸ್ ದ ಹೈಯೆಸ್ಟ್ ವ್ಯಾಕ್ಸಿನ್ ಪ್ರೊಡ್ಯೂಸಿಂಗ್ ಕಂಟ್ರಿ. 100 ಕೋಟಿ ಜನಸಂಖ್ಯೆಗೆ ಒಂದು ಡೋಸ್ ಹಾಕಿದ್ದೀವಿ ಅಂತ ಹೇಳಿದ್ರೆ 1 or 2 ಡೋಸ್ 2.5 ಲಕ್ಷ ಕೋಟಿ ಬರೀ ವ್ಯಾಕ್ಸಿನ್ಗೆ ನಮ್ಮವ್ರು ಹಾಕ್ಸ್ಕೊಂಡಿದ್ದಾರೆ. ಅಷ್ಟು ಅಫೋರ್ಡಬಿಲಿಟಿ ನಮ್ಮ ಕಂಟ್ರಿ ಕೊಡ್ತಾ ಇದೆ ಮೆಡಿಸಿನ್ ಅನ್ನು. ಅಫೋರ್ಡಬಿಲಿಟಿ 2.5 ಲಕ್ಷ ಕೋಟಿ 1 ಡೋಸ್ಗೆ. 2 ಡೋಸ್ಗೆ ಅಂದರೆ 5 ಲಕ್ಷ ಕೋಟಿ. ನನಗೆ ಗೊತ್ತಿದ್ದಂಗೆ ನಮ್ಮ ದೇಶದ ಬಜೆಟ್ಗಿಂತ ಮೀರಿದಷ್ಟು ದುಡ್ಡು ನಾವು ವ್ಯಾಕ್ಸಿನ್ಗೋಸ್ಕರ ಕೊಟ್ಟು ಹಾಕ್ಸ್ಕೊಂಡಿದ್ದೀವಿ ಅಂದರೆ ವಿ ಆರ್ ಎಸೆನ್ಷಿಯಲ್ ಡ್ರಗ್ಸನ್ನು ಲೋಯೆಸ್ಟ್ ಪ್ರೈಸಲ್ಲಿ ಕೊಡ್ತಾ ಇರೋ ಕಂಟ್ರಿ ಅಂತ ಹೇಳ್ಬಿಟ್ಟು ನಾನು ಒಪ್ತೀನಿ. ನಾನು ಸರ್ಕಾರಕ್ಕೆ ಆಭಾರಿಯಾಗಿದ್ದೀನಿ ಈ ರೀತಿ ವ್ಯಾಕ್ಸಿನ್ ಕೊಟ್ಟಿರೋದಕ್ಕೆ. ನಾನು ಕ್ವಶನ್ಸ್ 2-3 ಅಷ್ಟೇ. ಯಾಕೆ ನಮ್ಗೆ ಅವಕಾಶ ಕೊಡ್ತಾ ಇಲ್ಲ? ಅನೆಥಿಕಲ್ ಪ್ರಾಕ್ಟೀಸ್ಗಳಾಗಿ ನಾವೆಲ್ಲ ಒಡೆದಾಡೋ ರೀತಿ ಯಾಕೆ ಮಾಡ್ತಾರೆ? ಕೆಮಿಸ್ಟ್ಗಳನ್ನ ಸರ್ ನಿಮ್ಮ ಮುಂದೆ ಹೇಳ್ತೀನಿ, ಯಾರಾದರೂ ಮೆಡಿಕಲ್ ಶಾಪಿಗೆ ಬಂದರೆ ಸರ್ ಎಂಥ ಕ್ವಶನ್ಸ್ ಕೇಳ್ತಾರೆ ಅಂದರೆ ಅಲ್ಲಿ 30-40% ಡಿಸ್ಕೌಂಟ್ ಸಿಗ್ತದೆ, 50% ಡಿಸ್ಕೌಂಟ್ ಸಿಗ್ತದೆ, ನಿಮ್ಮ ಹತ್ರ ಯಾಕಿಲ್ಲ? ನೀವೆಲ್ಲ ಕಳ್ರು ಅಂದರೆ ನಾವು ಕಳ್ರ ಸರ್? ನಾವು ಕಳ್ರ ಸರ್? ಫಾರ್ಮಸಿಸ್ಟ್ಗಳಾಗಿ ನಮ್ಮ ಮೆಡಿಕಲ್ ಶಾಪ್ಗಳು ಇಟ್ಕೊಂಡಿರೋರು ಇದೇ ಸರ್. ಸರ್ ನಮ್ಮನ್ನು ಹಂಗೆ ಕೇಳ್ತಾ ಇದ್ದಾರೆ ಸರ್, ನಮ್ಮನ್ನು ಹಂಗೆ ಕೇಳ್ತಾ ಇದ್ದಾರೆ ಸರ್. ನೀವು ದೇವರುಗಳಿದ್ದಂಗೆ. ನಾವು ನಿಮ್ಮ ಮುಂದೆ ಪ್ರಶ್ನೆ ಇಡ್ತಾ ಇರೋದು ನಮಗೆ ಬಂದಿರೋ ಅವಮಾನ. ಮೆಡಿಕಲ್ ಶಾಪ್ಗಳು ಬಂದು ಕೇಳ್ತಾ ಇರೋದು ಈ ಥರ ಆಗ್ತಾ ಇದೆ. ದಯವಿಟ್ಟು ಇದಕ್ಕೆ ನನ್ನ ಒಂದೇ ಒಂದು ಕ್ವಶನ್ ಏನಂದರೆ, ತಾವು ಸಾಲ್ವ್ ಮಾಡಿಕೊಡ್ಬೇಕು. ಈ ಅನೈತಿಕಲ್ ಪ್ರಾಕ್ಟೀಸ್ಗಳನ್ನೆಲ್ಲ ತೆಗೀರಿ, ಯುನಿಕ್ನೆಸ್ ಕೊಡ್ರಿ. ನಮಗೆ ₹10 ಸಿಕ್ಕರೂ ಸಂತೋಷ ಸರ್. ಯೂನಿಫಾರ್ಮಿಟಿ ಇರಲಿ, ಪ್ರೈಸ್ ಟ್ಯಾಪಿಂಗ್ ಇರಲಿ, ಏನೇ ಇರಲಿ. ಯಾರೋ ಎಲ್ಲಿಂದ ಬ್ಯಾಗ್ ಹಾಕೊಂಡ್ಬರ್ತಾನೆ, ಮನೆಗೆ ಎತ್ಕೊಂಡೋಗಿ ಕೊಡ್ತಾನೆ, 20% 30% ಅಂತಾನೆ ಕೂಪನ್ ಕೊಡ್ತಾನೆ, ಅದು ಕೊಡ್ತಾನೆ, ಇದು ಕೊಡ್ತಾನೆ. ಜನ ಸರ್ 12 ಗಂಟೆಯಲ್ಲಿ ಒಂದು ಡೆಪಿನ್ ಟ್ಯಾಬ್ಲೆಟ್ ಬೇಕಾದ್ರೆ ಹೋಗಿ ತೆಗೆದು ಕೊಡ್ತೀವಿ ಸರ್. ಎಸೆನ್ಷಿಯಲ್ ನೀಡ್ಸ್ ಕೊಟ್ಟಿರೋರು ನಾವು ಇಷ್ಟು ವರ್ಷ. ಯಾವುದೋ ಒಂದು ಮಲ್ಟಿನ್ಯಾಷನಲ್ ಕಂಪ್ನಿಗಳು ಬರ್ತಾವೆ ಅಂತ ಹೇಳಿದ್ರೆ ಅವನು ಏನೋ ಒಂದು ಆಸೆ ತೋರಿಸ್ತಾನೆ ಅಂದ್ರೆ ಕಾಗೆ ನೋಡ್ದು ಹದ್ಗಾಗ್ದಂಗೆ ಆಗೋಗಿದೆ ನಮ್ಮ ಪರಿಸ್ಥಿತಿ. ದಯವಿಟ್ಟು ಇದಕ್ಕೆ ಸೂಕ್ತ ಕ್ರಮ ಕೈಗೊಳ್ಬೇಕಾಗಿ ತಮ್ಮಲ್ಲಿ ಕೇಳ್ತೀನಿ. ಆಮೇಲೆ ಒಂದೇ ನಿಮಿಷ ಸರ್, ನನಗೆ ನಂದು ಕ್ವಶನ್ಸ್ ಏನಿಲ್ಲ, ಇಷ್ಟೇ ಇದ್ದಿದ್ದು. ತಾವು ನಮಗೆ ಒಂದು ಸೆಲ್ಫ್ ರೆಸ್ಪೆಕ್ಟ್ ಅನ್ನು ತಗೊಡ್ಬೇಕಾಗಿ ತಮ್ಮನ್ನು ಈ ಮೂಲಕ ಕೇಳ್ತೀನಿ. ಥ್ಯಾಂಕ್ ಯು ಸರ್.
ಕ್ವೆಶ್ಚನ್ ನಂಬರ್ 1 ನಿಮಿಷ.
ಇವ್ರದ್ದಾಯ್ತು. ಬೇರೆ ಯಾರು ಇದ್ರೆ ಒಮ್ಮೆಲೆ ಹೇಳಿಬಿಡ್ತೀನಿ ನಾನು. ಸೊ ದಟ್
ಯಾರಾದ್ರೂ ಕೇಳೋರು
ಬೇರೆ ಯಾರಾದ್ರೂ ಕ್ವಶನ್ಸ್ ಇದ್ರೆ ಟೈಮ್ ಆಗಿದೆ. ಸರ್ ಈಗ ನಮ್ಮ ಹೆಸರೇನು ಸರ್? ರಾಘವೇಂದ್ರ ಅವರು ಭಾಳ ಚೆನ್ನಾಗಿ ಕ್ವಶನ್ ಕೇಳಿದ್ದಾರೆ. ಟುಡೇಸ್ ಕಾನ್ಸೆಪ್ಟ್ ವಾಸ್ ಗೆ ತಕ್ಕಂಗೆ ಕೇಳಿದ್ದಾರೆ. ಇಟ್ಸ್ ರಿಯಲಿ ಐ ಮಸ್ಟ್ ಅಪ್ರಿಸಿಯೇಟ್ ಹಿಮ್. ಇಟ್ಸ್ ಎ ಐ ಓಪನರ್. ಅವ್ರು ಹೇಳಿರೋದು ವೆನ್ ವಿ ಆರ್ ಲಾಂಚಿಂಗ್ ಅಫೋರ್ಡಬಲ್ ಆ್ಯಂಡ್ ಅವೈಲಬಿಲಿಟಿ ಆಫ್ ಡ್ರಗ್ಸ್ ಇದ್ದಾಗ, ಸೊ ನಾವು ಜನೌಷಧ ಅಂಗಡಿ ಮಾರಾಟ ಔಷಧಗಳನ್ನು ಪ್ರೈವೇಟ್ನಲ್ಲಿ ಯಾಕೆ ಮಾರ್ತಾ ಇಲ್ಲ, ಯಾಕೆ ಕೊಡ್ತಾ ಇಲ್ಲ ಅಂತ ಕೇಳಿದ್ದಾರೆ. ಇಟ್ ಮೀನ್ಸ್ ಮೇಕಿಂಗ್ ಅಫೋರ್ಡಬಲ್ ಮೆಡಿಸಿನ್ ಅವೈಲಬಿಲಿಟಿ ಇನ್ ಆಲ್ ಪಬ್ಲಿಕ್ಕಿಗೆ ಅಂತ ಅವ್ರದ್ದು ಕ್ವಶನ್ ಇದೆ ಅಲ್ವಾ? ಸೊ ದಿಸ್ ಈಸ್ ಎನ್ ಪಾಲಿಸಿ ಡಿಸಿಷನ್. ಡೆಫಿನೆಟ್ಲಿ ವಿ ವಿಲ್ ಫಾರ್ವರ್ಡ್ ಇಟ್ ಟು ಗೌರ್ಮೆಂಟ್ ಆಫ್ ಇಂಡಿಯಾಗೆ. ವಿ ವಿಲ್ ಅಡ್ರೆಸ್.
ಥ್ಯಾಂಕ್ ಯು ಸರ್.
ನನಗೆ ಕೊಟ್ಟಿದ್ರಿ. ಮೋಸ್ಟ್ಲಿ ನಾನು ಸರ್ಕಾರಕ್ಕೆ ಗಮನಕ್ಕೆ ತಂದಿದ್ದೀನಿ, ಕಳಿಸಿದ್ದೀನಿ, ಬಟ್ ಅಲ್ಲಿ ಏನೂ ಆಗಿಲ್ಲ, ರಿಸಲ್ಟ್ ಬಂದಿಲ್ಲ. ಈಗ ಆ್ಯಸ್ ಅಡಿಷ್ನಲ್ ಟಿ ಸಿ ಹೇಳ್ದಂಗೆ, ಸೊ ನಿಮ್ಮದು ವ್ಯಾಲಿಡ್ ಪಾಯಿಂಟ್ ಇದೆ, ನಮಗೂ ಎಕ್ಸೆಪ್ಟ್ ಆಗುತ್ತೆ, ನಮಗೂ ಅರ್ಥ ಆಗುತ್ತೆ. ನಾವು ನಿಮ್ಮ ಜೊತೆನೇ ಇದ್ದೀವಿ, ಎಲ್ಲರ ಜೊತೆನೇ ಇದ್ದೀವಿ. ಅವ್ರಿಗೊಂದು ನಿಮಗೊಂದು ನಾವು ಏನು ಮಾಡ್ತಾ ಇಲ್ಲ. ಎಲ್ಲರೂ ನಾವು ಈಕ್ವಲಿ ನೋಡ್ಕೋಬೇಕಾಗಿದೆ ಡ್ರಗ್ಸ್ ಕಂಟ್ರೋಲ್ ಡಿಪಾರ್ಟ್ಮೆಂಟು. ನಿಮ್ಮ ಕಷ್ಟ ನಮ್ಗೆ ಗೊತ್ತಾಗುತ್ತೆ. ಡೆಫಿನೆಟ್ಲಿ ವಿ ಆರ್ ಗೋಯಿಂಗ್ ಟು ಟೇಕ್ ಅಪ್ ದ ಇಶ್ಯೂ ಬಿಕಾಸ್ ಇಟ್ ಈಸ್ ಎ ನ್ಯಾಷನಲ್ ಪಾಲಿಸಿ ಇಶ್ಯೂ ಇರೋದ್ರಿಂದ, ಆನರಬಲ್ ಪ್ರೈಮ್ ಮಿನಿಸ್ಟರ್ದು ಜನೌಷಧಿ ಬಂದಿರೋದ್ರಿಂದ ನಮಗೂ ಎರಡು ರ್ಯಾಕ್ ಕೊಡಿ ಅಂತ ನೀವು ಕೇಳ್ತಾ ಇದ್ದೀರಿ. ಅದು ನ್ಯಾಯಸಮ್ಮತವಾಗಿದೆ. ಸೊ ವಿ ವಿಲ್ ವೆರಿಫೈ ಆ್ಯಂಡ್ ವಿಲ್ ಡಿಸ್ಕಸ್ ವಿತ್ ಪ್ರಿನ್ಸಿಪಲ್ ಸೆಕ್ರೆಟರಿ. Then we'll forward to the DCGI know what they are going to take action. Based on that, we are going to inform you. Definitely we are going to.
Thank you. Thank you, sir. We complete the questionnaire. Next, all the participants who have registered and who have attended offline, online, our mail ಮುಖಾಂತರ ಈ ಸರ್ಟಿಫಿಕೇಟ್ ನಾಳೆ ಡೌನ್ಲೋಡ್ ಮಾಡಿಕೊಂಡು ಸ್ಪ್ರಿಂಟ್ ತೊಗೋಬೋದು. ಕೆಲವೊಂದು ಸರ್ಟಿಫಿಕೇಟ್ಸು ಐ ರಿಕ್ವೆಸ್ಟ್ ಅವರ್ ಡ್ರಗ್ ಕಂಟ್ರೋಲರ್ ಶ್ರೀ ಬಿ ಟಿ ಖಾನಾಪುರಿ ಅವರಿಗೆ ಇಶ್ಯೂ ಮಾಡೋಕ್ಕೆ, ಪಾರ್ಟಿಸಿಪೇಷನ್ ಸರ್ಟಿಫಿಕೇಟ್ ಇಶ್ಯೂ ಮಾಡೋಕ್ಕೆ ಕೇಳ್ಕೊತೀರಿ. Thank you, sir. Finally, we have come to the end of the session, PARICHARCHA on affordability and availability of essential drugs. This is organized by the PMRU Society Drugs. I request, before the vote of thanks, I request our additional drugs controller, Sri Amrish Tumbagi sir, to present our drugs controller, our beloved drugs controller, Sri B.T. Kanapure sir, a potted plant. Thank you, sir.
ಚರ್ಚಾದ ಕೊನೆಯ ಭಾಗದಲ್ಲಿ ನಾವಿದ್ದೇವೆ. ಈ ಕನ್ನಡ ರಾಜ್ಯೋತ್ಸವದ ಪೂರ್ವ ದಿನ ಆದ ಇವತ್ತ ಬಹಳ ಚೆನ್ನಾಗಿ PMRU ಸೊಸೈಟಿಯ ಈ ಅಫೋರ್ಡಬಿಲಿಟಿ ಮತ್ತು ಅವೈಲೇಬಿಲಿಟಿ ಆಫ್ ಎಸೆನ್ಷಿಯಲ್ ಮೆಡಿಸಿನ್ ಬಗ್ಗೆ ಕಾರ್ಯಕ್ರಮ ಹಂಚಿಕೊಂಡಿದ್ವಿ. ಅದು ಎಲ್ಲರಿಗೂ ಮುಟ್ಟಿದೆ ಅಂತ ಅನಿಸುತ್ತೆ. ಈ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಕಾರಣಭೂತರಾದ NPP ರವರಿಗೆ PMRU ಸೊಸೈಟಿ ಆಫ್ ಕರ್ನಾಟಕ ವತಿಯಿಂದ ಕೃತಜ್ಞತೆಗಳನ್ನು ಸಲ್ಲಿಸುತ್ತೇನೆ. ಅದೇ ಥರ ಈ ಕಾರ್ಯಕ್ರಮವನ್ನು ಈ ಪರಿಚರ್ಚೆಯನ್ನು ಹಮ್ಮಿಕೊಳ್ಳಲು ಒಪ್ಪಿಗೆ ನೀಡಿದ ಮತ್ತು ನಿರ್ದೇಶನ ನೀಡಿ ಸೂಕ್ತ ಕಾಲಕ್ಕೆ ಸೂಕ್ತ ನಿರ್ದೇಶನ ನೀಡಿದ ಸರ್ಕಾರದ ಪ್ರಧಾನ ಕಾರ್ಯದರ್ಶಿಗಳಾದ ಶ್ರೀ TK ಅನಿಲ್ ಕುಮಾರ್ ಸರ್ ಅವರಿಗೂ ಸಹ ನಾನು ಸೊಸೈಟಿಯ ಪರವಾಗಿ ಕೃತಜ್ಞತೆಗಳನ್ನು ಸಲ್ಲಿಸುತ್ತೇನೆ ಮತ್ತು ಅವರ ಎಲ್ಲ ನಿರ್ದೇಶನಗಳಿಗೆ ನೀಡಿದ್ದಕ್ಕೆ ನಾವು ಋಣಿಯಾಗಿರುತ್ತೇವೆ. ಅದೇ ಥರ ಈ ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ಭಾಗವಹಿಸಿ ಸ್ವಾಗತ ಭಾಷಣ ಮಾಡಿದ ನಮ್ಮ ಎಲ್ಲರ ಇಲಾಖೆಯ ಮುಖ್ಯಸ್ಥರಾದ ಔಷಧ ನಿಯಂತ್ರಕದ ಶ್ರೀ ಭಾಗೋಜಿ ಖಾನಾಪುರಿ ಅವರಿಗೂ ಸಹ ಸೊಸೈಟಿಯ ಪರವಾಗಿ ಮೆಂಬರ್ ಸೆಕ್ರೆಟರಿಯಾಗಿ ನಾನು ಕೃತಜ್ಞತೆಗಳನ್ನು ಸಲ್ಲಿಸುತ್ತೇನೆ. ಈ ಇನಾಗ್ರಲ್ ಫಂಕ್ಷನ್ನ ಮುಖ್ಯ ಬಿಂದುವಾದ ಈ ಕಾರ್ಯಕ್ರಮದ ಮಾಡ್ಯುಲೇಟರ್ ಆದ ಶ್ರೀ ಭಾಸ್ಕರ್ ಅವರು ಮತ್ತು ವೆಂಕಟೇಶ್ ಅವರು ಬಹಳಷ್ಟು ಕಷ್ಟಪಟ್ಟು ಈ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಒಂದು ಅಂತಿಮ ರೂಪ ತರೋದರಲ್ಲಿ ಯಶಸ್ವಿ ಮಾಡಿದರೆ ಅವರಿಗೂ ಸಹ ನಾನು ಕೃತಜ್ಞತೆಗಳನ್ನು ಸಲ್ಲಿಸುತ್ತೇನೆ. ಈ ಕಾರ್ಯಕ್ರಮದ ಕೇಂದ್ರ ಬಿಂದು ಒಂದು ಕನ್ಸ್ಯೂಮರ್ಗೆ ಬೇಕಾದಂಥ ಏನು ಫೆಸಿಲಿಟಿ ಬೇಕಿತ್ತು ಏನಿಲ್ಲ ಅಂತನ್ನೋದೊಂದು ಏನು ನಾವೆಲ್ಲಿ ಏನು ಮಾಡಬೇಕಾಗಿತ್ತು ಎಲ್ಲಿ ಅವರಿಗೆ ಮಾಡಲಿಕ್ಕಾಗಿಲ್ಲ ಅಂತ ಅನ್ನೋದೊಂದು ಗಮನ ಸೆಳೆದ ಶ್ರೀ YG ಮುರಳೀಧರ್ ಮ್ಯಾನೇಜಿಂಗ್ ಟ್ರಸ್ಟಿ ಕನ್ಸ್ಯೂಮರ್ ರೈಟ್ಸ್ ಎಜುಕೇಷನ್ ಆ್ಯಂಡ್ ಅವೇರ್ನೆಸ್ ರವರಿಗೂ ಸಹ ಇಲಾಖೆಯ ಪರವಾಗಿ ಮತ್ತು PMRU ಸೊಸೈಟಿಯ ಪರವಾಗಿ ಧನ್ಯವಾದಗಳನ್ನು ಸಲ್ಲಿಸುತ್ತಾ ಕೃತಜ್ಞತೆಗಳನ್ನು ಸಲ್ಲಿಸುತ್ತೇನೆ. ಅದೇ ಥರ ಈ ಅಫೋರ್ಡಬಿಲಿಟಿ ಮತ್ತು ಅವೈಲೇಬಿಲಿಟಿ ಆಫ್ ಡ್ರಗ್ಸ್ನಲ್ಲಿ ಮ್ಯಾನುಫ್ಯಾಕ್ಚರರ್ಸ್ದು ಎಷ್ಟು ಪಾತ್ರ ಇದೆ ಅನ್ನೋದು ಬಗ್ಗೆ ಶ್ರೀ ಹರೀಶ್ ಜೈನ್ ಅಧ್ಯಕ್ಷರು KDPMA ಅವರು ಬಹಳ ವಿಸ್ತೃತವಾಗಿ ದೇಶದ ಪರಿಸ್ಥಿತಿ, ರಾಜ್ಯದ ಪರಿಸ್ಥಿತಿ, ಗ್ಲೋಬಲ್ ಆಗಿ ಯಾವ ಥರ ಡೀಲ್ ಮಾಡ್ತಾ ಇದ್ದಾವೆ, ಅದರ ಬಗ್ಗೆ ಏನೇನು ತೊಂದರೆ ಇದೆ, ಯಾವ ರೀತಿ ಜನರಿಕ್ ಔಷಧಿಗಳಲ್ಲಿ ಹೆಚ್ಚು ಕಡಿಮೆ ಆಗ್ತಾ ಇದೆ, ಯಾವ ರೀತಿ ನಾವು ರೇಟ್ ಕಂಪೇರ್ ಮಾಡ್ಲಿಕ್ಕಾಗ್ತಿಲ್ಲ, PARA-19 ಬಗ್ಗೆ ಯುವಕ್ ಮಾಡೋಕ್ಕೆ ಕೋರಿಕೊಂಡಿದ್ದ ಅವರೆಲ್ಲ ಸಲಹೆಗಳನ್ನು ನಾವು ನೋಟ್ ಮಾಡ್ಕೊಂಡಿದ್ದೇವೆ. ಸೊ ಅವರು ಈ ಕಾರ್ಯಕ್ರಮದ ಭಾಗವಹಿಸಿ ತಯಾರಕರ ಪರವಾಗಿ ಅವ್ರದ್ದು ಅಹವಾಲುಗಳೇನಿದೆ ಮತ್ತು ಅವರ ಅನಿಸಿಕೆಗಳು ಏನಿದೆ, ಅವರು ಏನು ಕಷ್ಟಪಟ್ಟಿದ್ದಾರೆ ಇದಕ್ಕೆ ಅನ್ನೋದಕ್ಕೆ ತಿಳಿಸಿದ್ದಕ್ಕೆ ನಾನು PMRU ಸೊಸೈಟಿ ಪರವಾಗಿ ಮತ್ತು ಔಷಧ ನಿಯಂತ್ರಣ ಪರವಾಗಿ ಸರ್ಕಾರದ ಪರವಾಗಿ ಕೇಂದ್ರ ಸರ್ಕಾರದ ಪರವಾಗಿಯೂ ಸಹ ನಾನು ಕೃತಜ್ಞತೆಗಳನ್ನು ಸಲ್ಲಿಸುತ್ತೇನೆ. ದಯವಿಟ್ಟು ಚಪ್ಪಾಳೆ ತಟ್ಟಿ, ಇಲ್ಲೇ ಇದ್ದಾರೆ ಅವರು. ಅದೇ ಸರ, ನಮ್ಮ ಔಷಧ ತಯಾರಕ್ಕೆ ಮಾಡೋದು ಎಷ್ಟು ಮುಖ್ಯ ಇದೆ, ಅದನ್ನು ಬರೆಯೋದನ್ನು ಅಷ್ಟೇ ಮುಖ್ಯ ಇದೆ, ಅದನ್ನು ಉಪಯೋಗಿಸ್ಲಿಕ್ಕೆ ಅನುವು ಮಾಡಿಕೊಡೋದನ್ನು ಅಷ್ಟೇ ಮುಖ್ಯ ಇದೆ. ಈ ನಿಟ್ಟಿನಲ್ಲಿ ಪ್ರೈವೇಟ್ ನರ್ಸಿಂಗ್ ಹೋಮ್, ಪ್ರೈವೇಟ್ ಹಾಸ್ಪಿಟಲ್ ಆ್ಯಂಡ್ ನರ್ಸಿಂಗ್ ಹೋಮ್ ಅಸೋಸಿಯೇಷನ್ ಅಧ್ಯಕ್ಷರಾದ ಡಾಕ್ಟರ್ ಪ್ರಸನ್ನ HM ಅವರು ಬಹಳ ಸೊಗಸಾಗಿ ತಮ್ಮ ಒಂದು ಸ್ಲೈಡ್ಸ್ ಪ್ರೆಸೆಂಟೇಷನ್ನಲ್ಲಿ ಎಲ್ಲಿ ಏನಿದೆ, ಯಾವ ರೀತಿ ಡಾಕ್ಟರ್ಸ್ಗಳು ಯಾಕೆ ಜನರಿಗೆ ಬರೆದಿಲ್ಲ, ಯಾಕೆ ಬರೆದಿದ್ದಾರೆ, ಓಬಿಯಸ್ ರೀಸನ್ಸ್ ಏನೇನಿದೆ ಅಂತ ಅನ್ನೋದು ಓಪನ್ ಆಗಿ ಮಾತಾಡಿದ್ದಕ್ಕೆ ನಾವು ನಿಜವಾಗಿಯೂ PMRU ಸೊಸೈಟಿ ಪರವಾಗಿ ಅವರಿಗೆ ಧನ್ಯವಾದಗಳನ್ನು ಸಲ್ಲಿಸುತ್ತೇನೆ, ಕೃತಜ್ಞತೆಗಳನ್ನು ಸಲ್ಲಿಸುತ್ತೇನೆ ಅವರಿಗೆ. ಅದೇ ಥರ ಡಾಕ್ಟರ್ ಸಲಾವುದ್ದೀನ್ ಅವರು ವಾಟ್ ಆರ್ ದ ಗ್ಯಾಪ್ಸ್ ಇನ್ ಎಜುಕೇಷನ್ ಸಿಸ್ಟಮ್ನಲ್ಲಿ, R&D ಯಾಕೆ ಆಗ್ತಾ ಇಲ್ಲ, ವಾಟ್ ಆರ್ ದ ಅಕಾಡೆಮಿಯಾ ಇಂಡಸ್ಟ್ರಿ ಯಾಕೆ ಡೆವಲಪ್ ಆಗಿಲ್ಲ ಅನ್ನೋದು ಬಹಳ ಚೆನ್ನಾಗಿ ಹೇಳಿದ್ದಾರೆ ಅವರು. ಐ ಫೀಲ್ he has searched several literature ಅಂತ ಅನಿಸುತ್ತೆ ನನ್ನ ಸಮಯಕ್ಕೆ. He has really worked hard and he has made a bigger presentation and it is an ಒಂಥರ lightning effect on the for us to address such those gaps especially. So where we are not in a position to coordinate with them for initiation of the R&D activity in the ಇದರಲ್ಲಿ ಅವರು ಓಪನ್ ಆಗಿ ಔಟ್ ಆಫ್ ಬಾಕ್ಸ್ ಆಗಿ ಹೇಳಿದ್ದಾರೆ. ಅವರು ಸಬ್ಜೆಕ್ಟಿಗೆ ತಕ್ಕಂತೆ ಚೆನ್ನಾಗಿ ಹೇಳಿದ್ದಾರೆ. ಅವರಿಗೆ ನಮ್ಮ ಇಲಾಖೆ ಪರವಾಗಿ ನಾನು ಕೃತಜ್ಞತೆಗಳನ್ನು ಸಲ್ಲಿಸುತ್ತೇನೆ. ಸೊ ಅದೇ ಥರ ಈ ರೂಲ್ ಆಫ್ ಸೊಸೈಟಿ ಆ್ಯಂಡ್ NGOs ಬಗ್ಗೆ ಡಾಕ್ಟರ್ ಸೋಮಶೇಖರ್ VG ಮ್ಯಾನೇಜಿಂಗ್ ಡ್ರಗ್ ಶಕ್ತಿ ಅವರು ಹಿಂದೆ ನಮ್ಮ ಇಲಾಖೆಯಲ್ಲಿ ಯಾವ ಥರ ಸಾರ್ವಜನಿಕರ ಕನ್ಸ್ಯೂಮರ್ಸ್ ಇನ್ವಾಲ್ವ್ ಮಾಡ್ಕೊಂಡು ಕೆಲಸ ಮಾಡ್ತಿದ್ವಿ ಅನ್ನೋದ್ರ ಬಗ್ಗೆ, ಹಾಗೆ ಈಗ ಯಾವ ಥರ ಮಾಡ್ತಾ ಇದ್ದೀವಿ, ಅವರನ್ನು ಯಾವ ಥರ ನಾವು ಉಪಯೋಗಿಸ್ಬೇಕಂತ ಅನ್ನೋದ್ರ ಬಗ್ಗೆ ಸಹ ಅವರು ಚೆನ್ನಾಗಿ ಹೇಳಿದ್ದಾರೆ. ಅವರು ತೋರಿಸಿದ ಮನೋಭಾವ, ಅವರು ತೋರಿಸಿದ ಒಂದು ಆಸಕ್ತಿ, ಪ್ರೊಯೆಕ್ಟಿವ್ನೆಸ್ ಪರಿಗಣಿಸಿ ಸೊ ಅವರು ನಾವು ಇಲಾಖೆ ಪರವಾಗಿ ಇವತ್ತು PMRU ಸೊಸೈಟಿಯಲ್ಲಿ ಅವರ ಒಂದು ಪಾತ್ರವನ್ನು ಪರಿಗಣಿಸಿ ಮುಂದಿನ ನಮ್ಮ ಕಾರ್ಯಕ್ರಮಗಳಲ್ಲಿ ಅವರಿಗೆ ಅವರನ್ನು ಇನ್ವಾಲ್ವ್ ಮಾಡಿಕೊಳ್ಳುತ್ತೀವಿ ಅಂತ ಹೇಳುತ್ತಾ ಅವರು ಈ ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ಭಾಗವಹಿಸಿ ಅವರು ಬಹಳಷ್ಟು ತಮ್ಮ ಅನಿಸಿಕೆಗಳನ್ನು ತಿಳಿಸಿದ್ದಕ್ಕೆ ನಾನು ಧನ್ಯವಾದಗಳನ್ನು ಸಲ್ಲಿಸುತ್ತೇನೆ. ಅದೇ ಥರ ನಾನು ಅವತ್ತ ಆಯುಧ ಪೂಜೆ ದಿನ ನನಗೆ NPP ಅವರು PMRU ಸೊಸೈಟಿಯಿಂದ ನೀವು ಅಫೋರ್ಡಬಿಲಿಟಿ ಆ್ಯಂಡ್ ಅವೈಲೇಬಿಲಿಟಿ ಬಗ್ಗೆ ನೀವು ಏನು ಮಾಡ್ತೀರಿ ಅಂತ ಹೇಳಿ ಆಲ್ ಡ್ರಗ್ಸ್ ಕಂಟ್ರೋಲರ್ಸ್ ಎಲ್ಲರಿಗೂ ಕೇಳಿದರು. ಆ ಟೈಮ್ನಲ್ಲಿ ಕರ್ನಾಟಕದಿಂದ ನಾನು ಪ್ರೆಸೆಂಟ್ ಮಾಡಿದ್ದೆ. ಸೊ ಆವತ್ತಿನ ದಿನ ಸೊ ಅವರು ನಾವು ಪೋಸ್ಟರ್ ಅನಿಸ್ತೀವಿ, ಒಬ್ಬರು ಇದು ಮಾಡ್ತೀವಿ ಅದು ಮಾಡ್ತೀವಿ ಅಂತ ಹೇಳಿದರು. ಕೊನೆಗೆ ವಾಟ್ ಈಸ್ ಯುವರ್ ಕರ್ನಾಟಕ ರೂಲ್ ಅಂತ ಕೇಳಿದರು. ಆವತ್ತಿನ ದಿನ ನಾನು ಎಕ್ಸ್ಪ್ರೆಸ್ಡ್ ಸೊ ವಿ ವಿಲ್ ಡೂ ಎನ್ ಹೈಬ್ರಿಡ್ ವೇ ಆಫ್ ಅಡ್ರೆಸ್ಸಿಂಗ್ ದ affordability and availability of essential medicines ಗೆ we will have an physical as well as virtual anta. So ಆಮೇಲೆ we will also have an quiz activity and we will also issue participation certificates. Our aim is not only get appreciation, we need to have an feedback on that, whether we have done any mistakes. If you have done any mistakes, how to correct it out. ಈಗ ಯಾರೋ ಹೇಳಿದ್ರು ಅವರು ರಾಘವೇಂದ್ರ ಅಂತ ಹೇಳಿ, he expressed his genuineness. We must appreciate him. We must encourage him. We need to address here. We are not here to take only appreciation from the audience here. Our aim is to address the issues. ಯಾರ್ಯಾರಿಗೆ ಏನೇನಿದೆ ಅವ್ರದ್ದೆಲ್ಲ ಆ ಥರದ್ದು ನಿಜವಾಗಿಯೂ ನನಗೆ ಭಾಳ ಖುಷಿ ಆಯ್ತು. ಅಟ್ಲೀಸ್ಟ್ ಒಬ್ಬರು ಹೇಳಿದಾರಲ್ಲ ಈ ಥರ ಒಂದು ಇದಕ್ಕೆ ಜನ ಔಷಧ ನಮ್ಮ ಬೇರೆ ಅಂಗಡಿಗಳಲ್ಲಿ ಮಾರಲಿಕ್ಕೆ ಅನುವು ಮಾಡಿಕೊಡಿ ಅಂತ. ಗೌರ್ಮೆಂಟ್ ಪಾಲಿಸಿ ಇಟ್ ಸೆಲ್ಫ್ ಈಸ್ ಟು ಮೇಕ್ ಅಫೋರ್ಡಬಲ್ ಡ್ರಗ್ಸ್ ಟು ಅವೈಲೇಬಲ್ ಟು ದ ಪಬ್ಲಿಕ್. We need to make it out. What he has asked is rights. And as a licensed dealer, if he is asking, we need to make it out. It's a matter of gap. How much quantity we are manufacturing, how much quantity we are making availability. We need to balance between. ಈಗ ಒಮ್ಮೆಲೆಗೆ ನಮಗೆ ಪೇಷಂಟ್ ಹೆಚ್ಚಾದಾಗ ರೆಮಿಡಿಸಿವಿರ್ ಎಲ್ಲರಿಗೂ ಕೊಡಿ ಅಂತ ಕೊಡ್ಲಿಕ್ಕೆ ಆಗಲಿಲ್ಲ. ವಿ ಮೇಡ್ ಎ ರೇಷನ್ ವೈಸ್. ವೆದರ್ ದಟ್ ಕ್ಯಾನ್ ಬಿ ಡನ್, All those things, a policy has to be made it out. It's a new policy has to come out from the BPPIL that we will pressurize them to put into the place. So ಈ ಇದರಲ್ಲಿ ಬಹಳಷ್ಟು ಜನ ಕೆಮಿಸ್ಟ್ ಆಗಿರ್ಬೋದು, ಯಾರು ಅಕಾಡೆಮಿಷಿಯನ್ಸ್ ಆಗಿರ್ಬೋದು, ಆನ್ಲೈನ್ನಲ್ಲಿ ಎಲ್ಲದರಲ್ಲಿ ಭಾಗವಹಿಸಿದ ಅವರೆಲ್ಲರಿಗೂ ನಾನು ಇಲಾಖೆ ಪರವಾಗಿ ಕೃತಜ್ಞತೆಗಳು ಸಲ್ಲಿಸುತ್ತೇನೆ. ಸೊ ಒಂದು ಸೆಕೆಂಡ್, ಇದರಲ್ಲಿ ನನಗೆ ಸ್ವಲ್ಪ ಮಿಸ್ ಆಯಿತು. ಸೊ ಈ ಪ್ರೋಗ್ರಾಮ್ ಮಾಡಬೇಕಾದ್ರೆ 14ನೇ ತಾರೀಕು ದಿನ ಸೊ ನಾ ಫಸ್ಟು ಏನು ಮಾಡಬೇಕಂತ ಹೇಳಿ ಸಾಹೇಬರಿಗೆ ಫೋನ್ ಹಚ್ಚಿದೆ. ಅವರು ಯಾವಾಗ ಮಾಡಬೇಕಂತ ಮಾಡಿದ್ರಿ. ಸೊ 24th ಮಾಡೋಣ, ಸಂಡೇ ಆಗ್ತದೆ. ಇಲ್ಲ ಬೇಡ ಸೊ 28th ಮಾಡೋಣ ಅಂತ. ಇಮಿಡಿಯೇಟ್ಲಿ ನಾನು ನೆಕ್ಸ್ಟು ಸುನಿಲ್ ಸರ್ ಅವರಿಗೆ ಫೋನ್ ಮಾಡಿದೆ. ಸುನಿಲ್ ಅವ್ರು ಹೇಳಿದರು, ಸೊ ಯು ಡೋಂಟ್ ವರಿ ಸರ್, ವಿ ವಿಲ್ ಮ್ಯಾನೇಜ್, ಬಿಕಾಸ್ ನಮ್ಮ ಗೌರ್ಮೆಂಟ್ನಲ್ಲಿ ಸ್ವಲ್ಪ IT ಅಂದರೆ ಅಲರ್ಜಿ. ಸೊ ಇದು ಒಳ್ಳೆ ಇದರಲ್ಲಿ ಬಿದ್ದುಬಿಟ್ಟಿವಲ್ಲಪ್ಪ ನಾವು. ಎಲ್ಲಿ ಆನ್ಲೈನ್ ಮಾಡೋದು, ಸರ್ಟಿಫಿಕೇಟ್ ಕೊಡೋದು, ಫೀಡ್ಬ್ಯಾಕ್ ತೊಗೊಳೋದು. ಇಮಿಡಿಯೇಟ್ಲಿ ನನಗೆ ಒಂದೇ ಒಂದು ಫ್ಲ್ಯಾಶ್ ಆದದ್ದು ಸುನಿಲ್ ಚಿಪ್ಲಾಂಕರ್ ಅವರು. ಸೊ ಅಟ್ಲೀಸ್ಟ್ ಸುನಿಲ್ ಸರ್ಗೆ ಹೇಳಿದರೆ, ಸುನಿಲ್ ಅವರಿಗೆ ಹೇಳಿದರೆ ವಿ ಕುಡ್ ಏಬಲ್ ಟು ಮೇಕ್ ಇಟ್ ಔಟ್ ಅಂತ. ಐ ರಿಯಲಿ ಸುನಿಲ್ ಸರ್ ಅವರು PMUR ಮೆಂಬರ್ ಇದ್ದಾರೆ. ಈ ಈಸ್ ಎ ಮೆಂಬರ್ ಆಫ್ ದ ಸೊಸೈಟಿ. ಈ ಈಸ್ ಡೂಯಿಂಗ್ ಅಪಾರ್ಟ್ ಫ್ರಮ್ ದಟ್ ಈ ಹಿಮ್ಸೆಲ್ಫ್ ಹ್ಯಾಸ್ ಇನ್ವಾಲ್ವ್ ಮೋರ್ ದೆನ್ ದಿಸ್ ಇನ್ ದಿಸ್ ಥಿಂಗ್. ಈ ಸೊಸೈಟಿ ಪರವಾಗಿ ಸುನಿಲ್ ಸರ್ಗೆ ಮತ್ತು ಸುನಿಲ್ ಚಿಪ್ಲಾಂಕರ್ ಅವರಿಗೆ ಇಬ್ಬರಿಗೂ ಇಲಾಖೆಯ ಪರವಾಗಿ ಮತ್ತು ಸೊಸೈಟಿಯ ಪರವಾಗಿ ಕೃತಜ್ಞತೆಗಳನ್ನು ಸಲ್ಲಿಸುತ್ತೇವೆ. ಅದೇ ಥರ ದ ಡೇ 1 the day when we took this decision, ನಾನು ನೆಕ್ಸ್ಟು 15th ವಾಸ್ ಹಾಲಿಡೇ, 16th I SMS ವಾಟ್ಸಪ್ನಲ್ಲಿ ಎಲ್ಲ ಆಫೀಸರ್ಸ್ಗಳಿಗೆ DDC ಅವರಿಗೆ ನಾನು ಚೇಂಬರಿಗೆ ಬನ್ನಿ, ವಿ ವಾಂಟೆಡ್ ಟು ಡಿಸ್ಕಸ್ ವಿತ್ ದಿಸ್ ಇರ್ತದೆ. ಅವಾಗೆ ಕೆಂಪಾಯ ಸುರೇಶ್ ಅವರು, ನಜೀರ್ ಅಹ್ಮದ್, ಗೋಣಿ ಅವರು 4-5 ಜನ ಸೇರ್ಕೊಂಡು ವಿ ಸ್ಟಾರ್ಟೆಡ್ ಟು ಮೇಕ್ ಔಟ್. ಸೊ ವಾಟ್ ಕುಡ್ ಬಿ ಅವರ್ ಪ್ಲಾನ್ ಆಫ್ ಆಕ್ಷನ್ ಅಂತ, ಹೌ ಟು ವಿ ಹ್ಯಾವ್ ಟು ಡಿರೈವ್ ಎ ಸಬ್ಜೆಕ್ಟ್ ಅಂತ. I feel we have derived a good subject which will be able to address we have taken all ಇದರಲ್ಲಿ ಇವರೆಲ್ಲರೂ ಸೇರಿ we made this activity. I am really thankful to ಒಂದು ಕೆಂಪಾಯ ಸುರೇಶ್, then ನಜೀರ್ ಅಹ್ಮದ್, then ಗೋಣಿ ಪಕ್ಕಿರಪ್ಪ, ರೇಣುಕಾ ಸ್ವಾಮಿ ಅವರೆಲ್ಲರೂ 4-5 ದಿನ ಅವತ್ತ we made a draft invitation card and thereafter we put it for approval. Then same day we ಕೆಂಪಾಯ ಸುರೇಶ್ ನಾವು ಪ್ರಿನ್ಸಿಪಲ್ ಸೆಕ್ರೆಟರಿ ಹೋಗಿ ರಿಕ್ವೆಸ್ಟ್ ಮಾಡಿದ್ವಿ, ಈ ಥರ ಮಾಡ್ತಾ ಇದ್ದೀವಿ ಅಂತ. ಸೊ ಅವರು ಇಟ್ಸ್ ಓಕೆ, ಆನ್ಲೈನ್ ಇದ್ರೆ ನಾನು ಬರ್ತೀನಿ ಅಂತ ಹೇಳಿದ್ರು. ರಿಯಲಿ ಇಟ್ಸ್ ಅವರ್ ಗ್ರೇಟ್ನೆಸ್ ದಟ್ ಈ ಕುಡ್ ಏಬಲ್ ಟು ಅಟೆಂಡ್ ಇಟ್ ಬಿಕಾಸ್ ಆಫ್ ಸೋ ಮಚ್ ಆಫ್ ವರ್ಕ್ ಲೋಡ್. ಸೊ ಈ ನಾವು we call it as a peace time, there is no peace for us. We need to work it for anticipated activities. That way all government officers are working now. So ಇಂಥ ಇದರಲ್ಲಿ ಸರ್ ಅವರೆಲ್ಲ ನಮ್ಮ ಕಲೀಗ್ಸ್ಗಳು ಎಲ್ಲರೂ ಸೇರಿ ಏನು ಇವತ್ತು ಇದು ಮಾಡಿದ್ದಾರೆ, ಅವರೆಲ್ಲರಿಗೂ ನಾನು ಕೃತಜ್ಞನಾಗಿರ್ತೇನೆ. ಆಸ್ ಎ ಮೆಂಬರ್ ಸೆಕ್ರೆಟರಿ ಐ ಆಮ್ ರಿಯಲಿ ಥ್ಯಾಂಕ್ಫುಲ್ ಫಾರ್ ದೆಮ್. ಸೊ ಈ ಒನ್ ಥಿಂಗ್, ಸೊ ಅಪಾರ್ಟ್ ಫ್ರಮ್ ದಿಸ್ ಈ ನಮ್ಮ ಇಲಾಖೆಯ ಎಲ್ಲ ಅಧಿಕಾರಿಗಳಿಗೆ ಈ ಆನ್ಲೈನ್ ಮೂಲಕ ಪಾರ್ಟಿಸಿಪೇಟ್ ಆಗೋದಕ್ಕೆ ಭಾಸ್ಕರ್ ಅವರು, ನಜೀರ್ ಅಹ್ಮದ್ ಅವರು, ಕೆಂಪಯ್ಯ ಅವರು, ಆಲ್ DDCs proactively they have called them. At the same time ನಾ ರಮೇಶ್ ಅವರಿಗೆ ಮ್ಯಾನುಫ್ಯಾಕ್ಚರಿಂಗ್ ಇದಕ್ಕೆ ಹೇಳಿದೆ. ಸೊ immediately he coordinated. Today I could able to see that all manufacturers here, I am thankful to all manufacturers the way they have attended here, and I am thankful to Mr. Ramesh the way he coordinated. They came here and that is the respect they have shown to us. One thing is, it is an win-win policy. It is an, see, at least now they could able to know that how government is thinking. It is not that somebody questions, we don't go back, we answer them, we address them. See, we need to address, if somebody is it is not only from the retail side, sales side or distribution side. If anybody is having manufacturer side also, we will address it. There is not any problem in that. We are here to address it. If it is not possible, tomorrow we will address it. That was this thing. So ಇದರಲ್ಲಿ ಈ ಸಭಾಂಗಣದಲ್ಲಿರೋ ಎಲ್ಲ ಆಹ್ವಾನಿತರು, ಮಾಧ್ಯಮ ಮಿತ್ರರು, ಆನ್ಲೈನ್ನಲ್ಲಿ ಪಾರ್ಟಿಸಿಪೇಟ್ ಮಾಡಿದ ಎಲ್ಲರೂ, ಇಟ್ ಮೇ ಬಿ NGO ಇರ್ಬೋದು, ಇಟ್ ಮೇ ಬಿ ಕನ್ಸ್ಯೂಮರ್ ಅಸೋಸಿಯೇಷನ್ ಇರ್ಬೋದು, ಇಟ್ ಮೇ ಬಿ RTI ಎಕ್ಸ್ಟಿವಿಟಿ ಇರ್ಬೋದು, ಕಾಲೇಜ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ದವ್ರು ಇರ್ಬೋದು, ಕಾಲೇಜ್ ಪ್ರಿನ್ಸಿಪಲ್ಸ್ ಇರ್ಬೋದು, ಕಾಲೇಜ್ ಬೋಧಕರು ಇರ್ಬೋದು, ಕಾಲೇಜ್ ಬೋಧಕೇತರ ಸಿಬ್ಬಂದಿ ಇರ್ಬೋದು, ಸ್ಟೂಡೆಂಟ್ಸ್ ಇರ್ಬೋದು. ಅದೇ ಥರ ಕೆಮಿಸ್ಟ್ ಫೆಟರ್ನಿಟಿಯಲ್ಲಿ ಕೆಮಿಸ್ಟ್ ಅಸೋಸಿಯೇಷನ್ ಎಲ್ಲ ಕೆಮಿಸ್ಟ್ ಅಸೋಸಿಯೇಷನ್ದ ಮೆಂಬರ್ಸ್ಗಳು ತಯಾರಕ ಘಟಕದ ಮೆಂಬರ್ಸ್ಗಳು ಎಲ್ಲರಿಗೂ ಯಾರಿಗಾದರೂ ಹೆಸರು ನಾನು ತೊಗೊಂಡಿದ್ದಿಲ್ಲ ಅಂತಂತಂದರೆ ದಯವಿಟ್ಟು ಅಪಾರ್ಥ ಮಾಡ್ಕೋಬಾರ್ದು. ತಾವೆಲ್ಲರೂ ಈ ಇದರಲ್ಲಿ ಭಾಗಿಯಾದಕ್ಕೆ ಇಲಾಖೆ ಪರವಾಗಿ ಮತ್ತೊಮ್ಮೆ ನಾನು ಎಲ್ಲರಿಗೂ ಧನ್ಯವಾದ ಸಲ್ಲಿಸುವುದು ನನ್ನ ಒಂದು ಮುಗಿಸ್ತೇನೆ. ಥ್ಯಾಂಕ್ ಯು. ಸರ್ ಹೋಣ ಸರ್.
Sir, thank you, sir. Sir, one ನಿಮಿಷ. Thank you, sir. Sir, some of the certificates, our lady officers, important people, ಅವರಿಗೆ ಕೊಡಬೇಕಾಗಿ ತಮ್ಮನ್ನು ಕೇಳ್ಕೊಳ್ತೀನಿ. Sir. Sir. ಬನ್ನಿ. I request ಎಲ್ಲರೂ ಆನ್ಲೈನು ಆಫ್ಲೈನು ಫೀಡ್ಬ್ಯಾಕ್ ಫಾರ್ಮ್ ಇದೆ, ಕೈಂಡ್ಲಿ ಫಿಲ್ ಇಟ್ ಆ್ಯಂಡ್ ಖಂಡಿತ ಸಬ್ಮಿಟ್ ಮಾಡಬೇಕಾಗತ್ತೆ. ದಯಮಾಡಿ ಸಬ್ಮಿಟ್ ಮಾಡಿ.